of an eel with the curiosity of a cat. Episode 5 presents the bunny armadillo, a delightful mix of bunny charm and armadillo protection, captivating our hearts. Episode 6 features the horsefly, a small yet noble creature that buzzes with a blend of horse-like dignity and fly-like agility. Episode 7 explores the reptilian aru, a creature that leaps across the desert with the vigor of a kangaroo and the resilience of a reptile. Our adventure culminates in Episode 8 with the fox crow, a fusion of fox cunning and crow freedom soaring through the forest enigma. Join us on this mesmerizing journey through Beyond Our Reality, a journey to parallel worlds where the marvels of the unknown beckon.
All right. So kicking off our first panel for today, AI in Healthcare Innovation Challenges and Future Directions. I'm pleased to invite Vasuntara Yingpruksawan, the moderator for this panel, who is the Senior Universal Health Coverage Specialist from the ADB. She will introduce our first speaker, who will make welcome remarks, and then we will go into the main panel itself, which is going to be a very hybrid version today. Vasuntara, please.
Thank you very much. Good morning. It's my pleasure to be part of the session today, and welcome to the second day of the new era of digital, envisioning a future of artificial intelligence. So yesterday we had a full sessions that set up the context all the way from AI and development, all the way to the last session on ethical considerations. In this session today, I want to bring you to the series of applications of AI. My name is Vasuntara Yingpruksawan, and I'm part of the Human and Social Development Office sectors groups. And in our SSD team, we have health, social protection, social development, and also education, which are the three themes that we will cover today. So without further ado, I'd like to first invite our Director of Health Practice team, Dr. Ododo Banzon, to give a welcome remarks for the sessions. So as the MC mentioned, our session today would be fully hybrid. Half would be online and half would be in person. Dr. Dodo, the floor is yours.
Thanks, Vas. And I wish I could be there right now. Unfortunately, I'm here right now in Delhi, where we're looking at the priority of the bank, which is climate change and health. So, but allow me now to welcome everyone on looking at the health sector. We just came. I always say that we still post-pandemic world really affected health services, the general population. But the world's response to COVID-19 also showed how important using digital tools, capturing data, and of course, AI, big data, eventually now we're talking about AI, was able to help us not address the pandemic, from ensuring that vaccination can rapidly be provided, helping a lot of our friends from the pharma industry and the private sector develop new vaccines and new medical technologies, allowed and improved the diagnostic capacity of healthcare providers, not just in person, but also online. We saw a rapid growth of a lot of tools, which people call telemed and all of that, all driven by AI. So we had I call it a living proof of how now AI can help improve healthcare. And indeed, the challenge now in a lot of settings is how to get the regulatory frameworks, to get the financing schemes catch up with what's happening. So let us all listen today. I will be listening here from Delhi on the exciting developments we're seeing. I would like to thank the speakers who are here, the panelists, both there in headquarters and of course virtually. Again, welcome and thanks, Vas.
Thank you very much, Dr. Odo. So I'd like just to add 2 points to Dr. Do, what he mentioned, and also the context of how AI is also important in the age of increasing older populations and the link to non-communicable diseases. So the next part, we also like to invite one of our teams, who is health specialist, Dr. Akito Watabe, who will provide some overview of the AI in the ADB projects. Dr. Akito, if you're online, please go ahead.
Good morning, everyone. Thank you, Bas, and everyone. This is Akihito Watabe from the health specialist from the practice team as well. And thank you for can you see my screen? Not yet. So I'm sorry that I also couldn't join the meeting this time in person. I'm also in Bangkok for missions. So for this session, I'd like to start with our technical assistance and setting the tone for this session, and then followed by the panel discussion. Okay. And first of all, thank you for my colleague, Jae Young Kim, also preparing this session together. So in the setting the tone, I'd like to discuss about AI in healthcare and some challenges and also the innovation in the future. And for the achieving universal coverage, we need to improve the efficiency of the health systems. And we believe that there are some way that we can use a digital technology to improve the efficiency, including the behavioral, clinical, and operational challenges. For example, the behavioral inefficiency, we have some sedentary lifestyle, avoidable illness, smoking, and substance abuse, and non-adherence to medications and polypharmacy and doctor shoppings. And in the clinical setting, that also as part of the provider's efficiency, that the treatments, variations, and avoidable hospitalization, and also the admission to the hospitals. And sometimes the doctors over prescribed medicines and treatment errors, part of the human errors, and also defensive medicines to protect the health service on hospital and clinic itself. And a part of the operational inefficiency, including the claim processing, manual pre-approvals, individual underwriting, and manual premium collections or manual data collections analyzing. That's part of the manual arrangement for the payment mechanism in the insurance and health financing. So this is the kind of the overview of the health financing framework that we typically use in health sectors, and the collecting revenue, pooling fund, and then purchasing services from providers, and the provider provide the services to the patients. And we believe that the digital transformation can be used to improve the health financing systems, particularly purchasing services and the provision of services. And in particular, the health insurance schemes, there are many opportunities to use the digital technology to improve the value chains of the health financing and health insurance, such as claim processing and operations and care management and beneficiary management, provider management, and product designs. So there are different ways to improve the efficiency through the processing of the insurance. And also using the data is critical, and not just a single data source, but integrations of the data, interoperability is critical for more sophisticated decision making. So for example, the data integration can be used to understand what is happening in the health sector using the various source of data, such as claim data, to generate reports and discover insights on issues, such as incidents of procedures, cost of cares, and mixed use between the primary and secondary care. And also the prediction of the health services. For example, what is going to happen in the healthcare services using analytics and machine learning as part of the artificial intelligence technology to predict what may occur in the future. And this also included predictions and things like disease trends or utilization management. And finally, that the data can suggest the best course of actions for the future interventions. For example, using analytics to identify the scope of the improvement in the historic approach versus the new course of actions. So as part of the ADB's technical assistance, we have several TAs focused on digital health innovations. One is a service delivery and primary healthcare part that VAS is leading. And then another part is health financing as part of the TA 9967, that we provide the technical assistance in various countries, including Nepal, Bangladesh, Mongolia, Philippines, Armenia, Palau, India, and Indonesia. That's part of the in-country support and capacity building. And also we conducted the innovation challenge to identify some startup company that have an innovative approach on digital health financing, including one company from India, Tipatica. They are AI-based effective automation of the claim processing using the AI technology and the fraud detection. And also Ray from Indonesia, they have an end-to-end health subscription to provide the health promotion and prevention solutions as part of the insurance package. And also we produce several generating knowledge and digital health agenda, and also collaborating with several regional networks, including AIHIN, Asian Network on Digital Health. So in the last few slides before starting the our roundtable discussions, I'd like to cover the AI for healthcare and some advantage, risks, and also potential solutions. So in terms of the advantage, indeed that the artificial intelligence is useful in healthcare. The AI technology enable productive management by focusing disease outbreaks, patient admissions and compliance. And also real-time patient vital tracking is made possible by the AI-powered gadgets, allowing for remote treatment. And also, as I already mentioned, the technology can expedite claim processing and lowering the expenses, and also increase reimbursements and the speeds. And AI can also diagnose patients earlier than with greater accuracy than the traditional approaches, like diagnosed by the doctors and specialized doctors sometimes. And also AI can ensure fraud detection, risk assessment, and cost management and resource optimizations. And finally, the AI can ensure personalized treatments, analyze market trends, and patient behavior. So there are different ways to use the AI technology in healthcare. But also, we notice there are some potential challenges and risks that we need to address. In terms of the data management risks that we observe that some compromise the patient data due to the inadequate security measures by the organizations or the hospitals. That violation may give rise to the significant legal concerns and the also privacy of the patients. And the poor data quality or lack of standardization of the data is inaccurate outputs and decision-making based on the prediction modeling. So the data standardization is necessary for precise analysis and decision-making. And the second, regulatory and ethical risks. For example, data use, patient rights, and need address informed consents, decision-making, and accountability in sensitive situations. An AI system has perpetuate existing biases also that leading to the inequitable outcomes in the decision-making and service delivery. And the third, in terms of the operational risks, that high upfront expenditure to invest associated with the AI technology, and also the infrastructure that will be the significant obstacle, particularly in developing countries. And also there's some challenges in integration of the AI technology into the existing systems that will be also disrupt the workflow in the integration phase. And finally, capacity and trust risks that the training or the capacity building is necessary for using the AI tools for the many health workers and hospital staff that also require time-consuming and potentially resistance from the staff using the AIs. And not just the resistance from health providers, but also the patients may also skeptical about the new technologies, which can be challenging for the adoption into the health services in the health sectors. And finally, so the risk mitigations to address these challenges that we identify 6 potential solutions and mitigation strategies. The first of all, the implement the strong encryption methods that would be useful for data at rest and in transit, and also use strict access management to ensure only authorized personnel can access sensitive data, and also conduct frequent security audits and vulnerability assessments to identify and address potential weaknesses. And second, and stay informed about the evolving regulatory authorities updates using the AI technology in the health system or the government systems. And also design AI tool with user experience in mind, ensuring that they fit seamlessly into the existing workflow. And third, also invest in the training and upskilling programs for healthcare professionals to prepare them for new roles created by the AI integrities. And emphasize AI law is augmented human capabilities instead of replacing the jobs of the health professionals. And the fourth, involve the healthcare providers in the development of AI system to ensure that their needs and concerns are addressed fully in the introduction of the systems, and maintain throughout the documentation of AI algorithms, including their design, training, processing, and decision-making criteria. And also, decision support is critical, that the potential AI as a decision-making support to rather than replacing for the clinical judgments by health professionals, and ensuring the healthcare professionals are actively involved in the patient care itself. And finally, ensuring the AI modelings are trained on diverse and representative data sets to minimize biases for the accurate decision-making and the clinical judgments, and implement ongoing monitoring of AI outcomes to identify and correct any emerging disparities. So these are all potential risks mitigation strategies to address these challenges. So hopefully today's discussion is useful, and also you learn the new technologies and potential risks and solutions from the emerging the areas. And hopefully the session is successful today. And thank you for the opportunity today.
Thank you very much, Akito. And that set not only the landscape of the AI, but also the potential challenges that could be set out the tone for our discussion during the latter part of the session. So we now move on to the next part, which will be a panel discussion and speakers. So since we have a mix of online and in-persons, I might just test the system and see how that can cope with six people in 5 countries. First, I'd like to invite Mr. Hyesung Jung to the stage, please. He's a director of the International Project Division of Health Insurance Review and Assessment Service in the Republic of Korea. So we look forward to hear in this session on the AI utilization at health insurance services, and also in experience and also challenges. Thank you.
Yeah, thank you. Good morning, everyone. My name is Hisang Jung from South Korea. I'm working in HIRA Health Insurance Review and Assessment Service. Thank you for having me to join this fantastic digital conference today. And from now on, let me talk about the HIRA's AI utilization, experiences, and challenges. As its name, HIRA is responsible for operating the Korean public health insurance system by reviewing and assessing the medical services in Korea. Especially the claim review process is the most crucial and the basic business infrastructure of HIRA because through the electronic claim process and system, we could collect the standardized national healthcare data from the hospitals, and standardized data include the patient and healthcare facilities and hospitals information, and the disease code using the ICD-11, the global standard code, and prescription, the drug code using the GS1 as well. Thanks to the electronic claim process and system, we could establish this amazing national healthcare big data infrastructure in Korea. And I can say this is so powerful resource for HIRA to use AI. For the first time for HIRA to use AI, we used the AI, implemented the AI model just for supporting our current business process like review process by implementing the medical image reading models. And after having this kind of experience, we tried to make some prediction model of the chronic disease. And finally, we established our own goal of AI utilization. It is personalized healthcare operating by AI. But it's possible only if we could totally integrate the national healthcare data. For the first trial of the AI utilization in HIRA is implementing the medical image reading models, including the X-ray and MRI and CT. The first job of HIRA of AI utilization is the spine part. There had been serious issue in healthcare sector of Korea about the over-treatment of the spinal surgeries. So we needed to use the AI to monitor and control the spinal surgeries occurred in the Korea. This is the result of the medical image reading models of AI. You can see the notations, the character, a blue color character, and the red color character indicates the compression rate. This kind of notations generated by AI is provided to the medical personnel who is responsible for the review process, so that they can make their judgment and decision and the result of the review process more easily and more precisely. This is so simple but so important job for HIRA because according to the result of the review process, the hospitals can or cannot get their reimbursement. These are the remaining parts of the medical image reading models. Secondly, we implemented the fraudulent claim detecting models with two types. First type is detecting the upcoding case with similar code. The upcoding means that the hospitals claim their medical fee with wrong code. It is similar but more expensive. It's kind of an intentional job. So we implemented the huge hospitals profile based on the claim data and trained the AI model so that the AI can group the facilities and hospitals into three levels of coding likelihood. And the second model of the detecting the fraudulent cases is for the multi-cases like the overclaim for actual usage and the violated claim of actual purchase price. But it's different from the previous one because this is for the on-site investigation operating by HIRA. So that means detected claims and hospitals can be subjected to the on-site investigation process. Lastly, we tried to implement the prediction model of the chronic disease. As you might know, the Korea is going into the aging society so rapidly. So we needed to prevent the chronic disease using the state-of-the-art technology like AI. So in 2022, we implemented the prediction model of metabolic disease. And after that, we implemented the degenerative disease. And we are now on the process of the cancer disease. To implement the prediction model is quite different from the reading and interpretation models. So using the claim data as well, we developed another parameters and the patient 3 million data set using the claim data and tokenized the parameters and trained the model with the kinds of the parameters. In the healthcare sector, the AI is needed to be more accurate and transparent on the highest level because the healthcare sector is quite related to the people's lives. But despite of the national healthcare big data infrastructure, we just have limited data and resources to use AI because actually the claim data in HIRA doesn't include the clinic information from hospital. And we should experience the integration difficulty. I mean the AI models integration with the existing system. And we should experience the black box problem. Yeah, to overcome the challenges, we have been expanding the claim data coverage. I mean the standardized claim format. We are expecting that to collect and to include the clinic information. And we have been using the pseudonymous data method to integrate our healthcare big data with the data from the outside sector, like the financial and mobile. We are trying to migrate our existing systems to the public cloud, but it has a challenge because of the strongest information security law of Korea. So there is some discussion on the government level. And lastly, the black box problem. We consider that issue being faced by all the health technology organizations. Yeah, this concludes my presentation. Thank you for your attention.
Thank you very much, Director Jung. I think this is a really good case study to see how the claim AI could be useful in claim setting, but also the challenges that can be tackled, but also looking forward to how it can apply to other low and middle income countries as well. So I like to follow the order just so that those that join in other time can actually follow correctly. So in the next speaker, I would have it online. So that's Mr. Saurav Bhattacharya. He's from GIZ, and he's a component lead of the Global Initiative on Social Protection, Innovations, and Learning. So Mr. Saurav has worked in Nepal, in particular in led digital health team. And today we will get to hear more information on the Open IMS initiative and the use of AI. Mr. Saurav, if you are online, the floor is yours.
Thank you very much. I hope you can hear me well. Good morning, everyone. Today I'll be speaking to you about the use of AI for claims processing. So we saw a presentation from Hira earlier, and it was fascinating what they have been able to achieve. So we're trying to see if some of that can also be implemented in various countries in low resource settings as well, and we'll be looking at claims processing. And the objective of my presentation for today is to really give you the information on options that you have available to get started with AI in social health protection, focusing on claims processing. So from this session, I hope you can see that it's with a global good such as OpenIMIS, it is possible to get started, and you don't have to start from scratch when you really need to work on claims processing and AI. But before we get into the AI part, allow me to give you a very quick introduction of what OpenIMIS is, which is primarily a software. So it's a digital public good or an open source free software to help digitally transform social protection programs. It has a lot of functionality, and therefore can be used to provide various solutions in social protection, social health protection, or health insurance being a very strong solution from OpenIMIS, but also OpenIMIS can be used for other social protection programs like employment injury insurance, social cash transfers, and we're also now having implementations of voucher schemes, as well as looking into OpenIMIS acting as social registries. The system is built to leverage the ideas around digital public infrastructure, so payments, interoperability with payments, with ID, with exchange as well, and it's based on international standards for interoperability, particularly in the healthcare setting, the HL7 FHIR, and part of the OpenHIE architecture as well. So far, we have more than 15 implementations of OpenIMIS managing various social protection programs in over 12 countries. As you can see on the map, there's more implementations in Africa than in Asia, but the largest implementation that we do have is in Asia, in Nepal, where the National Health Insurance is using OpenIMIS to manage their complete the system for from beneficiary management to claims and data analytics as well. And this isn't possible without various stakeholders working on it as implementers as well. And currently, it's the initiative and it is made possible to run this initiative with funding from the German government, the Swiss government, as well as the European Commission very recently. So that's the basic foundations of what OpenIMIS is. Today, we'll be looking at the social health protection part. And just to give you an idea of what functionality OpenIMIS in general provides. So for the health insurance solution, as I mentioned, with OpenIMIS, you can manage enrollment, service utilization. So when someone, so the verification of someone's insurance, etc. Then claims management, which we will dive into right after this, and then monitoring and reporting. So in claims management, as we saw from the presentation from Hira as well, there are a lot of challenges coming up. Before we had, let's say, AI, or even we can still call this AI. I guess it's not machine learning, but there's a rules-based claims processing. No? So if you look at that chain, so you start with someone submitting a claim, a health facility, then there's a rules engine that checks for certain things that you have pre-configured, things that you know should be checked, and it should be either rejected or passed based on that. So is the policy active? Are the services that have been claimed covered by the policy? Are the services applicable based on certain criteria? Frequency limits, how often could the same service be claimed, etc. So, and those questions can increase, and those were, let's say, pre-AI kind of processing. No, so this is based on what we know, things that we can really quantify. We put it into the rules engine, but then all these claims which pass the rules engine, and suddenly we saw in Nepal, for example, in the largest implementation that we have, that a lot of claims started passing the rules engine, and then the burden to review claims falls into manual evaluation, because there were so many cases that it passes the rules engine, but there's many ifs and buts that need to be managed through manual evaluation, and then it only goes to payment and there's a response. So we saw that there was a big problem in the manual evaluation part of claims. And that was becoming the bottleneck for health facilities getting paid. We were holding back payment because claims weren't being reviewed fast enough. So now in OpenIMIS, to solve that problem, we introduced an AI engine which sits in between the rules engine, which still is there. So the checks that you need, but then now something in between before the manual quality assurance now, but an AI engine that starts automatically classifying based on manual review. And then it starts flagging claims rejected by the AI model, be it for fraudulent or any other activities. And it does it with a machine learning algorithm. No? So it starts categorizing claims, and it does that machine learning from all the previous data that is there from the manual review. So it takes in all the previously reviewed data, develops a model. The model is developed based on that, and then only there is a manual Q&A for quality assurance, and that also feeds back to the AI engine. No? So this drastically reduces the amount of claims that need to go into manual quality assurance, and that's basically it. No? So that's what we developed in OpenIMIS. So basically, if I could, what I wanted to show here is that now this claims module that we have can be used integrated with an OpenIMIS implementation. So for example, in Nepal, it's integrated within an OpenIMIS implementation. So that means if you have OpenIMIS, you implement it. But now we've also made it possible to be interoperable with your insurance MIS, because most likely if you're not using OpenIMIS, you still want to use a Claims AI module. This Claims AI module, so it's HL7 FHIR compliant, and it can interact with various insurance systems that are already there. So as long as you can send in FHIR, standardized FHIR claims or a claim resource to the system, it can use that to train the AI model, and then later for adjudication as well. So you don't need to use all of OpenIMIS that you saw in the previous chain to use the AI model. So we've made it available, of course, and this is also open source. And not only is this open source, but in terms of software, but the machine learning algorithms, all the thinking behind it is also made available. So basically, that means that anyone who is now looking to start off with AI already have a ready to customize, configure, and deployable system. So of course, if you have a project where you want to get this started, you would have to do the work on data preparation, because it's all implementation specific. You know what data is available, what the quality is, and the amount is. So, and you would need to put some effort into preparing the data. But then the AI model development is potentially doesn't need to be developed any further. But if you want to, of course, you can continue to do so. You can use the existing model, so that's no extra effort. But that's already a deployable system, so that you have. So that means that software development you could do, but the modules are ready to use as is. You can download it right now and start using it. And then, of course, if you need to customize it and deploy it, there are some efforts there as well. So this would be, if you look at the chain, the middle half, this is already covered now. And particularly in low resource settings, we believe this will help out because that's a lot of the cost driver to implement AI as well, with the model development, with a lot of resources being required even for software development. So we're really trying to reduce that burden in our partner countries, so that access to technologies like this is readily available. So basically, the claims module, it's all available freely as open source. Of course, you will have these presentations as well, so you can click through. There's links to where the model details are there, so all the design details, the different algorithms that were tried, the test results in terms of what kind of accuracy we're seeing, all of that is available for you to see and then engage with the community. And then you can develop it further. The code is on GitHub. The community is available for support. If you need any help getting started, please feel free to reach out through any of the channels that we have on OpenIMIS, or you can write directly to me as well. Basically, if you do more development on it, we'd be happy to include it in the next releases of OpenIMIS. So we're really taking this as a community effort moving forward. Again, links to the community tools that we have, from chat groups to the demo server for you to see the code repositories. So you'll have access to this when the presentations are shared. But basically, it's a call for joining the community, becoming a part of it, learning about OpenIMIS, implementing, and developing it further, because this is a digital public good. This is not a tool from GIZ or any other company. We're developing this as everyone's tool, and we hope this really helps countries transform digitally, particularly in their health financing models. So with that, I would thank you very much, and looking forward to the discussions with my fellow panelists. Thank you.
Thank you very much, Dr. Saurav, not only to provide us insight into your claim programs, but also the sources, which is, I think it's also quite helpful to actually look into different aspects of the AI. I'd like to now invite Ms. Divya Gupta, who's the Chief Business Officer on Global Health from Cure. She has been extensive experience across medical tech program and strategy consulting. So in this session, we'll hear more about health system strengthening experience with experience on lung health. Please.
Good morning, everyone, and thank you, ADB, for inviting us to share our experiences with all of you. Very often, when we think about AI, we think of it as a technology or a solution which is in development and will change our future. I will spend the next 7-8 minutes focusing on sharing our experience on how it is already changing our present, and how with your, all the resources as well as the influence that the ADB has, it can actually make a very significant impact to health systems globally. So if we start with what this panel, the description said, is can AI improve patient outcomes? I'll take the example of Cure, which is present in more than 90 countries across 2,600 sites and impacting more than 20 million lives globally. Let's start with an example from Philippines. We work with a firm called PBSP, which is looking to basically screen for tuberculosis. As some of you might know, tuberculosis is one of the largest infectious diseases that we are challenged with in Asia, Africa, and many other parts of the world. It has a mortality which is higher than HIV. And the challenge of it is not as prevalent in Western Europe and the US. However, the impact of it is still infectious, so there is no boundaries to it. We were able to screen more than 200,000 patients. This data is from 2022. So in the last 2 years, this has more than doubled. So I just want to show the impact that already we have seen in the past. More than 200,000 patients screened, almost 9,000 cases diagnosed. But I think the most important thing here is that the time to diagnosis has gone from 2 weeks to 1 day. As some of you who are in infectious diseases, you will know this is a significant improvement to reduce the spread, but also to reduce the number of patients who fall out of the treatment regime. A second example from Mumbai, India, where we worked with BMC, 7 government hospitals. We didn't change anything in the infrastructure. The same doctors, the same nurses, the same X-ray machines. The only thing we did was switched on AI. And we saw an increase of 29% incidental TB cases, 13% overall increase in TB notifications. Why is that? These were patients who were coming to these hospitals not in the TB pathway. They were coming to the hospital for any other problem. It could be a fracture, it could be a cough, it could be pneumonia-like symptoms. So they were getting an X-ray in the hospital for any other reason, but not being diagnosed for TB because they were just not in the TB pathway. Switching on AI with the existing infrastructure enabled us to spot the hidden and actually increase the pool that we are actually screening for TB. But can AI drive early detection? So we talked about TB, where it is really about catching patients as fast as you can. But can we even drive early detection in NCDs? So I'll take again the example of lung cancer, which, as again some of you will know, is the largest mortality amongst all cancers. The thing with lung cancer is that if you detect it in stage 1 or stage 2, you can live a completely healthy life for over 10 years with the kind of treatment that mankind has innovated. But if you detect it in stage 3 and stage 4, mortality is almost a given, sometimes even within 12 months. So it's really crucial to detect lung cancer early. There are extensive lung cancer screening programs that are done in Western Europe and the US, all targeted towards people who are smokers and have high risk for lung cancer. But we know that lung cancer does not only impact smokers, but impacts each of us. To make it even more challenging, many parts of Asia as well as Africa do not have lung cancer screening programs as we speak. Interestingly, the same scans that are being taken across the world for TB, like I just shared, also show signs of lung cancer, but they go unmissed. They go completely missed because when you're running a TB program, you're looking just for TB. You're not looking for lung cancer. You're not looking for other diseases. So again, the only thing we did was switched on AI in the same infrastructure setting. This is an example which is from Vietnam, where we screened almost 120,000 patients. This was a pure TB screening program. We switched on AI and were able to find almost 175 potentially malignant nodules in follow-up CTs. These are 170 potential lives which can get saved because of early detection. Similarly, we did a study with the Mersin University, this time for cardiovascular risk, for heart failure. 10,000 patients, not for cardiovascular risk patients. So these are patients who came to the hospital not presenting any cardiovascular signs. They were just in the hospital for any other reason. AI was able to detect about 82 heart failure cases. And the success rate that AI had in predicting that there is going to be a potential heart failure risk was over 86%. Again, these are lives which they would have at some stage realized that they have heart failure as a disease. But by the time they would have realized it, it would have been multiple years and much lower chances of survival and a healthy life. The only difference we made, no change in infrastructure, no change in the hospital setup. The only change was we switched on AI. As patients, we often think that when a doctor is reading our scan, they're reading it holistically. I am not a doctor, but I do know that doctors are very busy and they don't have the time to look for any and every potential risk that is out there. So switching on AI acts as a very big safety net to look for diseases which might go unnoticed. But can AI serve in under resourced regions? I think the pictures are a good example here. The picture on the left is where AI as well as a mobile X-ray is being carried on a boat. Then you see the two gentlemen, they're carrying it on their head to go to a very, very remote community. The third picture is actually two of my colleagues on the Everest Base Camp. We did this expedition in May, where we actually took our AI solution to the Everest Base Camp and scanned all the community as we went, as well as the trekkers when we reached, just to demonstrate that infrastructure is no longer a barrier to utilizing AI. And the last picture, more as a humor, but also reality, is that of one of our clients in Lesotho, where they are running an AI screening program on a horse, because they find that is the simplest way to reach the communities. To add to this, another few examples of nomadic communities where AI has made a significant difference in Nigeria. More than 15,000 people screened, with almost 18,000 patients detected for TB in this case, as well as in Uganda, with significant number of screening across sites and TB detection driven. I want to conclude this session by actually emphasizing that yes, AI can optimize resource utilization to drive health system strengthening. A few years ago, WHO came out with a guideline. They evaluated all the AI out there for tuberculosis specifically, and actually came out with a completely, I would say, game-changing guideline saying that in the absence of a physician, AI can be used for tuberculosis detection. This was a game changer for the field of tuberculosis because suddenly there was an ability to screen for tuberculosis in the remote communities, even where molecular tests were not available. But we can do much more. And you as ADB and all the members of ADB have a significant role here to play. As we see, a simple policy change by WHO had such a significant impact across countries in Asia and Africa. But why stop at only TB? The same community outreach personnel, the same primary healthcare facilities, the same diagnostic tests, and the same population. But we can do multi-disease screening. Why should we stop at only TB when we can do lung nodules, heart failure, hypertension, pneumoconiosis, silicosis, pneumothorax, etc., with the same scan and the same infrastructure? We are creating vertical programs, whereas actually we can utilize AI for health system strengthening holistically. The same platform can be extended into teleconsultation, chatbots, etc. So my strong request to everyone here in ADB is, as you think about policy, as you think about your engagements with countries, please look at AI, not limited to certain disease verticals, but genuinely as a health system strengthening infrastructure uplift. Because as we have demonstrated, this is not something that we need to wait for the future. It is in our present today. Maybe just a short little bit about Cure. So we are present in more than 90 countries and have impacted more than 25 lives. We have a very large presence in Africa and Southeast Asia, Latin America, and the North Americas. We have a large portfolio of regulatory cleared diseases, regulatory cleared AI solutions. All the discussion yesterday of should we regulate AI, I'm glad to say actually that healthcare AI is already very well regulated with the FDA, the CE medical. There are checks and balances placed to ensure that there is safety, data privacy, patient benefits are in prime and center. So I think as Cure, and I'm sure all of our other vendors, this is something which is a given, right? This is paramount. As I mentioned, WHO has also evaluated the solutions. We have solutions for tuberculosis, lung cancer, cardiovascular risk, some cancers, as well as stroke. But I think fundamentally, we believe that AI can really drive health system strengthening, and we would love to have a conversation to be able to enable that. Thank you.
Thank you very much for the presentation. All the examples from Asia to Africa, but also human to horses, which is very interesting. Last but not least, I have the last speaker from Fujifilm, Mr. Masaharu Morita, a founder and program director from Nura. Mr. Morita, if you're online, please join us. He's currently product marketing and new business head of Fujifilm healthcare domain. Please go ahead.
Yeah, very nice to meet you, everyone. Thank you for this giving me the time to present about Fujifilm, what we are doing. So let me introduce. Fujifilm is now 90 years company and toward 100 years old company and a Japanese company. Originally, Fujifilm was a photography company, but we transferred to healthcare company. Now, healthcare is the biggest business portion for Fujifilm Group. And as you know, Fujifilm started photography film from 1934, but on the same time, we started healthcare X-ray film as well. So this two film was very important for Fujifilm Group. So this like a X-ray film, we made originally it's an analog film, but we made digitization by 1983, and we made such small X-ray system, digital system, and become flat panel solution, and it become IT solution, and we are installing everywhere in the world. So this is the core strength of Fujifilm. So this IT is a core, but on the surround of IT, we have X-ray, CT, mammography, endoscopy, ultrasound, MRI, everything. So why not us to utilize this kind of asset by ourselves to create something new? And especially it's a good from Japan. So this was our concept. So Japan is, as you know, maybe you know some ikigai is how to make life enjoyable, joyful longevity. Now Japan is 85 years old life expectancy, and 65 years old plus people is more than 30%. So this joyful longevity is supported by Japanese government. Definitely, we are very much controlled healthcare. So cancer is very much treatable now because we can find at the very early stage of the cancer with annual health checkup, and also lifestyle also control to reduce the weight, reduce diabetic risk and heart attack risk, etc. So this is very important preventive culture from Japan. So I wanted to create this kind of preventive culture in the world, especially in developing countries. So that's why we opened Nura Health Screening Center in India first. So we opened 2021 in Bangalore, and after that, Delhi and Mumbai and Hyderabad. And now we are opening in Chennai and Ahmedabad and Pune, etc. On the same time, we open in for example, Mongolia in Ulaanbaatar. Last year, we opened in a big center and a tremendous success. So we opened second center by last August, and we got peace medal from Mongolian president. And now, recently we opened in Vietnam, and now preparing Malaysia, Philippines, etc., and the UAE, Saudi, Uzbekistan, Kazakhstan. So we are trying to go everywhere to create such good preventive health culture. So what kind of service we are providing exactly is a cutting-edge technology and world-class service. So this is the concept of Neura. The omotenashi kind of service, because you are guest for us. It's not sick people. Healthy people will come to annual health checkup to be confirmed by yourself, I'm healthy. So it should be in good environment, in a 5-star kind of environment. And 10 cancer and 20 lifestyle disease, we can check up. And full body CT with ultra low dose safe CT can cover up all the body. And we can explain everything by imaging basis after screening immediately. So how we can make it just such much fast screening program? Actually, we are utilizing AI, and Fujifilm has AI brand is Lady. After the scan, mammography and CT, etc., Lady start to pick up all abnormality and pass to the teleradiology doctor, specialty doctor, and the specialty doctor make a report. And then our GP on site will explain everything by imaging basis. This is all process only 120 minutes. So of course, AI is a tremendous a technology support role they are taking. So white and black image can be this kind of like organ recognition by himself. So we can pick up all abnormality, and once confirmed, the doctor report also will be generated by AI. So this technology-driven service, it's making. And the CT is originally, it's like a high radiation equipment, so it's everybody a bit afraid. But we could make a 97% reduction radiation, which means only 3% of radiation we are using. For example, is a normal CT for lung and heart and abdomen required around 25 millisievert, but we use only 0.8 millisievert, so 3%. For example, normal chest X-ray and abdomen X-ray required around 1 millisievert, or it's like what we are getting like natural radiation from the space around 410 annually. So we could reduce 0.8 millisievert, which is ignorably safe. So this is one of the technology advantage. Little bit talk about clinical things. This is cause of death in the world at average. And cardiovascular disease, heart attack is the #1 killer. #2 killer is cancer. Inside of the cancer, is lung cancer is the biggest killer. So basically, lung and heart is a killer disease. So how to tackle this area? For example, we made the imaging basis analytics. For example, like a heart attack, once coronary disease block, then heart attack happen. Inside of this block, yes, we can recognize calcium and we can make image. If no calcium, very safe heart. If heavy calcified heart, it's very risky to take a heart attack. If more than 300 calcium, it's many people get a heart attack. But if zero calcium, it's none. For example, in India, we recognize 80% of people has zero calcium, no problem, but 20% people has calcified heart. And especially 10% to 5% of people is very heavy calcified. Anytime he can get a heart attack. So we recommend them to go hospital, then to take an angiogram. If find a blockage, we recommend them to put a stent and a balloon and to avoid the heart attack itself. Because once get a heart attack, it's a 50% of people dead in the house before reach hospital, and 50% of people can survive. But we shouldn't take this kind of risk. So preventive action is very important. So this is what we are doing. For example, lung cancer also is a killer disease. Unfortunately, mortality rate is very high. For example, developing countries such as India, is survival rate is only 3% or 4%. In Japan is the highest only, but 33% only. So it's not like enough, because X-ray is sometimes very difficult to find such small cancer. For example, 10 of 10 of doctor couldn't find this kind of small cancer, but yes, CT can be found. So with this CT lung cancer screening, survival rate become 80% or more. So this is globally recognized. So that's why this is what we are doing, CT and AI based. For example, this is like from National Cancer Institute from Japan. It's a breast cancer. If we can find at early stage, 99% of people can survive, but if later stage, 33%. So basically, it's like all developing countries survival rate from cancer is around 20 to 30% basically, but our mission to push up to 90%. So this is what we are doing. So we welcome the as guest relation executive and to explain everything to our guest, and the changing the clothes, and once take a blood sample, in a 1 hour time, blood analytics will come. So meanwhile, eye test and hearing test, ECG, and full body composition, bone mineral density by CT, lung and heart and abdomen, the kidney, liver, pancreatics, and for breast cancer and cervical cancer. Once changing clothes, and then doctor is waiting and explain by imaging basis of report, and we give the paper as well. So this is the whole program of Neura. Report also very easy. Each organ A, B, C, D. A is good, D is bad, B, C need to be careful. And compared to last year, become better or not is very easy to understand. And once click the QR code, image will be appeared. And cancer, this kind of cancer, and lifestyle, this kind of lifestyle, is everything covered in 2 hours only. So this is my final slide. It's Japan now. Why is like a health screening is important? Because India, for example, life expectancy was 40 years old before, but become now 70 years. Japan is 85 years old. Everybody become like a higher life expectancy now in the world. For example, cause of death also changing. Before, it's a more communicable disease such as tuberculosis was very heavy, but getting lesser and lesser. On the other hand, non-communicable diseases such as heart attack, diabetic, kidney transplant, this kind of things is getting higher and higher. So for example, we did the screening for Fujifilm employee in India, 300 people. Unfortunately, 77% of people was obesity. Everybody knows I'm a bit obese, but we show him this is your belly inside, visceral fat. You will get a heart attack or diabetic in future. You have to reduce it. And then many people could reduce, 62% of people could reduce next year and make a good sustainable life now with less cholesterol, less sugar. So we could change the behavior. So this is the most beautiful point of Neura. So this is my the final message is we focus on the fairness and available and affordable. We utilize our technology to make affordable as much as possible. We are providing this service as a full body test in less than $200 in India. And definitely we are now coming to Philippines as well. So we are targeting everybody can come comfortably. So this kind of service we want to provide and we want to create the culture in the world. Thank you very much.
Thank you very much, Mr. Morita. It's also great to see the history of Fujifilm the last 90 years and how the involvement into health and technology. I think we are doing okay with time and also technology. I think the transition has been quite smooth. So we are taking questions both also from the floor and also online. But I might just take 1 minute. Just I think it's really hard to sum up all the presentations. We didn't want to cut the time short because really get into the detail and completeness of it. So 4 things I want to highlight from the presentations is we get to see the role of AI in health financing, especially in claim processing. And with the experience in South Korea, I think this is quite encouraging to see how that could involve as part of universal health coverage. The second part, which also rings through in the last 2 presentations, is the role of AI in non-communicable diseases, especially lung diseases, which are very highly contagious, but also the potential in other conditions such as CVDs and also cancers, as demonstrated. The third part is also a presentation where I discussed the role of AI on existing health services, including primary health care, and that linked to the potential for early detection. And I like to mention that it's not only detect those already ill, but also as part of the health promotion and prevention. Lastly, also we get to see how the case studies has already been done in some of the low and middle income countries and see how we can actually expand it to other countries in the region. With that, I might just see if we can take any questions from the floor. Any takers? And Mr. Bo, could I also have the online one if you have any as well? Okay. I think this is more general question online, so I might just read it out and take any comments from the floor first and then online. So aside from preparing the data, what are the requirements or resources that need to be considered if we are going to automate using AI for our healthcare systems? I might start with Mr. Chung, please.
That's a great question. In my opinion, and from my experience, to implement the automized claim and digital healthcare system, I think the standardized data is the most important thing, but truly it's the hardest and difficult one to standardize this kind of healthcare data nationwide. So in HERA, we experienced the standardization job from 1998. So we struggled to standardize all of the healthcare data, including the disease code and the prescription code and the procedure code as well. So I think the electronic claim using AI and the advanced technology, so implementing the electronic claim is the most basic and crucial basic infrastructure to implement the automized process to deal with the healthcare data. Thank you.
Ms. Kuta,
From my experience, what I've seen is that there are two main parts if you want to implement AI in your center. One is the IT department, which is very crucial because it depends on your setup, how many departments you want to involve in it, how many users. So the sooner I think the IT department gets involved, the better. But actually the IT part is actually the simpler part because sooner or later we figure it out and it is doable. The harder part is the change because it is a change in the way people are reading and taking decisions. And just one training does not solve it. So of course, one level of training is important, but what we've seen is that 2 weeks later, 3 months later, 6 months later is when the real questions start coming. So if you are planning an IT, if anybody's planning an AI adoption, I think do plan for recurring trainings, do plan for addressing the questions people might have in changes in decision making and patient flow.
Thank you very much. I couldn't see the other speakers online, but I have another question as well, but I might just see first if Mr. Saurabh or Mr. Morita is online to answer this question.
Sure, maybe I can come in. Just in addition to what the other panelists have said, maybe just a very practical thing coming in from especially a low middle income setting is the technology resources. What we're facing now, like implementing OpenIMIS AI models for claims adjudication. And this is very particular to low resource settings, is you need advanced computing hardware for doing some of these for model trainings, etc. And it's a very it's a new problem that we have. We need very high computing power for a short amount of time. So now do we have large investments from the health insurance to buy that computing power for a short amount of time and make that investment? But what would be the best is if we look at this as a health system, so that that computing power is available to the health system. The health insurance uses it for some time. Other uses are also possible, so that there's almost time sharing in there. So I think the message is that we need to look at AI in a very systemic approach. How, when we're looking at ministries of health, governments, how they want to set up even the technical infrastructure. In addition to what my fellow panelists also said, like I think training, etc., should also be looked at in a very holistic manner, and we should stop thinking in silos within AI as well, saying and look at it from a system perspective for implementation.
Thank you. Mr. Morita?
Yes. If the question is how to use AI and how to implement AI, I think this is the firstly, the vision is first. AI is just tool actually. So in my case, as Japanese, we are getting annual health checkup as obligation. I wanted to make this kind of culture in the world. So how to do that? Is everybody is busy, doctor is busy, hospital is not number of hospital enough. So how they can do that preventive health screening? It's not possible in many countries without technology. So that's why we bring a machine and technology to make it happen. So from my point of view, yes, it's a vision first, and then to utilize AI to make it happen. I think this is a way.
Thank you very much. I just have another question, if that's okay. I think we have seen before how we can use the AI in lower and middle income countries. But I'd like to see if you can have perhaps one comment each of how we can actually invest or promote the role of government to actually upscale this AI, especially in the next 5 years toward the Sustainable Development Goal 2030. Yeah, please, on the floor.
You mean that how to improve the AI skills in the government level?
Yes, and also how it applied on developing countries, if possible.
Yeah, I'd like to speak about the Korean experience. As you might know, the Korea is quite passionate to digitalize everything. So I've experiencing some the projects with the developing countries before. For example, we built some national health insurance information system for Bahrain, the small Middle East country. We built the system in 2017. The most important thing from my experiences is the hierarchy of the decision making. I mean the comfortable and efficient decision making process from the government. Fortunately, the Bahrain is the kingdom. The kingdom and the loyal families and the high positioned government people, they can decide all of the policies and digitalize the effort and how much budget they will invest into the project. So in sometimes, but ironically, some kind of like the diplomatic and the political issue is the most difficult one, and yeah.
Yeah, thank you.
I mean, I think I like to see it half glass full. I think a lot of the developing economies have an opportunity to use AI and leapfrog the technology adoption. So, if I take the example of India, there is a massive drive to go from CR to DR when it comes to x rays. But actually, it is a shifting bottleneck, right? If you do CR to DR, which is digitalization of the machine itself, 5 years later, the challenge will be there are not enough physicians. So it's an opportunity to actually go from CR to DR plus AI rather than wait 5 years later. So that would be one thing that I would say country governments can think a little bit forward in their digitization journey, that how can AI help bottlenecks in availability of physicians, trained physicians. The other challenge I have found, which I think governments are starting to think, and I would encourage it more, is a lot of the time the funding and the implementation is disease specific. So some of you might know that there are programs for HIV, there are programs for TB, malaria, etc., NCDs, etc. But again, AI is an infrastructure which cuts across disease areas. So I'll take the example of Kenya. We do a lot of work in Kenya for tuberculosis, and we are very well, in conversations with the NTP there. Now we have been able to gain the trust to be able to say, but the same infrastructure can go to NCDs and to cancers. So I think that is a role that governments can play to look at things more holistically, more horizontally, rather than disease specific.
Thank you. Mr. Akito, please.
Yeah, thank you very much. Just one point I want to emphasize before introducing the AI to the healthcare services and system. And I see that many developing countries are also struggling data interoperability in health sector. It's critical for the machine learning. And most of the data is not public available, it's closed information. So if missing data, that's also the result is misleading. And I understand that many governments try to connect the data sets from the facilities, insurance, and other government data, and sometimes the boundary between the ministries or sectors and facilities are also challenges. So it's not only health sector's issue, it's more the cross-sectoral agenda, and also government entire policy, how to manage the data and connects between the different sector. That's also critical before introducing AI technology into the health systems. Thank you.
Thank you. Mr. Saraf?
Thank you. I think what is also very important is when you say we're looking at the SDGs 2030, we effectively have 5 years, no, at this point to get there. And with AI now really coming up, I don't think we'll get to a point where we have big impact unless we build on the work that all of us in this room and more are doing together. I think the point made about AI being infrastructure, I couldn't stress it more, no? And especially with investments from ADB, I think that can really push it to have governments really look at AI as infrastructure within the health system, so that we're not developing AI for different projects, but we have AI that can be leveraged by different projects within the health system, but also in terms of technology, how we're developing things. So using more digital public goods, learning even within countries. So what's being done in Nepal is definitely can be used in other countries as well, and vice versa. So I think we need to set up systems through investments where we can build up on each other's work, and that's the only way we're gonna reach those goals in about 5 years.
Thank you. Last but not least, if Mr. Marita has any comments.
Yes. I think it's firstly like young, visionary, good leader you have to put in the organization, I think, in each government. And then he will think something make good for the government and the countries. And then AI technology and any technology will follow, I think. I saw that I was like in a Fujifilm, I was like a salesperson for medical equipment in the Middle East and Africa before, and I go around everywhere. Some country is very visionary person there. So in such kind of country, drastically make something new. But if not, it's nobody. So it depends on the person. I think a good leader to put, I think this is the most fastest way.
Thank you very much, and that's a great way to sum up. And thank you for all your comments from the panel. I think that's a wrap for us. I just want to thank Mr. Bo for helping us organize all this, Mr. Jae Kun Kim, who couldn't be here, but organized all the panel speakers. And thank you very much in person and also online panelists. And last but not least, thanks for the participants since yesterday to today, and hope you enjoyed the rest of the session. And thanks for joining us in this health AI journey. Thank you.
Thank you.
Thank you. And for the rest of us, there's coffee outside. We'll see you back here at 11:10. Thank you.
Good.
Michael Dieter has been awaiting a lung transplant at the University of Florida Health Center since December.
I'm what you call high flow air. And because of that, I can't sustain myself at home.
A dedicated team of doctors and nurses attend to him day and night. But that's not all.
That's okay.
Sensors and cameras track Dieter's every move in this smart intensive care unit, from vital signs to facial expressions and everything in between.
Every place in this room will sense something about you. Is this enough light? Is this enough noise? Are you okay? Are you moving enough? Are you in your bed? Are you out of the bed? I think that's the future of how we will design hospitals.
More than 350 gigabytes of information per patient goes into a central computer, where artificial intelligence then processes the data.
We could look at the patient and go, they're moving a lot. There's
Yes.
something going on there, or their face has a certain grimace
Absolutely.
to it that they normally
Absolutely.
don't have. Is it possible that it could tell you before I even know that I'm having problems?
Yes, 100%. We will be able to decipher complex features, complex emotions like agitation or hunger.
Funded by the National Institutes of Health, the high-tech experiment enters its third year. Researchers are still teaching the technology what certain actions like sitting and standing might indicate. The hope that AI will soon be able to provide real-time healthcare recommendations.
Nurses, doctors, we spend a considerable amount of time paperwork,
Yes.
translating the data we get.
You will actually have representation of the data in a way that you as a human can just understand and action.
But will this new technology replace the need for humans in the hospital altogether?
They are very simplistic models compared to what our brains are doing. And I don't think that we should be worried about humans being replaced anytime soon.
This technology does take big burden off the physicians and nurses and provide them time to actually engage what we are here for, taking care of the patients.
A new holistic approach to healthcare where humans and computers work hand in hand. Dr. John Torres, NBC News, Gainesville, Florida.
All right, welcome back, everybody. Let me now move to our next session, which is AI and the future of education. I'm going to invite our moderator, Mr. Jeffrey Su, Senior Education Specialist at the ADB, to come up on stage, and he will introduce the other panelists.
Okay, thank you. Good morning. We have a full day yesterday, and then this morning we just listened through the health sector panel. Education sector is part of the human social development sector office. We got health, we got education, we got obviously social sector as well after us this afternoon. So and we all heard from yesterday's conversation and a lot of discussions. The education sector would be one of the most disrupted sectors by AI, I would say. Obviously, that's not just because I think our keynote speaker, one of our keynote speaker, Javin, has cautioned us that none of the kids, what they learn today might not be relevant anymore in the future. And I have 3 kids, and obviously we all are into this. But it's more about really how do we capitalize the opportunities to look at transform our education sector to really prepare our students for the AI age and not getting unemployed as soon as they graduate, right, and get into the job market. So we know the AI in education is the market is accelerating very quickly. From the data last year in 2023, the AI in education market is about $3 billion. And then the estimates, one of the aggressive estimate I see in 10 years, like 2033, the AI in education market will grow all the way up to $90 billion. That's some of the data. But again, we will actually see some of those from our keynote speech, Maria's speech, because she, as a Holland IQ, they actually look into the market, all the different innovations and all the different players, providers in the market. So we're going to get more data insight into that. But again, I think from the ADB perspective, we understand AI, the potential in AI to bridge the learning gap, and also transform the way our teachers teach, transform the way our students learn, and also transform the way we actually assess our students, and how do we assess their competencies and prepare the competencies for the future. So just to give some examples, for example, in Bangladesh, I think Rose is going to share a little bit. We're doing a teacher co-pilot tool to support the teachers to better prepare their lesson plans and teaching materials. In Vietnam, we actually have a project using a AI-based English language learning software. It's called Elsa Speak, using AI to actually help students improve their listening and speaking and spoken English skills. That is a project we actually just wrapped up from one of our what we call technology innovation project in the Southeast Asia. We also have a pilot project looking at using digital assessment, AI-based digital assessment to improve and to assess the students' competencies. Those competencies, especially the self, expression, the empathy, a lot of the competencies like individual execution and the self-decisiveness, and these competencies are going to be extremely important in the future. And we don't know how we can best assess them. So last week I was in Cambodia doing a project using an AI-based tool, try to assess these soft competencies as well as the 21st century competencies such as critical thinking and creativity that we know it's going to be extremely important in the future. And also, I think we're also looking at potential AI tools to look at to better predict what is the future of jobs and future of competencies coming. I think Trisha from the LinkedIn shared yesterday about some of the changes. Like some of the jobs are going to be really disappearing. Some of the jobs are going to be complemented. Some of the jobs are going to be still stay and maybe even stronger. And the new jobs are going to be coming. So there are actually AI tools to look into the market, the industry data, curriculum data, and also the job market data to see the trends and the changes so that we can be more prepared from our institution perspective. Because ADB projects span across school education, higher education, and TVET, right? So today's session, we're gonna dive into the nuts and bolts of how we're gonna prepare all the different subsectors in our again developing member countries to capitalize the opportunities with AI and how we can work together to address the challenges. Obviously, in the panel, we have experts from academics, from industry, from our developing countries, policymakers as well, from Vietnam and Philippines as representatives to help us share their insights and discuss the way forward. But with no further ado, I will introduce our keynote speaker now. And Maria is Maria's species is actually a co-CEO of Holland IQ. She's the co-founder and co-CEO of Holland IQ, which is the world leading research analytics platform for the global impact economy. Their data and insights power growth, innovation, and risk intelligence for forward-thinking governments, institutions, organizations, and the investors across climate, education, and health. Maria has worked in public and private education for over 20 years, specializing in transforming education through technology. She has built and led global teams, driving innovation in curriculum, teaching, and student experience in over 50 countries. I think the global education sector and the platform provides the tools and frameworks such as the global learning landscape, scenarios for the future of education, and digital transformation frameworks from Holland IQ. So let's welcome Maria Spies onto the stage. Thank you.
Hello, everyone. All right, can you hear me? Great. Hi, everyone. Thank you so much for that introduction, and thank you, of course, for inviting me to this wonderful 3-day conference. It's been illuminating. I work across education, climate, and health, as Jeffrey said. The presentation today is a primer, really, for the conversation. We want to deep dive a little bit, double click into education, what's happening in AI on the global landscape, and provide some examples about how artificial intelligence is being used or not being used in the education sector. So I'm going to start with global trends, just to frame the conversation about AI use in education, and then key types of AI being used and the key issues we're facing or seeing in the education sector. I'm going to look at mapping AI across the global landscape, particularly in across learning and also systems in terms of use of AI or deployment of AI, and then deep dive into some examples from the region and from other regions too. So let's just start with, artificial intelligence is a part of a broader digitization landscape in every sector, not just education, of course, but these digital 5 forces, mobility, big data, social media, cloud, robotics, AI, etc., are part of transformations that are going across every sector. For education, that lends itself to mobile, the possibility of mobile learning, personalised learning, disaggregated content. These are all the trends that are happening and have been happening in education for quite some time. Social learning, gamified learning. So this is not new to you, but it's actually part of a broader digital transformation that is, impacting every sector. When we survey schools and ed techs globally, we ask them what are their key challenges. Because we can talk about technology and that's interesting, but more importantly, focusing on what are the challenges for education, how can we match solutions and the deployment of AI into those challenges. Teacher retention is number one. We know that there's a huge global problem in terms of teacher shortages. And the number of youth in the world that, there's something like 2 billion more learners that need to be educated in the second half of this century. There's no way that existing models are going to cater for that. So we have to think differently. So teacher retention is part of the issue, teacher shortages. Preparing students for the learners for the future was the second top issue. Faculty and staff wellbeing, learner wellbeing, particularly since COVID, that sort of holistic thinking around a student and teachers and their whole sort of, not just academic experience, but their social and emotional experience as well, mental health and so on. There's an update to this survey, which is not yet published. And what happens in the 2024 version is that preparing students for the future, it becomes number one. School systems globally are very concerned about this and how, because things are changing so much, how do they prepare learners for that future? Followed by faculty, followed by teacher retention. So still the same. Of course, and in the workforce sector, what's happening is a big focus on skills and the gap, the skills gap. How can education systems from pre-K, K-12, higher education, workforce upskilling, how can they prepare and support what's coming and what's needed? We see massive skills gaps. We see still, even the last 50 years, analytical skills, self-management skills, digital skills have been asks of industry for a very long time, but more and more now. And we survey education leaders globally every year, and we ask them, what are the top trends in education that are impacting your institution and your organisation? Artificial intelligence, personalisation, and assessment are the 3 top ones. Now, this is all related to technology and data. Education leaders are concerned about it, worried about it, thinking about it, and in many cases acting on it. Learning analytics, of course, is the fourth one, followed by issues or trends concerned with changing models, particularly in post-secondary landscape. So apprenticeship models, internships, work-integrated learning, micro-credentials, unbundling, this is driven by technology, but actually it's a model change. And that's something that we need to think about concurrently with what's happening in the classroom at the learning level, what's happening at the industry structure level. We're going to see some changes there. Wellness and wellbeing, tutoring, test prep, etc. This is thinking about students. So when we sort of pull back and think about what are the sort of key issues that are driving activity in education right now, focus on the learner engagement, learner retention, and the learner experience are front and centre. And of course, artificial intelligence can lend its hand to supporting engagement, retention, and experience. Generative AI integration, I would say it's in the phase of mass experimentation at the moment. I wouldn't say it's nailed, and we see lots of different practices. The other thing globally is the very, very clear attention to infrastructure, core infrastructure, and that is right down the technology stack to broadband or access to the internet, and all the way through to applications and data integration, interoperability, and so on. This is a very big focus for governments and education systems at the moment. So let's just focus on AI for a little while. There are different types of artificial intelligence. It's not all the same thing. And these different types are being deployed in different ways through the education system. Vision-based AI, voice-based AI, we've heard a little bit about this already in both health and in yesterday's program, language models and analytics, of course. So all of these different types of AI are being deployed, used in ed tech, and deployed into formal and informal education systems, into direct-to-consumer models, and also inside formal classroom environments. The sentiment around AI in education is interesting. And so, over the last few years, the sentiment is generally positive or neutral, with a bit of a spike after November 2022 in the negative, because everyone's concerned about generative AI and its impact on learning and so on. But generally it's positive. And then really AI and education isn't something people thought about much until the public availability of generative AI, and you can see the spike there in search terms for education and artificial intelligence, and also a little more concern around, well, what is generative AI going to do to learning outcomes for kids particularly? There are three key issues that education to do with AI that is always part of the conversation and should be, of course. Security and bias. Is the data secure? Who has access to it? We're talking about kids' data here. How and where were the training algorithms built? So that whole part of the conversation. Equitable access to the technology. How can we ensure that all people have access, equitable access, not just to using these tools, but creation and being part of that whole environment. And thirdly, and I haven't heard this too much already today, but in the education circles, this is one of the most important. Does it work? Is it effective? Does it impact learning outcomes? How? In what circumstances? In what contexts? I mean, context is very important in education. Context is king, actually. A tool, a particular AI tool, can work very well in one context and fail in another. So, we've got a lot of work to go there. You would have seen this vibrancy index. AI capability has become an absolute national priority for all countries, essentially. And, you see, I bring this up because a lot of the capabilities here require a very robust education system. So the top sort of part of this heat map is research, AI journal publications and so on. Who does research? Well, generally it's in universities. So AI research. The middle is per capita. You see differences here when you put it on a per capita basis. Then investment into artificial intelligence and skills and hiring, and so talent, vibrancy. And again, you see different the darker the square, the more vibrant. And you see differences in countries as we go down. So countries are good at different things. And so measuring capabilities at a national level is becoming very important to most countries. For emerging economies, generally there's sort of a couple of key issues. One is limited digital infrastructure, one of the things we've been talking about today and yesterday. A skill shortage, so a significant skill shortage in people being able to know about AI and work with AI and deploy and manage and so on. Particularly, I think we heard in the last couple of sessions in the government sector, so the leadership, and then a lack of quality data. They are generally the three key issues, and there's all sorts of possibilities, positive and negative, that come from these issues. For higher education, plays a huge role in how artificial intelligence is going to be managed, deployed, upskilling, you name it, across the world. And higher education universities are operating on a couple of fronts, 5 fronts, deploying AI in their own operations to make it more efficient or whatever it may be, building AI capacity, so ensuring the university has the capacity to lead these conversations, teaching with AI, using it in their curriculum, and teaching about it for the future generations, and of course a huge amount of research in AI. So they're the 5 sort of concurrent activities that universities globally have to tackle, but have to incorporate using AI into their operations. So let's just have a quick look at some of these AI tools that we're seeing. Generally, overall, there are about 100,000 EdTech solutions or EdTech startups of varying sizes globally. If you ask those 100,000 who uses AI, about 100,000 would say, I'm using AI, all in different ways, of course. But let's just have a quick look at some of those solutions. When we ask institutions, are they deploying AI over the last couple of years, our 2019, 2022 and 2023 surveys, what you see here is a change. So back in 2019, a quarter of institutions were saying, yeah, it's on the radar, but we're not really doing anything. Now that's just 10%. So actually the majority is moving now to deploying, seeing this as a serious thing and deploying AI into their operations in one way or another. Across the learner lifecycle, let me just unpack this for a second. Artificial intelligence is being deployed inside institutions, K-12, higher ed, pre-K, upskilling across the whole life cycle in different ways. So if you look at people and systems, that's the leadership, digital capability of the staff and so on, you know, AI skills and leadership in terms of human capacity, institutional data, reporting, visualization, you know, those sorts of things, automated data management and so on. There's a technical side of things. Learning design and learner experience often obviously go together. We've seen a big spike in the use of artificial intelligence for learning design. How can artificial intelligence help to map curriculums? How can they help to build curriculum perhaps, or even suggest? And there's a lot of that activity going on. For the learner experience, it's you know, being used in instant feedback, possibilities for digital literacy or writing practice, or creating, you know, detecting plagiarism, creating rubrics, all sorts of things. And there's been a lot of press around some of those activities, particularly on the detecting plagiarism side of things. And then you know, in terms of life ready, right to the end of the life cycle in terms of, you know, placement, matching placement, people, students with jobs or interview practice or all sorts of activities. And this is the problem. One of the problems in EdTech and education is that there are many millions of point solutions. And this is difficult when you're trying to build an integrated set of solutions for institutions particularly. And so data interoperability, that layer underneath, the infrastructure layer, is particularly important, hence the work in infrastructure. Education institutions have been using AI for many years, and mostly they didn't even know it. Artificial intelligence has been embedded into their corporate systems for a long time, but now applications at the user layer, teacher and learner, are much more, you know, front of mind. The last few years have showed an opportunity here for embedding advanced technologies into the processes of learning. How do we support students if they're digital, if they're online? This is more and more the case. How do we provide authentic experiences? How do we observe learning if they're not in front of the teacher? And the answer to that is data. There's problems, of course, but it is observation through data. How do we assess learning? Again, there's lots of opportunities for artificial intelligence. We track all those 100,000 EdTech solutions, and one of the areas that's of great interest to us is how AI is being deployed. And so we see use cases. These are some examples. I see Elsa Speak is in this list, which was mentioned a minute ago. So language and literacy is a very big use case for artificial intelligence, even more so with voice AI. Teacher productivity, personalised learning, tutoring support, research and study tools, engagement, retention and wellbeing is a new application, assessment and feedback and productivity sort of tools. So we see some of those. I want to double click into a few of these examples. Let me jump into, I've pulled them from the region mostly. So this is a Singapore example, an AI-based language teaching tool, Giglish, helping users to improve their fluency. It's a voice-based AI for language and literacy. Language learning, English language learning particularly, is very important in this area, in this region, but literacy as well, early literacy. But it's not just speaking to, yourself, I guess, or your phone. It's now moving to speaking to some sort of avatar that you design. We're seeing many, many applications of this. There's a whole presentation on the problems associated with these things, but anyway, we can talk about that later. But these are the sort of applications we're seeing. They're a bit fun, they're a bit unique, they use voice, they use text and so on. Intelligent course development assistant. So this is out of Malaysia. Chat to course, AI-powered course builder. And this could be great for teachers, maybe. Could be great for anyone in a learning and development department in an organisation who has objectives, and then artificial intelligence can help to build a curriculum. And this is also a big, big use case, particularly since the advent of generative AI. And so an example out of Vietnam, we can't forget the upskilling component of it. And so Techie, which I think is a really interesting organisation, teaching STEAM, coding and AI skills for, youth, young people. And so capacity building in AI type of skills is incredibly important. And so you see solutions like this in the direct-to-consumer market all over, particularly Asia, but all over the world. And they're fun and so on. Coding through, it's not just green screen type coding. And I wanted to bring an example from Brazil. One of the things that we can learn a lot in emerging economies is that some of the problems or challenges in emerging economies, it could be infrastructure, it could be remoteness or whatever it may be, are similar. So looking at solutions from other similar environments can be helpful. This is Teachee is a platform that is just focused on teacher productivity. And so it claims to save teachers 20 hours a week in administrative tasks, which is actually a lot of time. And so, we're seeing these type of efficiency solutions, particularly aimed at teachers, a lot of that happening. But I wanted to say it's universal here. So have a look at the drop down there and the languages available. So this is not just Brazil for Brazil. These solutions are actively deploying across all sorts of different geographies, including, you can see here, including some in this part of the world as well. So this is just a very quick double click down into some of the solutions we're seeing, some of the issues and topics that are being discussed in education right now. There's actually a very, very long way to go still, but I look forward to the panel discussion on that. Thank you.
Okay, thank you so much, Maria, for really managing the time so well. And so this is to make sure that we don't get hand up here and we are delaying our lunch. So we're trying to make sure that we finish on time. I know this is the only session between you and lunch. So we're gonna move on to I think the panel session. I will be really delighted to invite the rest of the panelists onto the stage. First, Ms. Han, Officer in Charge of International Cooperation and Communication, Ministry of Science Technology in Vietnam. Ms. Han is in charge of the International Cooperation and Communications of NATEC under MOST Vietnam, and also at the same time Director of Soy Hub. Ms. Han has been working in MOST Vietnam for over 3 years in the field of startup and innovation ecosystem development, and 10 years experience in communication and public relationship management for development organizations. Next, I will invite one of our keynote speakers yesterday, Javin Chi-Feng-Shu. He's the director of Causal AI Group, University of Adelaide, and at the same time, professor of School of Computer and Mathematical Sciences from University of Adelaide. Welcome again to the panel. And then we have our own colleague, Ms. Rose Second. Rose is an education specialist with the education practice team. Before joining ADB, she worked in the Education Commission in Washington, D.C., which was actually convened by the former Director General of UNESCO and the UN Special Envoy for Global Education. So she has worked in adaptive and personalized learning before, and digital learning EdTech initiative, in various countries. So that's Rose, and also obviously our host country based in Philippines is our Director Lila, a career executive service officer. She's the current director 4 of the Bureau of Learning Delivery of the Department of Education in the Philippines. Director Leila, prior to her appointment as director, she was a former assistant schools division superintendent and officer in charge of the office of the schools division, and the superintendent in the schools division office of a couple of cities, multi different cities and provinces in the Philippines. And obviously she is quite hands-on in really improving the learning and the teaching for the education systems. So we have a panel. Obviously you can see they are representing different subsectors of education, all the way from school education, higher education, the TVET, and the industry. I want to take a quick poll. How many of you here have kids that are school age? Oh, okay. How many of you have kids who are in college, in higher education age? Okay. Yeah, I have one son in US studying, and he's about to graduate. And then how many of you have graduates, kids already graduate in the market already? Okay. Good. Okay, I have my daughter who graduated 2 years ago, doing data science as well. So I think all of us are in this together, right? So it doesn't matter you have relatives, kids, yourself, from school age to higher education to TVET. We're all in this together, trying to see how we can capitalize the whole opportunities with AI and look at the challenges. So I will move on to the first question to Javin, because Javin shared a keynote yesterday, right? One of the things that I remember very well is, because I have a daughter who is 14 years old, who is in 10th grade. I talk to her every day, and she's struggling about obviously the pressure to study. And listening to what Javin said yesterday, it doesn't matter anymore. No pressure, because whatever they learn will be irrelevant 10 years later with the whole AGI and all the super intelligence coming in. But obviously, I think we're getting back to the real reality is based on what you shared yesterday. But in terms of getting our future generation students ready, right, for the post AI age, especially from the higher education perspective, what do you see you're doing in your university in terms of curriculum assessment to really help the students get ready when they graduate?
So I'll tell you the old approach that we have been used in the past, maybe a few years. The old approach, and we've been doing well. And the reason we've been doing well is because we are the researchers too. So we publish top papers. We know a lot of business owners, so we know who they want to hire, right? So the students come to us. Some of them are even with full GPA or surprised us, right? Come to my team and say, can you please take me as an intern? I was like, okay, but why is it happening now? They say, oh, well, if we spend some time with you, we're going to land on a fancy job. As they find out, okay. So that's the old approach. We teach them skills. But in the past, maybe a couple of years, we realized, if you look at the people who really succeed in life, right? The ones you admire, the ones they're happy, are not the ones with the best grades, right? Are not the ones with the best skills, right? Those are often the ones with the best values. So now the new approach is we had a mind shift. It's the value that we should share. And that's the torch we should pass on, that should grow and glow. So that's after that, and the quality of the students suddenly become higher, that we never need to do this and do that. No, right? They would just find out the meaning of their life. Right? I would teach them some tricks. Say, one thing I like to teach them, share with them is die before you die. So you meditate, think about now you're going to die, right? When you're old enough, you're going to die, although you are young. And think about what are the regrettable moments that you had in your life and the stuff that you dreamed of if you did never do, right? And come back, realize, oh, what actually is important in your life, right? So, because we are living in a chaotic world full of distractions, right? Find wisdom in silence and in stillness. So that's my philosophy. That's the new approach. Wow. That's for now, so.
Okay, thank you. Thank you, Javin. I think move on to the school education sector now. Let's hear from Director Leila. For developing countries such as Philippines, right? You heard the speech from Maria around the various opportunities out there, right, in different domains in teaching, learning, assessment. So in terms of what do you see the opportunities for AI adoption and developing the AI competencies, right, at a younger age for Philippines?
Okay, thank you very much for that, and I'm happy that the Department of Education forms part of this forum. In fact, I listened to the presentation of Ms. Maria, and I noted that the Department of Education is having some issues and challenges as presented a while back, particularly on the utilization of artificial intelligence. So in a developing country like the Philippines, adopting artificial intelligence for learners at a younger age may definitely be bringing some opportunities and also some challenges, especially for learners in kindergarten, grade 1, 2, and 3, of which to us, we see that it may not be the best time for us to be introducing generative artificial intelligence, as their brains are still developing essential cognitive, motor, and that of social skills. So we all know that in teaching learning, we really have to consider developmental readiness of our learners, so that exposing our learners at a very young age may hinder the natural development of critical thinking, problem solving, creative thinking, and that of hands-on learning on the part of our learners. So to us, we see that this crucial stage would be needing a sort of building language, literacy, and social skills among our learners. And this could be best learned through direct interaction, through play, and active exploration rather than exposing the children to advanced technology, of course, like artificial intelligence. So we really have to consider the stages of cognitive development. So for kindergarten, grades 1, 2, and 3, our learners are still in their concrete operational stage. And AI, as we all know, calls for a lot of abstract thinking. So they may not be ready yet. So I have to mention that in the Department of Education, we have already started introducing basic AI in grades 4 and particular grades 4, and these are integrated actually in some learning areas like science, mathematics, and that of languages. Thank you.
Thank you, Director Lila. I think let's move on to the industry. I think Vietnam is also very aggressive in building an open innovation system that heavily promotes the AI talents for the industry. Can you share some of the initiatives in Vietnam to prepare the human capital talents for the AI age?
Okay, thanks, Mr. Jeff. Yeah, I started with this slide because in case I forgot anything, I feel that I'm old, so I really need an AI assistant. And actually, thanks Mr. Jeff and Miss Arena mentioned about two startups. They're quite very typical in Vietnam. One is the Elsa and the second is Turkey. In Vietnam, is at top of the industries attract startup now. Until now, is education, edtech. And the second is the key area in technology that applies in almost industry is AI. And but I want to share point of view from the Vietnamese government. And now we are promote for the open innovation. Actually, our original one, the model just have a three components. The first is the government, the second is the university, and the third is the industry. And until now, industries involved a lot because they really need the AI as human resources. And almost the investors come to Vietnam, they propose to us for the qualify the human resources, especially on AI. And that's why all the startup and all the activity now, we are change the way government collaborate with business to set up all the challenge in Vietnam. And then we bring all the challenge from business, come to the startup ecosystem, come to university and reaching out to the solution and models. For example, we just started with the Qualcomm and we go with Qualcomm for the QVIC challenge. That means Qualcomm apply all the challenge and they attract all the AI solution. And I count that is around top 10 of QVIC, 2 of them from EdTech. And until now, the startup in Vietnam can create the AI technology to translate the voice into the text with exactly around the 92%. Yeah, that is a very high numbers in the world now. And that is the role of the government. Government do the very hard role in this pictures. We do this game and arrange all the key stakeholders in this game. And we do the strategy together. And what is the role from the international organization? Because Vietnam now at the very beginning step. And that means we are really need to build up the foundation and our boundary activity. That's why we are collaborate with almost the international organization and to set up the mentor and advisor network to support for the Vietnamese government to build up the strategy together. And they also set up by the separate the projects in Vietnam with the different color, and then they also support for Vietnam to build the ecosystem. And the second is the innovation hub, because between the university and industry and governments, we still have too many gaps. And that's why we create the area like we can support the solution, edtech and other startup and company that mean they have a flow, the input and output, and we bring them with the knowledge, the advice, the funding, and then the output we support them for the test beds for the technology piloting areas. So that is also the roles of university to take the role of R&D. They set up the R&D centers inside, and they take a lot of, they have to define the challenge so well. And the second is when the university mesh with the business and government, they have a clear about the demand of the market on the AI human resources. And then we are collaborate with university to design the practical training, how we can train them. Miss Maria mentioned a lot of skill and soft skill. I remember have a 2 skill very neat for the Vietnamese student. I really agree. That is the first one, the analytic skill. And the second is the design, and those skill is necessary now. And we bring all the criteria to set up the curriculum learning for students. Yeah.
Thank you, Ms. Han. And we are looking forward to actually participating in the OID, the Open Innovation Day, in the end of October. Then I know you have a AI, like Green AI Challenge, right? So on the day.
Yeah, we have a 4 section, and the key section is the AI, because almost industry now come to Vietnam for invest on the R&D and AI, and we have a collaboration between Intel, Microsoft, and Qualcomm for this panel discussion around October 25th and 26th this year. Open Innovation Day.
Thank you, Ms. Han. While we're having the session going on, please feel free to scan the QR code to post any questions to either Maria or any of our panelists on the stage. So we'll try to address some of the like questions once we get them. And then let's move on to roles. You heard from the different perspective from higher ed, from school education, from the industry. Can you share a little bit about the ADBs, again, across all the 3 subsectors, right? How ADB, some of the upcoming projects that's going to be supporting the AI adoption across our DMCs.
Sure. Thank you, Jeffrey. It's really, I would like to preface by saying that this is really an exciting time to talk about AI in education, because the challenge is huge. I mean, we don't need to recap. We know what the education challenges are. Maria mentioned the 2 billion more learners that need to be educated by the second half of this century. So there's a lot. We don't have a dearth of challenges, is what I'm saying. But the opportunities are also aplenty. And a lot of the work that we're doing in AI in education, while in its beginning stages, it's really quite ramping up. And we're very excited to be in collaboration within ADB with other teams and departments to really ramp up the runway for AI in education. So I'd just like to give you an overview of some of the work that we're doing. And this is, again, across ADB. And I'll give a brief description for each one. So there has been an AI needs assessment survey that our colleagues from CCDT, led by Byung-jo Kong, and our colleague Jigang Lee at the education practice team, they have surveyed over 1,000 primary school teachers in Bangladesh to really get a pulse check of the needs, their concerns, and the opportunities surrounding AI capacity. So with that, interestingly enough, and I have another slide after this just to kind of dig a little deeper into the data. So most of the teachers that were surveyed were actually rural teachers. And they demonstrated a lot of comfort in AI once they've been trained. And they see a lot of opportunities in AI when it comes to creating content and helping formulate lesson plans and even providing formative assessment. And these are the tasks that are quite rudimentary and also quite laborious for primary school teachers. And also, with the learnings gleaned from that survey, there's been a development of an AI teaching assistant tool called ATAL that will be piloted in Bangladesh by Joe Jigang and the team next year. And this will actually be a direct learning from the survey, in which it'll be a teaching assistant platform for teachers to be able to do just that. Their concerns about being able to create lesson plans, teaching materials, and content, which really could be a game changer when it comes to cutting time and effort for school teachers. And we're also actually just about to embark on an AI in education capacity building multi-country project. And the countries that we are looking into are Bangladesh, India, Indonesia, Philippines, Uzbekistan, and Vietnam. So as you can imagine, that's a diverse range of contexts that we'll be working with. And for that, we want to be able to collect and generate various use cases across school education, higher ed, skills development on AI adaptability. So we'll be testing, Jeffrey and I and the team will be testing different AI-enabled applications. Elsa was mentioned in Vietnam, Copilot under Microsoft in Bangladesh, and other types of tools, so that we can really understand the different contexts, how they behave and how they learn and adapt using these AI applications. And in parallel to that, it's one thing to be able to pilot these AI use cases. It's actually another to be able to capacitate and train the education workforce. So a big component of that pilot will also be to create what we're terming an AI-powered community of practice. So we'll be helping enable teachers, education stakeholders, and really understanding the data that they're getting from the AI applications and how they can actually innovate their classroom practices on the ground in schools in real time. And with that as well, we would like to make sure that we're not just training the teachers, but we're also capacitating the education policymakers. So it's really and I'm sure this is music to your ears, Director Leila, because it's really a concerted ecosystem effort. We have the piloting of the AI-enabled applications. We have the teacher training that's severely needed. And we also have the capacity building and the leadership training for AI. And on top of that, we would like to develop an online resource hub. So all of these findings, all of these learnings can be put in a repository. And we're also going to be doing a pilot with Khan Academy. I don't need to elaborate further on Khan and its benefits. So Khan Academy Philippines is a pilot that will be launching soon, and also regional knowledge sharing in other countries. And lastly, we'll also be doing an AI in education professional development program within ADB, so that our internal capacities for AI will be further strengthened. So I'll just quickly go through, I just have two more quick slides. And I mentioned the needs assessment survey a while back. And in this heat map, we can actually see that the teachers are most responsive to AI when it comes to AI's ability to create questions, plan lessons, and to prepare content. So again, just echoing that the teachers know the value of AI and they're already bought in. It's really a plug and play model in a lot of ways, where we know that the need is there, they already know this, they're already bought in. So it's really up to us to really have a concerted effort in making sure that we're able to pilot as quickly and as effectively as possible. And I've mentioned earlier ATAL, the AI teaching assistant tool, that will also be piloted in Bangladesh. So again, this is a really exciting time where this platform would really be able to help teachers cut so much admin time in making lesson plans. And what's exciting about this work that Joe and team are doing is that you can actually upload a lot of text, a lot of reading material, upload this into ATOL, and ATOL will make the questions for you. You can even tell ATOL the level of difficulty, the type of questions, do you want true or false or multiple choice? So again, this is very robust, very interactive for the teachers to be able to use in the future. Thanks, Jeffrey.
Thank you, Rose. I'm looking at some of the live questions already coming up. There are some interesting ones that we will be able to address. But before we get to the questions, I think I would like to come back to Director Lila on some of the, because you hear all the opportunities which we shared across the the panel. But we know that in developing countries, we are facing significant, digital gaps. So I remember last year I went to a mission to one of our last mile schools in Philippines. So we have to actually hand carry the solar panel that we were trying to deliver as a part of the project. Walking about 8 hours to get to the school. There's no board, no translation available. So the question is, how these schools going to be, capitalizing the AI, and they're going to be completely left out if we're not doing something with them. So I think obviously there's many other challenges like the capacity, the policy support. So would you like to share a bit more in detail what you're thinking right now? What are some of the challenges you are facing, try to fully adopt AI and capitalize the opportunities here?
Yeah, actually, piloting or adopting AI in a developing country like the Philippines come with opportunities as well as challenges. So for us in the Philippines, particularly the Department of Education, one of the major challenges that we're facing, of course, is on digital literacy. While it is true that the Department of Education has growing efforts, particularly on integrating ICT in teaching learning, we know so well that the use of AI will definitely be calling for a more specialized training for our teachers, for our policymakers like us, and even school leadership, because it cannot just be the teachers being informed about how is it to be using AI in teaching learning. Even school leaders need to, because they have to provide support also to our teachers. So as mentioned earlier by Ms. Maria and that of Ms. Rose, our implementers, particularly teachers and even policymakers and school leaders, would be needing comprehensive training. So we have to be capacitated on the use of AI and teaching AI. So that's actually one challenge. Another one would be curriculum integration. I mentioned earlier that we started implementing or integrating AI competencies in grade 4 in learning areas like technology and livelihood education. We have STEM, we have science and technology. But of course, even if these are present actually in the curriculum, we still need the infrastructure, we still need teacher training in order for our learners to be able to attain competencies, particularly on AI. And what comes with it, of course, is funding and resources, because it will never be easy for our schools to be coming up with the needed funding and resources in order for us to implement AI. So teacher training itself would definitely be needing a lot of funding should we really want to have it be implemented nationwide. Another one is on privacy concerns. We really have to think about how we are going to protect and safeguard our learners, especially on the data that we'll be gathering about them. So there's really a need for the Department of Education and the government as a whole to be establishing safeguards, particularly on this. And the next one, bias in algorithm, which was mentioned earlier by Miss Maria. So you know so well that in the Philippines, we speak a lot of languages. So inclusivity needs to be observed in coming up with this, so that the Philippines has a number of languages, to include also the mother tongue. So if it's going to just be English, then most of our learners will be put on a disadvantage. I mentioned what comes also with funding and resources would be infrastructure and technological access. So there's really a need for us to be providing a lot of digital devices, digital resources to our schools. And the challenge would not just be on providing this technological or digital devices, but making it work, especially in areas where for example, in last mile schools where schools may not be energized. So that's going to be another concern. And of course, policy and regulation. It's important to mention that the Department of Education has already started drafting policy, particularly on the use of AI, generative artificial intelligence in teaching learning. We are still developing it, and we have yet to finalize. And of course, developing this would really need a lot of technical expertise from experts like ADB, and I hope that ADB will come along the way and help us finalize the policy so that we can make generative artificial intelligence happen also in teaching learning. We recognize that it's going to help us a lot, particularly in improving learning outcomes, but how to go about it and making all the requirements be made available in our schools will definitely be a challenge. But it's important to mention that the Department of Education is doing a lot in order for us to be, in order for our learners also to be enjoying artificial intelligence. Thank you.
Thank you. Thank you. I think the Director Leader also mentioned about the technology access, energizing, through solar panel to some of the last mile schools. Connectivity is another thing. I think we are working with the uni from the digital technology group. They have a very good, very timely connectivity TA. Piloting using Starlink for especially some of the island countries where broadband, through landline is not possible. So there are, opportunities and then there are more alternatives coming up to help tackle the technology access gap. So I will move on to maybe Ms. Hop now. So you heard about the challenges in the Philippines, right? So I'm assuming again in Vietnam there are some similar challenges. Although I do see, because I was in Vietnam multiple times this year, a lot of the infrastructure connectivity is better based on our survey on the digital readiness assessment as well. Vietnam has been investing in the technology access and connectivity for quite some time. But obviously there's other challenges in Vietnam. So can you share some of the actually the practices that you are doing in Vietnam? How to hopefully working together to address some of those challenges.
Yeah, I have one more slide need to be shared.
Can we share on the back?
So Miss Philippines also just shares about the challenges, and Vietnam is the same. All the key point, and we are set up the national AI strategy already, and we started from 2021 on the slide. And actually we based on the national strategy, Vietnam Ministry of Technology and Science collaborate with Ministry of Information to run the strategy together. And for the strategy, we are focusing on the two key areas. And the first one is the infrastructures, as you mentioned, that is how we can build the infrastructure, data centers, and link all together. And we are, in our strategy, we have an intention to set up the AI innovation hub in some like objective regional in Vietnam. And the third one is we want to capacity building for the create the AI generation, AI human resources. But the most important is how we can do the strategy now in around 10 years up to 2030, and we are do the strategy action plan together. And we have a 5 key area. We are focusing on the base objective. And the first one, of course, is a policy. But sometimes in Vietnam, policy will go later. Sandbox and other initiative will go first. And we are trying to piloting and give more feedback to build up the foundation, policy foundation. And the second is we are, because the policy now, we are need a lot of, as you see the mention, that the infrastructures and the data center. Now we are work with almost the investor in Vietnam to build up this data center with the other ministry, like a Ministry of Security, because that is a quite very like a link with other industry and many department, government together. But we are do together, we have to link with the local. Because in Vietnam, the national strategy just at the high level. And for the local, we have 63 localities, and we have to diversify and set up the national strategy for each local with a different color. And we're focusing on the key area, key industry, potential industry in the each area to build up. And AI action plan, we go together with the each local. And the third is the AI ecosystem. We build the innovation ecosystem around 15 years in Vietnam. And now we do the next step. We link the AI into the innovation ecosystem. How we can link all the activity from the government and from different stakeholders can link all together with the AI solution first step. The second is that we link with the all the activity we deploy, and we raise all the key issues about the AI, relate to AI. And the next is the AI application. The AI application, like now we want to change, because almost the startup and R&D team now in Vietnam, they raise the AI solution as a very like on the basic layers. And we want to put all the core tech and deep tech into the AI software, AI the application. For doing that is related to how we can involve them with the national economic value chain, how they can join with the big game and the with big players in Vietnam. That is our very hard question we are doing. And that's why we are do with the next step is we collaborate with the big incorporation in Vietnam and international incorporation, and we find out all the level of challenge, and we define how we start up, how the SME can define the which challenge by the AI. And we have 3 kinds of the challenge we raise, and we list down on all the platform and all the panel discussion the first one is the challenge at the very national level, but it's a very general and basic. And we really need the ecosystem involved to define the problem statement. And we up on the level, the second one is when they have a problem statement, all the AI solution and startup and the team can bring the solution to deal with the challenges. And the high level is how we can link with the AI solution with the economic value chain, like they can engage with the manufacturing and they engage with the investment. That is the key level we are doing now in Vietnam for AI application. And of course, the last one is the collaboration. We are trying to promote in different format.
Thank you. Thank you very much, Ms. Khan. I was glancing through the live questions from our audience. There are already some questions coming up. One of them I remember is actually addressed to Director Lila about the AI in grade 4, what is the result? I can still remember that question very well. That's related to Director Ilan. Maybe while waiting for additional questions coming up, can you share a little bit more about details? I'm sure there might be some challenges there as well, some success stories.
So I mentioned earlier that our curriculum actually starts with the integration of AI in grade 4. So we just started the Matatag curriculum. So I cannot provide you yet any result because we just rolled out the Matatag curriculum this year.
Okay, got it. And so we're actually doing the Khan Academy pilot is actually starting with the grade 4, right? So try to mapping with the Matatag curriculum as well. Hopefully there will be more updates, as we move further into this project. Another question that's quite interesting, I think it's probably a very common question as well. Is AI institutionalization in education sector intend to augment or replace the human resource, especially I guess in the teacher resource in our department? So who want to address this question?
So the question is AI intended to replace or augment educators?
Replace or augment the human resource in the education sector?
So the answer is both, actually. It depends. AI is not one thing and education is not one thing. And so is the intention of artificial intelligence to replace teachers who are central to learning processes for kids between the ages of 0 and 18? No, I don't think so. That would be a bit of a mistake on the part of humanity. Is AI intended to replace or augment where there are not enough teachers? There are not enough teachers, we know that. Yes, I think yes. So when we see industries like health, the last presentation was very interesting because health and education are often sort of bundled together, but actually the approaches here are very, very different. And in health and in law and in other professions, you see the structure of the profession differently. There's lawyers, there's doctors, there's paralegals, there's health workers, there's different layers. Education is not that segmented. It's the teacher and maybe a teaching assistant if you're lucky, but it still sort of centres around a highly qualified person, one highly qualified person often with many kids. I think that's going to change. And so more people being involved in educating children at different levels for different purposes appropriate to their qualifications, and some of those resources will also be AI. And if it's appropriate, then that's okay.
Thank you, Maria. That's always a very difficult question because the teachers feel threatened sometimes. But again, we have to really bring the teachers and the teaching faculty on board for all the various interventions, right? To make sure that we're actually helping them to improve their efficiency, not being threatened that they might be losing their jobs and be replaced by the coming deployment of AI. There's another question coming up. Is there a way an educator would know if the student submitted an AI-generated report? I know this is quite a controversy, especially in the higher education, right? And that's why some of the universities start to forbid the usage of AI. But I was talking with Javin the other day about where their position right are, and so maybe you can share a little bit of this, Javin.
Yeah, so it did come to us quite a lot. So one day, one of my postdoc come to me said, "Hey, Javin, our AI can detect the ChatGPT generated report with 99% accuracy. We can catch them if they did it." I said, "Okay, great." Then he said, "But also I figured out a way. We can provide a software that our AI and other AIs cannot detect it." I said, "Oh, right." So I say, so it's like it's a catching up game, right? So it's, but I think it's not even the point. Why do you even want to catch them? So when they are out in the work market, if they are not AI fluent, if they don't know how to use ChatGPT, they're not going to be hired. So why you have to catch them, say, oh, you did it or not, right? Maybe there's some critical things you want to, but generally you don't really want to, right? Plus, I mean, as a scientist, we can find a way that you can never catch them, or if you did it, we can catch you. So it's normally the educators, they are not the ones how to upgrade, invent new algorithms for that. The other thing I wish to touch on is when we teach about also whether the AI can replace teachers and educators. The AI would actually augment teachers, educators' ability, right? And also the teacher and the student, they have a special relationship, right? So not only in the one teacher vs massive classroom, not only that, but sometimes you have this disciple or chiller master relationship that is never going to be replaced by AI. I mean, student and AI as a chiller and the master, or disciple and the master, no, right? That is very hard to replace. And as a master, you want to see your disciples succeed, and with all your possible ways to help them, right? And with your wisdom, and those are not what actually AI can do. And the caring you can offer, right? And the friendship you can offer is not AI can offer. So it's a big difference. But there are some roles that AI can help you. So, and when we often try to help students, the first question we ask is who you want to be, who you choose and want to become, rather than what do you want to do or what do you want to have. Because often they come back with the answer, I want to have a fancy car, I have a fancy job, I want to have a fancy house, right? But that's what you have, not who you want to be. So after a while, they actually get a point, right? They start thinking about, okay, who I want to be, or what state I want to be. I want to be happy, okay? That's good to start, right? I want to be, now you're getting more becoming human rather than what I want to have, what I want to possess. And the other thing I often tell the students, if they cannot decide who they want to be, we will encourage them by default to be an entrepreneur, okay? The benefit of that is sometimes you didn't make it, right? You run a good business, nice. Even if you fail, you will end up with being a top employee because you have the mind of a boss, you have a mind of owner, and you see different things the other employee can never see. Believe it or not, right? Your boss see a lot more than you can see because the butt decides the head. So because where the vantage point they are, they will have, that would decide their point of view. So if you don't have that mentality, you will never see that, right? And you cannot even be a good employee. So students do enjoy that, and we can see the behavior change as well. So that's the stuff we try to pass on, not to pass on in the top-down way, but to share with them. And sometimes they can change it, they discover, and we learn from them too. I think that kind of student-teacher relationship will not be replaced by AI until AI becomes self-conscious and become alive, right? Maybe artificial life, then it owns its right to be a new species. Then probably could, but until then, probably not. Okay, thanks.
Thank you, Chairman. I think we talked about this in the last panel. I remember last year in the skills forum. One of the key speakers, what the key takeaways, as opposed to trying to all the ways to figure out whether they are cheating on their assignment, or we should be really thinking how we should assign, how we should assess the students' competencies, because the tools are there, they're going to be using, so I can share a data that we look at, the 2 weeks ago, because during COVID, the graphic designer, UI designer is in high demand, especially in Philippines, because all the COVID and online. And then when I look at, 2 weeks ago, I was chatting with one of my colleagues in China, And then the company actually laid off 90% of their graphic designers and UI designers. And the 10% left who actually knows very well how to utilize all the various ChatGPT tools to make the graphics and context light per there based on the company demands, and then they're replacing those. So I think it's there. So the question is, how do we prepare our students when they graduate and go out to the market? How do they, have the competencies to actually utilize those tools to, improve their own productivity? And all the competencies on creativity and critical thinking, those are the things that we know AI won't be able to easily replace the students for. So we have...
Jeff, I want to add more.
Okay.
Yeah, from Vietnam side, because you just remember one funny story from Vietnam. We just have one student, I don't want to say exactly the name of the university, but have one student do the assignment and they use AI. He's used AI, and then when he apply and submit the assignment, and the lecturers are very angry, and remove the student out of the class. Oh. And then the decision maker, the head of university, they decide to retire, reject the lecturers, because they said that the way the lecturer do with the students is not good. Yeah, but when the story we public on the media, the Vietnamese media, we have two information flow, and some agree, some disagree. And then after that, the university decide to recruit again with the lecturers. So that is one funny story, but the effects on the way we are facing with the AI effect. And I think that in Vietnam, we don't say yes or no. We don't say the replace or replace. We say that is a transformation. That means like back in around 20 years ago, when Vietnam set up the regulation to wear the helmet. And of course, the helmet production should be disappear, should be have a lot of job. Yeah, but so we can see that for the AI is the same. When the AI integrate in the life in Vietnam, so a lot of job will be no longer anymore, but we have burn a lot of job. And we just add that is just a transformation. We have two parts. And the transformation will help us to increase the quality of life of education. And the transformation will help us to give the lecturer, have a more space to do specific job, and can go deeper into the training. And have a lot of work AI cannot replace for the human, of course. So the lecturers and our job, they can focusing on this area. Instead of for other area, we can use a machine, we can use AI. Yeah, so that is the way we do in Vietnam now. In case we want to reduce that situation or that case study I just raised.
Yeah, thank you, Ms. Hao. I'm conscious of time. We have 5 minutes left, so I want to make sure that we address as many questions as possible. I will read out some of the questions. Like, for example, here, for the AI adoption in education, to be successful, do you agree that teachers should adapt first on AI and upskill themselves? I think I'll just read out. I think that's a no-brainer. It is, yes, I think we're doing a lot of efforts trying to help the teachers. And then there's another question. Oh yeah, so what are the solutions or planned solutions that the education sector has to address the identified challenges? I think that's to the ADB team. So I want to share one good news, thanks to Meryl, who is also sitting here in the room. We actually went through approval for a technical assistant on AI in education from the high-level technology fund. So we are actually planning to run a few different pilots very, very soon in the coming year with a few different countries. I think Rose shared some of those. But Rose, we want to maybe see what is the key focus after hearing the conversation. Should we rethink and the next steps, the immediate next steps that we can start to roll out to help with our countries?
Yeah, so just quickly, I think one added dimension here, aside from what we've already talked about, is really workforce development and having an intersectoral approach. After hearing Maria's keynote and Javana conversation in Australia last week, we know that the industries are already gearing up for AI transformation, but we still need millions of people to actually do those jobs that have yet to be created. And the education life cycle takes time, right? It takes give or take 15 to 18 years at least to educate a child. With AI, we might be able to accelerate that process, redefine what education looks like, which is a common thread here. So with that in mind, how do we develop workforce at scale and accelerate that and actually do it better, hopefully cheaper, faster? So I think that's a question that we will definitely have a think on. How does education play a role in making sure that the workforce in 5, 10 years, or even as early as, 2 years, can actually be ready to be AI literate so that the industries can also transform with them?
Thank you, Rose. I think that's another perspective, point of the the importance of partnerships, because ADB cannot do this on our own. The policy makers from DMCs need help. We need the collaboration with the academics and the industries. So maybe I will just give the final 3 minutes summary from Maria on hearing through all of this, and you have made your keynote looking at the industry solutions. So how we can actually capitalize on the partnership with various providers in the sector to really help build up the capacity for our DMCs going forward.
Thanks for that question. So I guess summarizing all of that would be very difficult because it's a multi-pronged conversation. I think there's a couple of key things. One is, and this leads back to the humanness. The minute you talk about new technologies, what it is to be human comes immediately to the conversation, which it should. And so the purpose of education, what is the purpose of education? And not losing the essence of that. And so, obviously there's social and civil society development, economic development as well. And I would add environmental, but that might come into social and civil. But there's very many different ways that AI as a tool, it's having a calculator moment. Do you remember when calculators first came in and, everyone still wanted you to do long division because that was cheating, right? This is the same moment in time. And so over a period of time, artificial intelligence will be used, more known, people will be more skilled. This requires education though. So in K-12, in the K-12 area, I think there's some really interesting points from the other speakers in terms of what is it really we're talking about here? It's learning how to think. It's learning about problem solving. It's being creative. It's not a replacement thing. That's important for early childhood. And so the applications of artificial intelligence have different applications, if any, at that early stages. But building the building blocks of thinking is human, and that's what we need to do. And as you move forward into higher levels of learning, then how will those individuals build better societies and contribute to economic outcomes? They need to know. They need to know about ethical considerations. They need to know all those sorts of things. That requires education, and they need to also be technically proficient, not deep technical specialists, but they need to understand it enough to question it and to be able to apply it in their jobs in the future, because that's what all the employers are looking for. AI is disrupting and changing every single industry. So every single job is going to be impacted at some point in some way or another. So we have to prepare people for this future, technically, but also on the human side, ability to question it, the ethical considerations, and so on and so on. We need both streams appropriately delivered at different points of education. And it's not just about the education system, because the education system is completely embedded into society. And I think your point here around connecting, sort of building an innovation ecosystem inside a country is incredibly important, because that connects typically technology, creativity, problem solving, economic outcomes, etc. I would say that of the 100,000 edtech solutions out there, that's not including even products of companies, which are also edtech solutions, I guess, every single one of them wants to solve education problems. The problem we have is not the technology, it's not the will, it's the ability to connect different parties to come together, problems and solutions in context and so on like that. And this is the work of ADB and other similar organisations. So, you know, there's lots in that, but I do think we should not get too wrapped up in the here and now and just sort of zoom up and have a look down at this point in time and where that's heading.
Thank you so much, Maria. Again, so right at the moment of, I think we're finishing the session right on time. We're not taking any additional minute after you. Thank you for everyone for staying until the lunchtime for the panel. Again, so this is the topic is we're not going to solve everything in the panel, but it's really a starting point for us to have additional follow-up conversations and collaborations in the following year and coming years through hopefully through the support of our TA resource we can achieve more and keep sharing those different initiatives and progress among all of us. Again, thank you again for your time and wish you a good lunch and a productive session in the afternoon as well. Thank you. Thank you. Applause to our panelists here in the session. We'll take them.
Thank you. Lunch will be served at the same place as yesterday, so multi-purpose room 1 and 2. And we'll see you back here at 2 o'clock. Good afternoon, everyone. Thank you for joining us again. Hope you had a nice lunch. I am pleased to introduce the next panel. It is called AI for Social Protection and Care. And I'm going to invite the moderator, Anand Kumar, from the Department of Human and Social Development, ADB.
Thank you so much, and good afternoon, everybody. Hope everybody had a good lunch. It's always difficult to keep morale up after a nice heavy lunch, but we will try to push through for this one. My name is Anand Kumar. I'm a human and social development, social protection specialist working with the Human and Social Development Sector Office here at ADB. As we've seen with, I think my colleagues have already explained how the umbrella of education, health, and social protection is now structured. We are the last presentation in that list. There might be some overlaps in terms of what you've heard with the health side of AI and technological interventions, because what we have here is a collection of speakers who would showcase a few innovations and experiences that they can share on the social protection and elder care side. And we've managed to put together a panel which can hopefully give that experience to you and also share some interesting country experiences. So first and foremost, without further ado, let me invite our keynote speaker for the session, Ms. Sophia Shakil, who's the Director of Human and Social Development here at ADB. Thank you.
Thank you, Anand, and good afternoon, everybody. So it's my real pleasure to welcome all of you to this really insightful session where we're going to delve into the sort of transformative power of big data and artificial intelligence in advancing social protection and elder care services. So we're like kind of standing at the cusp of a technological revolution, but it's really imperative that we harness all that the innovations that come with it responsibly to address some of our most pressing societal challenges, particularly ensuring the safety, dignity, and respectful living of our elderly population. Now, I know this is an afternoon session, so I'm going to take a brief pause for just 30 seconds from my AI-assisted generated opening remarks to just ask you one question. How many of you or your parents have been victims of online cyber fraud or manipulation? Yeah, I lost $6,000 earlier this year, and unfortunately it was a cross-border kind of thing where I was not able to recover my money. But I've also seen my mother and my mother-in-law get extremely manipulated by AI-generated videos of Imran Khan from jail, riding a horse, telling them that he's going to come out and save the country. So I've seen what it can do to elderly who are very vulnerable. We've all felt it, and I think that today we're here to really hear from experts from across Asia, on some very good examples and experiences and pilot projects that support elderly individuals through advanced monitoring systems. For example, Korea's pioneering pilot projects with SK Telecom, to Singapore's health tech advancements providing remote healthcare solutions, and back all the way here, the Philippines, where AI integration into social welfare systems is setting new benchmarks for operational efficiency and respect for the elderly. Our esteemed speakers will share their expertise on leveraging telecoms infrastructure for emergency response systems, transforming healthcare delivery through AI-powered diagnostics and patient monitoring, as well as strengthening grievance redress mechanisms within social welfare programs. These innovations are not just technological feats. They are really, really important steps that touch upon the lives of an aging population, where our aging population can then get the services that they deserve and also live with dignity and respect. So implementing AI, we're also going to hear, is not without its challenges. A significant hurdle is data privacy and security, continuous monitoring, measures to reduce the potential misuse of sensitive information. All of these, are really important pressing concerns. There's also the additional challenge of digital literacy among the elderly, which can hinder the adoption of AI-based solutions. So ensuring that these technologies are user-friendly is paramount. But as I said, despite these challenges, we have three, really good success stories that we're going to hear from today. We're going to hear from the expert presentations, followed by an engaging panel discussions. So let's engage deeply on this. Let's reflect while we're hearing the presentations. I personally am committed in the work in the team that I lead to ensure that we're ready to implement innovative solutions that prioritize the well-being of all vulnerable populations, and particularly how we can help this demographic transition that we're seeing, maintain access to the kinds of services despite the kind of changing challenges that they face. So without much further ado, I'm going to pass over to the panel. Thank you.
Thank you so much, Sophia, for those wonderful opening remarks. Okay, so we have a mixed panel for you today. We have a couple of speakers here in person, and we have a few of them joining us online. So let me first introduce the speakers we have in person here, and I request you to please join me on stage here. First and foremost, we have Mr. Changyong Lee, Product Manager at SK Telecom. Mr. Lee will share some experiences that they're piloting at SK Telecom on care services. Secondly, we have Mr. Augustus Lito Nagra. He is the Chief of Grievance Redress Division, Department of Social Welfare and Development in the Philippines. Thank you. I am not sure if we have our speakers already online. Can I please check with the technical team? Do we have our online participants already? If so, it'd be great if we can see them on screen for a second. Okay, so let me run through them in the meantime while we try to get them on the screen. We have, as part of the panel discussions, we have Ms. Janice Chia. She is the founder and managing director of Aging Asia, and Ms. Lilian Nang, co-founder and managing director of Tetsu Healthcare. Finally, we have Ms. Hyunju Jung, Senior Social Development Specialist from ADB, who will provide some reflections. To begin this session off, I think I will start with our esteemed speakers who we have here. So, Mr. Changyong Lee, if you could come forward and please deliver your presentation. Thank you.
Hello, I'm Changhyun Lee from SK Telecom. It's an honor to present at this conference. Today, I'd like to tell you how SK Telecom is contributing to social protection and elder care. Due to the time limitation, I will proceed quickly, just talking about mainly what we are focusing on. So first, I'd like to explain about the social issues that we are targeting. So South Korea will be entering a super age study by 2025. And also, especially in Korea, 1/3 of single household actually consists of elderly lives alone. So the aging population issues are broad and complicated. So we narrow it down to these 3 issues that we are aiming to address. So first one is depression and loneliness. And second one is dementia, and last one is lonely death. So for telecommunication company like SK Telecom, aging population issue means long-term decline in profits and subscriber. So for SK Telecom, addressing this issue is very essential for our company's sustainable growth. So to solve this aging society problem, we created AI care platform, which utilize our SKT AI technology to provide this care service for elderly living alone. So if you see this AI care model, we made partnership, public and private partnership with our government and also social enterprise. So governments is responsible for budget allocation and matching with users. And social enterprise operate service. And SK Telecom, we provide our AI technology and platform. So from this partnership, actually, we can make a bigger synergy effect in the end. If you see this air care platform, it shows from the bottom how SKT's AI technology can reach to the elderly. So at the top layer, you can see 3 channels we call first big data and AI speaker and AI call. So in this presentation, I like to focus on big data and AI speaker. So this shows big data based care service. At home, we collect 3 different types of data: electrical data and telecommunication data and phone data. So in terms of electrical data, we also made public-private partnership with Korean government-owned company called Korea Electrical Power Corporation. By that, actually, we can improve the result of our data analysis. So after we collect this data and we send those to big data center, at big data center, if there are any large gap between predicted data by AI and actual data, it is classified as normal events. And then the big data center send analysis result to monitoring center. So there, the operator runs 24/7 monitoring. And also they provide AI call, phone call, in-person visit to those selected users. And if you see here on the left side, there are 2 algorithm and deep learning model we used for data analysis. And the top right is the actual care app we developed, and it collects and analyzes phone activity data. And the bottom right is the actual case of dispatch service for anomaly. So next, I'd like to tell you about AI speaker-based care service. So here, if you see here, the elderly person is now interacting with AI speaker and uses various services. So here, basic service means talk and music, whether just like Google Home and Alexa provide. And specialized service is SOS and home training, and those are what we actually specifically developed for AI care service. And optionally, also we provide IoT sensor and health check sensor to the elderly person. And then we collect those user data and send those to monitoring center. So monitoring center, we mainly focus on 3 events. So emergency SOS events and negative comments events and abnormal events. And then there they send alarm information to care service. So their care manager provides psychological counseling and service guide and device guide counseling, and also in-person visit care service to the elderly. So here, this is about conversation and music service in our AI speaker. So for elderly people who live alone, by just simply having conversation with AI speaker and listening to music can significantly reduce feeling of loneliness and isolation. Actually, we did 2 research for proving this effectiveness, and by these 2 data analysis and user survey, we can prove the effectiveness. And also, this is about specialized service. So there are 2 key our specialized service. First one is SOS. In the emergency case, especially elderly cannot move at their house and there's no one nearby, then he or she can request rescue by voice to AI speaker. So in the monitor center, if the agent detected those abnormal events, and then they confirm situation and they call hospital for emergency call. Also, so far we have saved the lives over 1,000 elderly by using this SOS service. And in terms of dementia prevention gain, we developed this game collaborating with Seoul National University. And also we proved the effectiveness of this game by doing clinical research with them. I'm going to tell you about AI monitoring service in AI Speaker. So sometimes, not sometimes, quite often actually, by our experience. So elderly person, sometimes they quite often talks to AI Speaker about depression or suicide. So at Monitoring Center, we detect those kind of negative comments. We provide mental health counseling to those elderly person. And additionally, if there's any abnormal events detected in AI Speaker and health sensor, also we provide in-person visit and counseling service. So these are our achievements. We started AI Care service in 2019, and so far we have taken care of almost 21,000 elderly person, and we have made 189 partnerships. So lastly, I'd like to talk about future of AI care. So utilizing our SK Telecom's own LLM technology, in October, we are planning to launch LLM-based AI call. So we trained our LLM to provide emotional support to elderly person, and I hope this LLM provide more natural and human-like care service to those elderly person. And from our 6 years experience, what we learned is making partnership with private-public partnership is very important. And we can make that big synergy pact by making this partnership. So in the future, we hope to expand this collaboration and partnership. And before I finish my presentation, I'd like to show the actual video, short video of our LM-based AI call.
여보세요?
이창현 어르신 안녕하세요. 저는 서울시 AI 안부전화 상담사입니다. 오늘은
Yeah.
는지 안부 여쭤보려고 전화드렸어요. 이창현님 맞으시죠?
네, 맞습니다.
네, 반갑습니다. 이창현님, 어제 잠은 푹 주무셨어요?
아, 네, 잤어요.
네, 어르신 오늘 컨디션은 어떠신가요? 괜찮으신가요?
오늘 조금 괜찮은 것 같아요.
어떤 점이 괜찮으신가요? 제가 도움을 드릴 일이 있다면 말씀해 주세요.
아, 허리가 조금 덜 아파요.
허리 통증이 완화되셨다니 다행입니다. 허리 통증을 줄이기 위해 어떤 조치를 취하셨나요?
병원에서 준 약도 먹고 운동도 조금 했습니다.
아쉽지만 오늘은 전화를 이만해야 할 것 같아요. 혹시 저에게 추가로 전달하시고 싶은 말씀 있으시면 남겨주세요.
아, 네, 항상 전화해서 고마워요.
네, 오늘 통화 내용은 담당자에게 전달해 드릴게요. 오늘도 웃음 가득한 날이 되었으면 좋겠습니다. 감사합니다.
Okay, thank you. Thank you for my presentation.
Thank you, for that interesting and innovative presentation. I would definitely like to see a little bit more of that interaction. I think that's quite fascinating. Now that we've seen a solution from the private sector side, I think we'll move a little bit to the core social protection related AI integration from the public sector side. So without further ado, I call on Mr. Augustus Chief of the Grievance Redress Division, Department of Social Welfare Development at the Philippines, to deliver his part. Thank you.
Thank you, Anand. Good afternoon, everyone. On behalf of our National Program Manager, we are glad to share to you how the Department of Social Welfare and Development, specifically the Pantawid Pamilyang Pilipino Program National Program Management Office, optimizes the artificial intelligence in order to bring social service delivery to our beneficiaries. My presentation will focus mainly on one of the components of the program implementations on grievance redress. By the end of my presentation, I hope that everyone will have a better understanding on what Philippine Conditional Cash Transfer is all about and its current accomplishment, and how artificial intelligence is actually integrated into the process of CCT, especially on grievance redress, and identify potential deterrence challenges on grievance redress, and recommend some policy actions that can be pursued by various stakeholders so that we can further optimize artificial intelligence in social service delivery and, of course, along grievance management. The Pantawid Pamilyang Pilipino program, or the Philippine Conditional Cash Transfer, is in fact the largest poverty alleviation program of the Philippines. It invests on the education and health of the children to ensure that they finish college so that high school rather, so that they can be able to access a formal workforce employment to improve their welfare and at the same time contribute in breaking intergenerational poverty. In essence, when we look into the entire picture of where 4Ps really is, we are contributing into the economic and social transformation of the Philippines so that we can have a prosperous, inclusive, and resilient society. Zooming further, we contribute under social protection. Now, in order to articulate how the 4Ps contributes to social protection, the 4Ps provide support to the poor, disadvantaged, and marginalized in order for their risk on any form of individual life cycle will be addressed. Now, for the last 16 years that we have been implementing, we are confident that we have impacted countless millions of Filipinos. In fact, World Bank takes pride that the program has contributed in reduction of poverty, and also the NEDA has identified that the program is a major factor in the improvement of poverty reduction. And in the impact evaluation, we have consistently showed that we have increased the participation of children in school and in their visit to health centers. So just a short background, we are implementing in all regions in the Philippines except for one municipality, and that's in Kalayaan in Palawan. We have served this year 4.4 million households. And as you can see, if we make a demographic profile of our beneficiaries, most of them will be in the age of 16 to 14 years old and 15 to 18 years old. And we take pride on our accomplishments that we were able to have seat 32,556 college, and some of them managed to pass the board exam, top notchers, magna cum laude, and so forth. And we have seen 11 million graduated from elementary, 3.2 graduated from high school, and around 355,000 who we can confidently say they are not poor anymore. We can see that we are now on a period where technology and big data is around us. And in 4Ps, we recognize that we have to make sure we have to improve our service delivery, capitalizing and optimizing artificial intelligence. So the demand for digital transformation for the program is in fact understatement. It is a need for the program. We are recognizing that with the presence of a technology, artificial intelligence, data, big data, it is drastically impacting the lives of the Filipino, and it is redefining the narrative of the poor and also the manner through which DSWD will have to respond in order to address the recent vulnerabilities of the poor. Thus, that being said, the program is evolving, changing, and responding. Now, one of the mechanisms through which we respond to artificial intelligence or the change in our technology is in the aspect of grievance redress system. We are actually looking into we wanted to make sure that for all the complaints and the inquiries that we receive, we will make that we will use that to inform policy and policy actions. And as far as possible, we want to minimize incidents of grievance and improve beneficiary experience. In order to do that, lately, we have revised. We have been using system for longest time, but we've been doing it haphazardly, or we've been doing it. It's just a per system where we just download it from the system, then we process it, then we upload it into the system, or forms are being filled up manually. It seems like there's a gap from one system to another. That's why the development of the grievance redress workflow automation system, or new GRS, leverages on artificial intelligence and rule-based workflow engine. This time, we are now automating the interconnectivity of the different systems from the field level, from the barangay level, up the way to the national level. So as you can see in this diagram, there are so many channels through which we receive grievances. However, all of these will have to be manually encoded into the system, will have to be transmitted from one place to another, which requires transportation costs and time, and everything is manually driven. And in fact, when you look at it, it delays the manner through which we respond to the grievances and the inquiries of our beneficiaries. Now, with the new GRS, we are now optimizing the text analytics solution. We have the segregation of emails. We have the extraction of the grievances and classify it to the main grievance type, and extract specific information without the need to type it manually, and it just automatically be fed using the household ID. Now, of course, with all of this with the automation that is at hand, we are confident that we're able to address grievances at the most efficient manner. That being said, with AI in Grievance Redress Division, we are able to enhance the efficiency of managing grievances by automating case. We're able to classify those cases that are highly important, that should be resolved in 3, 7, or 20 days, and identify those that needed immediate action. Of course, it enhances transparency and accountability, where we are able to see data real time and identify areas or bottlenecks that affect the timely resolutions of our grievances. Upon identifying when we see data is not moving, we immediately reach out to our counterparts on the ground and identify what are those bottlenecks, and we immediately provide the necessary technical assistance and address the concerns. Now, as we are using artificial intelligence, as mentioned earlier, we are now able to enhance data collection and analysis. With real-time data, we can now predict what are those things that can be what are the grievances that we can receive at a particular time, and we can prepare ourselves on the number of people that we require to respond to a lot of inquiries and so forth. Of course, we're improving our reach to our beneficiaries. With artificial intelligence, we're bringing closer to our beneficiaries the platforms through which they can raise their grievances, and they can receive immediate response from us. Of course, we have streamlined the processes. But we have to understand, the poor are poor. With the use of technology, there's also a resource that we needed in order to access this platform. Of course, the digital divide and the access issues can be deterrent on further maximizing the use of artificial intelligence. And of course, as mentioned, we have issues on data privacy and security concerns, and that has needed to be looked into, especially that we're now bringing technology closer to the people. Like in the past, we've been managing the data at the central office, but still we've been exposed to data breach. But now bringing it closer to the people, there are so many entry points for data breach, which needed to be looked into. Now, lastly, on the system reliability, because we can only feed to what the AI can only respond based on what we feed into it. And if we are just having one particular type of grievance being received every now and then, should there be new grievance that will be received, it will take a lot of time for the AI to give appropriate response on the matter, or it might recommend a wrong route of resolving the matter. Having said that, despite the deterrent factor, we recognize that AI holds significant potential for optimizing the implementation of CCT in the Philippines. So that being said, it is important that the government or our policy partners will have to invest in digital infrastructure to make sure that beneficiaries in remote areas will have a better access to digital infrastructures and tools. We also need to enhance the literacy of the 4-piece beneficiary, considering that they are poor, in order for them to access this technology so that they can actually manifest or provide or reach out to the program to ask for inquiry or to raise issues that are important to them. Of course, as we are expanding the data set, the big data in 4Ps, it is important to implement a robust data protection, and monitor data bias. And lastly, we have to strengthen the grievance redress system by enhancing the efficiency, transparency, and responsiveness of the grievance redress process. In closing, we belong to the social welfare and development. The heart of 4Ps is the empowerment of the poor, disadvantaged, and vulnerable to find their voice to address the drivers of poverty. For us, the household matters. Regardless, whatever be the contributions of the artificial intelligence, we still wanted to make sure that this will be contributory in empowering the poor, vulnerable, and disadvantaged. That being said, thank you everyone. Together, let us continue to remain true and committed to the heart of the program of uplifting their well-being. Thank you very much.
Thank you, Mr. Augustus. The Philippines, as many of you might know, is one of ADB's larger social protection investments, and ADB has been supporting the 4Ps program historically. It's very interesting to see the kind of technological advancements you're integrating into the systems, and I'm sure many of us here would be interested to find out more about it over the break and the extended discussions. Thank you so much, Mr. Augustus. For the next presentation, we have a speaker online. We have Ms. Lillian Nang, co-founder and managing director, Tetsu Healthcare. Ms. Lillian, are you there? Yes. Thank you. So without further ado, I will hand over to her. She will be presenting on healthcare delivery, AI innovations in remote and in-home care. Thank you.
Thank you. Can everyone hear me? Yes. You can hear me? Right, good, right. So thank you very much for the opportunity to share. I have only 10 minutes, so I'll try to speed things along. Obviously, artificial intelligence from a patient care perspective has been, I suppose, used in many different types of use cases. So without, elaborating too much, you've already seen the use of AI quite frequently in telehealth, in remote monitoring, even in resource, right, allocation to ensure that the right people actually get sent to the types of situations that best suits them or best needs them. Of course, you've also seen quite a bit of use cases around the world on disease prediction, on AI diagnostics, and of course for personalized care plans as well. So of course in Tetsu Healthcare, we do a myriad of different aspects of AI. So our solutions actually straddles between care management systems, such as CARES, which is actually being used in the community care management space. So this is a electronic medical record, if you may, for community care providers looking after people who are being managed in their own home, or for example, in a nursing home, or perhaps in an ambulatory center, such as a rehab center or dementia daycare, right? We also have apps such as Care for Caregivers, which is being used by care staff or even the client themselves or their caregivers to help the clients that's being looked after by the service providers manage their day-to-day care. And lastly, of course, we also use AI for wound assessments, right? So this is in the area of image processing. So for today's sharing, because I only have 10 minutes, I want to put a little bit more emphasis on the wound component of it, which I think is a little bit different from what the other speakers would have been speaking about. But again, it's actually using AI throughout the entire experience of managing a person's wound or a client's wound. So maybe I just give a little bit of a background in terms of what is this product called Cares for Wounds. Firstly, it's a AI-enabled wound imaging, measurement, and monitoring tool. The idea really is that it uses AI image processing to raise productivity of a clinician or maybe even a junior nurse who's actually doing the wound assessment. So this actually improves the quality, right, of the wound assessments and management through a very evidence-based way of managing, right? And the product actually comprises two parts. One, of course, is the mobile app itself, where the AI sits, right? This is where the the nurse or the junior clinician could be actually taking a photo using their phone. Once the photo is taken, immediately measurements, right, are seen. Some simple analysis is done, and the treatment algorithm gets presented to the clinician. So even if you're not very familiar, you're going to be able to be guided through a very systematic process. And with that, all this information gets stored in the cloud, and that's where the website becomes a very powerful monitoring tool. So this is a medical device, which means that it can only be used by, I would say, clinical people. So far, it's not something that we actually allow a caregiver or the client to be able to manage on their own. But definitely, it means that we don't really need very specialized wound nurses, right, to be able to do that. So in Singapore, in various other countries, including Europe, and of course, in Brazil, this is actually already a registered medical device, yeah? Okay, so the problem we are hoping to solve, right, with this product, maybe just to kind of share the background, is obviously, as we all know, in many aspects of clinical practice, including wound management, human resource is the worst, is the biggest problem, right? So in order for us to actually have skilled workers, it takes probably, you know, a lot of training and probably also, you know, years of education. So skills training is something which, if we can't actually replicate very quickly by training that many wound nurses, could an app actually acts, right, with some intelligence, act as a guidance, act as a second pair of eyes that can see the wound and measure the wound much easier, much better. Second, of course, it also means that in an environment whereby only very senior wound nurses are allowed to do prescription, or only doctors are allowed to do certain prescription or guidance, could an app actually be allowing a more junior person to be able to assess the wound using AI and escalating for interventions only when the wound actually requires a more senior oversight? And of course, with this escalation protocol, with this app is going to be able to help a junior clinician get to the endpoint as if a senior person, a more well-trained person is next to him. Secondly, of course, how do we actually use AI, right, in this process to have portable tools whereby, such as having a mobile phone, you're going to be able to assess good guidance in terms of a wound assessment and management, such that it's so portable that just simply by a few simple steps, as simple as taking a Wi-Fi, you're going to be able to actually conduct a good wound assessment, probably comparable to somebody who have had some years of training and experience. And of course, with all these standardized reports, you're going to be able to do a lot of remote monitoring, which means that the person doing the assessment and the person monitoring, which could be thousands of miles away, could be completely different, right? So the more trained person, the person who can give the guidance, can be seated in a big city, right? Whereas a person who is actually doing the assessment could be in a remote village. As long as they access to a mobile phone, they will be able to do the assessment and have the opportunity to have all this information, all these standardized records being thrown out into the cloud and have it remotely monitored by perhaps, you know, more trained, more experienced experts. Now, lastly, of course, you know, you have the standardized ability through this kind of AI capability to auto capture all the data that's necessary to track and trend. And of course, the clinical workflow would be played out, embedded, as if you already know the steps very well. And of course, all the different guidances from treatment products, pathways, review timelines can actually be used, or rather can actually be called out simply with the mobile app. So of course, the cost and of course, the quality of care becomes much better. So of course, you can see in here, you know, we have attempted to combine within this app AI, telehealth, and of course, the mobile and web applications. And with that, we're going to be able to improve dramatically productivity, quality, connected care, and of course, we can scale this care much better. So we talked about how simply with an iPhone or a handphone, you're going to be able to take a photo and within 1 second, all the wonderful data that perhaps only a well-trained nurse would have been able to get is now at the fingertip on the phone of a junior clinician. So that in itself is very powerful. something which probably takes many years of experience for someone to be able to get to that standard. But more importantly, they do not need to do any more physical records or to do any measurement or probing of the wound, causing the client pain. So this in itself is already powerful enough. But we actually wanted to go multi-steps further. So together with a few of our co-creation partners and clinical collaborators, we've actually done a number of studies. So I think these are studies which you can see through the internet, and we can actually share the reports with you. But first and foremost, of course, it's with Tan Tock Seng Hospital in Singapore. They've actually used this app and did a measurement validation. And we have found that this validation shows a high level of accuracy for the width, the length, the area of the wound, making it a very powerful adjunct for any form of wound assessment. I think that's a very, very good study that, please feel free to actually take a look at it in the IWJ, the International Wound Journal. The second study that was done was with a health economic study that we did with St. Luke's Hospital in Singapore. So they did what I've just described earlier on, right? Where a less trained nurse, for example, in a nursing home who may not know wound care very well, actually does the assessment, right? But we have a wound expert that's seated, right? For example, in hospital, that's actually doing the management, and you can see that the improvements in the quality of care and overall cost reduction and travel time reduction as well. And of course, in Japan, we've actually done a telehealth study, right, using nurses in the University of Tokyo and also home care nurses to do something which St. Luke's also did. So obviously, all this are very good evidence-based, right, data points that shows that the workflow that I've just discussed actually does make sense. So of course, productivity, I think later on you can take a look more in details if you want the data, has been proven to work very well. And of course, again, this data that goes into the cloud is so powerful because now at our fingertips, we have all the data in terms of the types of wounds, the kind of wounds that's been infected, and that is powerful for public healthcare planning, right? In terms of knowing the details in terms of all the different types of wounds that's being managed in the community. And of course, with the value-based care, right, movement that has been coming around the world, this information now becomes something that we can generate from the system as well, because this data allows us to know who actually managed the assessment of the wound, what kind of products has been used, how long did it take, and all this then gives us a very good estimation of the amount of time, amount of money that it takes to actually manage the wound, and more importantly, optimize the way in which we can actually manage the wound, given, right, the myriad of different types of pathways that's possible. And of course, this then gives us the opportunity then throw in different types of algorithm to optimize the care. So of course, finally, we will be able to also throw in some form of a contact center that is AI assisted, i.e. having a virtual call assistant that can answer questions relating to wound management. And lastly, of course, be able to do some describing and some of this diagnostics that is actually on cloud as well. I think with this, I've used up my 10 minutes, so happy to actually share more later on in that panel. Thank you very much. Thank you.
Thank you, Ms. Lillian. I think all of you can also see the close sort of overlaps we have also what was presented in the morning session on health. I'm sure we'll get to explore a little bit more on the solutions that Ms. Lillian was mentioning during the panel discussion. So at this moment, we are through with the presentations, and we're going to spend the next couple of minutes doing a sort of panel discussion, but we have two additional speakers joining us for the panel discussion. We have Ms. Janice Chia and our own ADB's Hyunju Yoon. Both of them joining us remotely. To start off the sort of panel discussion and go a little bit more in depth, I would first request Ms. Janice to give sort of a framing around the concept of aging in place and how digital technology, what the role that digital technology and digital innovation and AI plays within that concept. Janice, on to you. Thank you.
Hi, thank you very much for the opportunity. I trust everyone can listen and hear me from afar. So thank you very much to ADB for the opportunity to share. Just as a background to the panel we are about to have, I wanted to share a bit about technology and aging from the Aging Asia's perspective, because as an ecosystem that looks at the silver economy trends, what we have seen is actually the impact of a mindset shift, because changing generations of older people are now driving changing trends in how we use technology and how we consume goods and services, and also their lifestyle. We are heading towards that 100-year life. And as scary as it sounds, the only thing we can do is to make sure we reach that 100-year life as strong as possible, with as little frailty as possible. And should we ever need care, we are able to access the care that we need. And how can we support more caregivers in future? A lot of this we'll cover later, because that's the role technology can play. But first, just share with you the mindset shift in Asian culture. We're going from a society where we look after older people as our DNA, the filial piety mindset, which is the value, and I call that the business of care, where we see a lot of people pushing someone in a wheelchair and helping them to do things. That is filial piety in its traditional sense. However, as we move to the future, this mindset shift is the modernization of filial piety, which is what we call age with laughter, and creating purpose, independence for a new generation of older people. So it's going to be that 30-year customer that we look after in future, and giving them the business of life and enablement. And that is the health longevity economy. So in the background of very expensive healthcare costs, 4 to 6% of GDPs of most countries, what can we do? What are the challenges that seniors currently face? Sedentary life, weak legs, unable to walk, chronic disease management, dementia, incontinence. These are all actually factors relating to our new modern lifestyle. In the past, in blue zones, people live long and people live healthier because of the perhaps I think the non-sedentary type of occupations. But as society got more and more affluent, our occupations are more desk-bound, and people are using more and more opportunities to withdraw from outdoor activities but doing more indoor things, and leading to an overall sedentary lifestyle and absence of exercises and social activities. So the opportunity here, how do we look at this market opportunity? We measure it at about 4.56 trillion, which is 600 million seniors in Asia Pacific. In future, how are they going to use the amount of savings that they have after the age of 60 on the consumption of goods and services, including technology? So here we have a market map that shows you an overview and where we see the biggest market potentials. Asia Pacific, of course, is huge because you have young populations that are aging, with absolute numbers of older people higher than even some of the current super aging populations. But you also have super aging countries like Taiwan, and Singapore becomes super aging by 2026. These are all amazing stats. So the new 70-year-old, the new 80-year-old, the new 90-year-old, the new 100-year-old, these are all going to help define how we prepare the market for tech adoption, because the needs that they have as they age, how they progress on their aging journey from an active person to a less active, requiring more care. But they may also go on a trajectory where I am temporarily needing more care, but after I do home care and rehab, I can get back to the wellness prehab regime again. And then after that, when my health is no good, I can go to a facility for an operation. But when I come out, I have home care services being brought into my house. I use technologies for rehab. Or for socialization and to ensure that I have a good social circle, what is the tech connection that I can have? So this is one group following the seniors trajectory. But another group that is already here is the B2B space, which is technology players talking to healthcare groups, are talking to elder care corporations, centers, nursing homes, retirement villages. Because right now, I would say the majority of the market lies in the B2B sector first, which is these large institutions that have influence over their groups of consumers, which is the seniors. And when you want a large institution to adopt your technology, there are many factors behind it, and we run surveys and write papers. And one of the biggest pain points for them is always about efficiency and staff shortage. So the technology that we deliver can help them to reduce the amount of time that is required for looking after the seniors, and then helping them to look at services that helping them to confine their staff to be able to do more things. So every staff has a very efficient technology platform that can deliver the operating requirements, but the time that they save can then be used for more human interaction. So the role of technology is very important. So today, people say, oh, how about we use robots? Robots have some roles to play. Certain things can be done by robots. Even a dishwasher is a form of a robot. But robots cannot replace human interaction. And if humans are the most expensive force, then we need to give them all the best tools. We equip them with all the best technology so that they become the best companion for older people in the organization. If companies today want to enter this technology space, how can we enter it? You have to look at working together with operators, be willing to pilot, be willing to research, and you must be willing to customize your initial ideas of what you thought that service offering could be in order to get the operator to be able to efficiently use your technology. All technologies are good, they are good, but if it's not implemented, then there's no point. You need to make sure that you are willing to work closely with the industry to do this implementation. So we've seen a lot of examples of also if people were to be reviewing the technologies and the review process and the validation process, that's all very important, because if you want your products to enter the funding channels of major governments around the region, then you have to make sure that there is a science and a research-based approach when you conduct these case studies in order to help the companies and the operators see that you are truly adding value. So just on technology innovations out there, just some photos. Like I told you, robots are always very popular, but robots are not the only thing. There's telemedicine, there's intelligence. However, if you choose to use a robot as the interface for people to see your technology behind, that's also possible. Some of these technologies that we've seen, apart from what other speakers have mentioned earlier, especially to use healthcare, home healthcare solution, we also see other things like technology wellness rehab, home motion monitoring, intelligence in elder care facilities, so that you have the smart homes, because it's not just about nursing homes. In future, it's also making every home a viable home for the senior, and then they can work with other services. So that's my sharing for my part, and thank you very much for the opportunity, and I look forward to sharing more during the panel discussion.
Thank you, Janice. Can everyone hear me? Okay. All right, so we'll move into a set of questions towards the panelists. We have time, I think, for one question each, and then we'll try and accommodate, at least take a few questions from the audience so that you get a chance also to ask your intriguing questions to our panelists. We'll start with Changyong. So in your work with SK Telecom, how do you address potential privacy concerns when implementing AI solutions that involve continuous monitoring of elderly individuals in their homes? This is, I think, a concern that sits in everybody's mind, especially when you're dealing with large amounts of personal data.
Yes. When we implement AI solution, we focus on, I think, 3 aspects to keep our user data safe. So those are users and infrastructure and also management policy. So for user, we actually get on consent face-to-face. So when we do that, we visit their house and provide enough explanation about like how we are going to use their data, and then we get consent, even though it takes a long time and we have to put lots of effort and like cost, but we prefer to do this because in-person visit is what we choose, because I think this is also important part of our care service that we provide to elderly people. And in terms of infrastructure, also we store our user data in our cloud center. SK Telecom has our own cloud center, and also we also use global top-tier firewall technology, so we are keeping their data safe. And also talking about managing policy, those data are automatically deleted after 6 months, and also designated account only can access to it. So in this way, we are addressing these potential privacy issues.
Thank you, Changyong. I'm sure our colleagues here will have further questions, especially along that line. And I hope we can try and have a few conversations during coffee, etc., to venture a little bit more into that. This is a very interesting area, also something that a lot of people are now grappling with. If I could direct my next question maybe to Lillian. Can you hear me, Lillian? Thank you. Yeah. I think in your context, so you envision AI transforming the delivery of healthcare for the elderly in rural settings. And especially, what do you see are some of the barriers for adoption, specifically when it comes to such technologies? Thank you.
Thank you. Thank you. I think one of the speakers earlier on talked about how cost sometimes is the biggest impediment, the biggest barrier, because to avail a remote, for example, a remote patient monitoring capability is not just about having a handset, right, that works. It's also about having an entire ecosystem, right, that can bring the different care providers together and some form of an intervention, right, that can eventually come to the scene when the requirement is there. So I think definitely having the infrastructure, making sure that even, for example, Wi-Fi is available, having a care team that is overseeing this clients or these patients, that in itself already takes quite a bit of investment. So on their own accord, I don't think any of these rural patients would actually be able, right, to manage this on their own. So I think that there has to be some form of a concerted effort to fund a project like this. That's one. Secondly, of course, I think it's also to do with the openness, right, of clients of this type of community to be open, right, to AI-centric kind of a remote patient monitoring or even telehealth, because fundamentally, you may not be dealing with a person all the time. So depending on the age group and the tech savviness, there might be quite a lot of that, inability for us to be able to reach out, right, to these clients and for them to get the buy-in to participate in this form of remote monitoring. So I think the second big hurdles would definitely be in terms of the acceptance, right, of a so-called target group of this nature. And I think ultimately care management or healthcare is really a people business. No matter how much we rely on AI or any form of technology to be able to reach out to the target audience, be it in a remote setting or even in an urban setting, the motivation of that person, the client, is important because very often they see themselves participating in this care because there is someone else that cares about them. And fundamentally, if we are going to be managing or implementing something that is completely AI-centric without the person centricity involved, without that motivation of another carer or group of people who actually cares about this person, it will still fail. So to me, I would summarize these three potential issues to be something that's worth thinking about. One is cost. The other one is, of course, the cost and, of course, the entire ecosystem infrastructure. Second, of course, is the openness of the persons to receive a digital way of actually managing. And thirdly, of course, not completely removing the person centricity, right, in this entire care ecosystem. So that's my input.
Thank you so much, Lillian.
Thank you.
That's very interesting.
Thank you.
Also, again, an area that ADB does quite a bit of work on in supporting aged care. And I'm sure we would have more colleagues here as well as other stakeholders who would like to discuss with you further on these areas and learn more from the interesting work that you're doing. If I may direct my next question to Mr. Augustus. The 4Ps program and the AI integration that you were attempting in the grievance redressal system, this is among the few examples of AI integration in the social protection space that we have. There is a lot of interest among other countries to attempt the integration of such technologies into their own systems, very often not supported by the technology infrastructure nor the know-how how to do so. What would you say are some of the key lessons that you have from your attempt to do so?
Thank you very much, Shannon. I think technology is really evolving, and from the perspective of program management, when things are changing around us, we had tendency to um, avoid changing our policies so that we can address operational issues. What I'm trying to say here is that the program has existed for quite a while, but there are so many things that are happening, but we are not changing the manner the manner we are doing things. And apparently because of that, we are already in a certain period that things seems overwhelming right now. But if at the time things were at the time or at the previous time it was happening and we were quite open-minded and just embrace the complexities and the dynamism of technological changes, then things could have been a lot easier right now. I'm coming from a perspective that artificial intelligence or big data is the best way really to manage a huge social protection program. And if we do not leverage on it, then definitely it will be a lot difficult for us to be prompt on the provision of services to our beneficiaries. And as well, it's kind of hard to process all of those data so that we can respond to our oversight agencies. So perhaps one important lesson really is that as things are changing around us, including the technology, we find ways on how we can adjust or we can adapt to these changes and integrate it into the way we do things rather than just ignoring these changes. And at the end of the day, when things go so fast, then it creates so much stress on the program itself to catch up. Also, since we're talking about lessons learned and social protection, I think there's so much premium that we also need to put on standardized targeting system, because if there's no such thing as a systematic way of identifying our beneficiaries, then the number of grievances will just explode. And we have to be very careful on that, because with standardized targeting system, we can be confident that we were able to select beneficiaries based on sound and objective indicators, where in the past years we have been bombarded by a lot of controversies where arbitrariness and political preferences were put on the table. But with standardized targeting, at, at the face value, it seems like there's favoritism, but when people look at it, there's like a huge percentage that we're reaching the right people. So from a perspective of grievance redress system, no matter how tedious or challenging or time consuming the process of doing standardized targeting system, it has to be done, because at the end of the day, it reduces also the job for grievance management. Thank you.
Thank you so much, Mr. Augustus. I think you really nailed that one on the head with that one particular point, that your primary duty is to deliver to your people in the quickest and most efficient way. And tools that are enabling that process, we should definitely be open to that adoption. Thank you so much for that. For the next intervention, we have our own Miss Hyunju. Can you hear me, Hyunju?
Yes, I can. Hello, everyone. Can you see me okay?
Yes.
Great. The technology is wonderful. Hello, everyone. I'm connecting. This is Hyunju. I'm connecting from China. My colleague Lanan and I were on the way to the elder care project in Xiangyang to discuss with our client on how we can improve the quality of the elder care service in the Xiangyang municipality of Hubei province. I just want to briefly touch upon the perspective that I see from the operations point of view. As you heard today, a lot of these technologies are used for directly supporting the elders and the patients and the beneficiaries, which are very, very important and effective. What we also want to see happening is that use of these technology to help the quality of the work and the streamlining of the work of the care workers. So what we are doing in Nanning province, another elder care that we have, elder care project that we have, we're trying to use the AI technology to really improve the drudgery, the repetitive work by the care workers, replacing it with the AI-based technology so that the nurses can really allocate and free up those time to really provide much needed human-to-human interaction care services. And also, we want to see a lot of these technology could also help to reduce the burden, the stress, the depression that are experienced by the care workers, both formal and informal caregivers who are directly living and also day-to-day interacting with the patients and elders themselves. So we see a lot of potential of use of this technology in improving the way we provide elder care services. And we look forward to sharing the lessons learned and the results in more of these kind of events and also knowledge sharing activities. Before I stop, I want to quickly announce that recently the project, the elder care project in Nanning, together with the Nanning Second People's Hospital, as well as our technology department, we launched the AI challenge, which means that we are inviting those technology AI-based solution holders to come and join us to provide their solutions to really make it happen and pilot through our project. We're still calling for the applicants' proposals, and it's going to end by the end of this week. And if you see this, please apply, and we look forward to working closely with you through your innovative technology. Thank you.
Thank you so much, Unju. A truly digital session, bringing you fresh input from the ground as Unju moves through her own activities there. Thank you so much, Unju, for joining us. So we have a couple of minutes now remaining in the session, and I'd like to use this time to open the floor up to the audience. I believe we have a system in place to source audience questions, so I'm going to try and move on to that and pick a few questions to ask here. Okay, so we can take, I think, two questions. I think the first question that we have here is addressed to Mr. Augustus, and this is on how does DSWD plan to use AI for grievance redress in 4Ps connect to other social protection programs like the new food stamp program? I can repeat it. How does DSW's plan to use AI for grievance redress in the 4Ps program? How is this going to also apply for other social protection programs that you have, such as the food stamp program?
Since the food stamp program is a newly established program for food poor, they also have established grievance redressing system. In fact, they copied our program operations manual in reference to managing grievances. But I want everyone to understand that we have the similar kind of procedures when it comes to grievance management. And in terms of the use of artificial intelligence, in fact, we could say that the 4Ps is way advanced compared to other programs because we have a well-established data system and we have different levels of contact points on the ground as compared to the food stamp where it's just piloting this year. So in terms of system or any kind of tools for that matter, it's a little bit manual. It's more tedious for them to process the grievances, unlike for the 4Ps where we have the well-established policies and we have those tools that we are that are available right now. And we're very, very conscious on the 3/7/20 turnaround transaction time for its resolution. But also, I wanted to emphasize that at the DSWD level, we have an integrated grievance redress where this can also be a channel for different grievances to be received. It's just a receptacle, but at the end of the day, each different program will be receiving these grievances and whatever tools, whatever be AI mechanisms that they have, that depends on the program, depending on their maturity, depending on their experiences. So the more mature a program is, the more advanced, the more AI advanced, the more big data conscious it is, but the more when it's just beginning, then it's just grappling on the ground.
Thank you so much, Mr. Augustus. I see a lot of the other questions that we received on the app are also related to sort of data segregation and data classification in the DSWD programs. I'd like to check if there are other questions on the floor here for any of our other speakers. If not, then I can move to another question for Mr. Augustus that we've received on the app. Anyone on the floor? Okay, great. I think one of the questions we've received is more on the policy regulations and on the criteria within the 4Ps program, which may not necessarily be the main topic that we're discussing at this session. So I will skip those questions for the moment. Any other final reflections and anything anyone wishes to share in their perspective with respect to what you've heard here today? Booming silence. I assume the lunch was very good. Great. All right. So with that, I think we can wrap up the session. And before I thank the participants, I'd like to call on our director, Ms. Sophia, again to deliver sort of closing reflections for the session. Sophia, please.
Wow, first of all, thank you so much to our panelists or presenters also online. You know, I think this topic is very close to my heart, as it is, I'm sure, to many of you. You know, we're all living in a society where we're facing challenges. You know, at least for many of us, we're far away from our families and our aging parents, and you know, the burden of care still remains very close to our, you know, our sense of duty and responsibility. We're also living in Asia Pacific, where, you know, a lot of society, as you know, I mean, the culture characteristic, the key feature for looking after the elderly has really been about home-based care. But we've also seen, you know, in my own work, I've worked in, you know, Hinju's now working on a lot of our projects in China in elderly care. Me and some other colleagues were involved in helping start up our engagement in the People's Republic of China in the elderly care sector. And, you know, one of the things that I still remember, I was in a municipality called Yichang, and we went to look at some neighborhoods where the, you know, concentration of a lot of, you know, the population had just aged. I mean, a lot of the young people had moved out to the bigger city, and there was a big concentration of people. And I remember visiting one housing community, and, you know, the idea was that there would be a community center built nearby. But, you know, honestly, what struck me at that time, and this is, you know, this is before a lot of the digital AI type solutions were really rolling out, which now they're all over the place. This was back in maybe 2014 or 2015, you know, so we have made a huge stride, as we've seen and heard from our esteemed presenters today. But what struck me was there was a woman standing in the window of her old dilapidated apartment building. She lived on the 7th floor or something, but she was just standing there looking down and stuff because this was all familiar territory, but she wasn't very mobile. We went to I asked if we could go and, you know, speak with her. I took the translator and some colleagues along, and she wasn't able to come down the stairs to buy her groceries. So, you know, you can just imagine the impact of isolation, the impact of not getting the right kind of nutrition, and what that means for your own sort of, you know, health, but also your cognitive development as you age when you're not getting the right nutrition. Over the years, I have seen these wonderful examples that we've heard of today that are really providing people-centric solutions. They're there. We heard today about, you know, how AI is helping to monitor health risks, providing timely interventions. You know, the wound care app, that's amazing. You know, we know of people who are diabetic, and then they get a wound and they don't know what to do, and it leads to catastrophic outcomes. We've seen today, we've heard about, you know, how the importance of people-centric solutions is so key. We cannot just rely on AI-assisted or digital technology solutions. We need to focus on people, so the human interaction is very important. I have a lot of respect for you know, the companies and the startups that are represented by our panelists today, because they're really trying to bring solutions that really touch at the daily lives of elderly and other vulnerable and rural communities. It is so important we do that. I also know from having worked in in our work in ADB, where we engage with public sector and try to strengthen public service delivery, we also know that there are challenges on how to integrate some of these innovative technologies and solutions into mainstream public sector sphere. Another set of challenges we're facing is how to incentivize more private sector collaboration to help improve, the availability of services, the affordability and accessibility. There are many good models, and we've heard about some of them today. I think today has been this session. I was not able to attend some of the earlier ones, but I know that there are a lot of interconnected sort of overlaps, because a human being, their education, their health, their access to services, it's about one person. They don't know which department, whatnot. So imagine how much more we need to do as an institution to bring more multi-sectoral approaches, to break our silos, and to start engaging much more with these innovators that are providing solutions for tomorrow. So I'll stop there, and I really want to tell you how much I was inspired, and really look forward to seeing what we can all do together. Thank you.
Thank you so much, Sophia, for those words. With that, I'd also like to take the opportunity to thank each and every one of our esteemed speakers for taking the time, for joining us here, and also sharing your innovative and wonderful experiences with us. I'm sure a lot of our colleagues have further questions for you and aspects of your work that they'd like to explore further. And I hope the breaks and the interactions that you'll have here within the ADB corridor will help some of us through that. With that, I will bring this session to a close. Thank you so much, everybody, for joining. I wish you all the very best for the rest of the day, and hope you have an interesting few sessions ahead of this. Thank you.
Thank you. Well, there's a coffee break, and we'll see you back here at 3:40.
That's why, right?
Sentiment. You guys all of them.
I think that's what that's their glamour because they were like saying when they do digital training, since they are in their respective workplace, but they cannot concentrate and there's a lot of interruptions in the team, so they can focus on what is being communicated. And I think it's really different. It's important to mention. Yeah, everyone is a little.
I know this kind of feeling is always happening in other digital government applications. So I understand. But anyway, it delayed a lot of time, so we have contact with data methods. Actually, it is beyond the contract is already completed. Yeah, yes. So I request them to support. This is very important. So they are controlling.
You have, I don't really know. There was this one time we have a new system that we developed like a few years ago, no, before UGRS. Yeah. But because of lack of training, lack of support from the management, it was never used. It was like a multi-million kind of investment. And I was like, they have a lot of discussion forever and ever where like they don't want to use it yet because it's not yet perfect. I already made my opinion in the matter that we go all out because we will never know what problem but when we figure it out together soon, that will be the best thing for us to really integrate. And one more thing, we're moving towards re-engineering and impact for us. Using the new GIS is a good model for
Definitely, yeah.
I think so.
I think among three applications, GRS is a little bit better position.
Yeah. So we have to be more vigilant to
Yeah.
I wanted to
And then I think less critical than other CVS and then bus, which is very critical. Once something happens, then it's very difficult. But GRS, there are some error processing. So once that comes. So and another one is I just wondering the relation between two. IGRS, you mentioned, and UGRS. How is it replacement or
no, it's not a replacement. Here it just receives different
interface.
Yeah, it's just an interface. Then after it receives it, the new GRS fetches the data. Then we receive it, we process it. Once it's resolved, we bring it back to the IGRM. So there's no duplication.
And then final one. I'm also supporting the food stamp program, which we are processing. So what is the plan? So they are going to use a separate GIS or they are using our old manual.
Oh, hi.
I know, but once
You're here. Okay.
yeah.
Good for private to be here.
Yeah.
Hi, I'm Claudia. Nice to meet
Nice to
you.
meet you. This project yesterday, yeah, finally. So this system currently using other so I suggested whether OpenAI ChatGPT can be integrated or replaced. We should explore that. Yeah.
So we actually did a bit of that for that's all we have now in practice. So he gets like a dashboard like once a month saying these were the exact and often they're not able to give him any insights because the data is so bad. So one, they are listening to anyone as a
Hindi ko alam sa kanila. Kala ko alam na ni Ken.
Kaya dumami na yung black nung screen. Hindi sa kanila isa lang. Nagtatest pa rin ba sila? Mukhang nagtatest sila sa likod. Sana. Sana. Kasi kanina, di ba, isa lang dito. Pag ganyan, papatayin na natin yung right screen.
Ay, ang pangit, naka-block.
Dami natin na mo. 1, 2, 3, pang 4 yung kanina. Pili ko pinapatay nila yung yung ibang panel.
Yeah. Oo nga eh. Nagtatest daw yata sila.
Sila sa likod.
Everything has had a buffer on it. The final 10 minutes anyway.
Oo.
Yeah, actually, Yumi's gonna jump straight up to the next one. All right, if everyone could be seated, please. We're about to start our last session, where we've got some amazing panelists. Can we turn the music down? All right, let me invite Tahani Iqbal on stage, who is going to introduce the panelists that we have for this last session.
Yan na yan.
Yan at todo na yan. Ay, ito sa ilalim. Pahanapin din po na yung pencil.
Okay, the music's over. Continuous speaking language. Bakit? English naman ah.
All right, welcome and good afternoon, everyone, to today's panel session on harnessing private sector collaboration for innovation in AI and development. My name is Tahani, as Soni mentioned, and I'll be your moderator for this very important session today. We've heard collaboration is key. I mean, all of the sessions for all of yesterday, even today, talked about the need for better collaboration and partnerships, and the need for a multi-stakeholder effort to drive the development of AI, and not just AI, but it is fundamental for all, the development of all digital technologies. So public and private sector collaboration is crucial for driving innovation. By combining the strengths and resources of both public and private sectors, we can accelerate technological advancement, foster economic growth, and tackle some of the most complex social, societal challenges that we face today. This is my first month, not even my first month at the ADB, so I'm also still learning. I'm also still learning about how this place works. But I do understand that, as ADB enhances its activities in the APAC region, collaborating and identifying strategic partnerships with the private sector is going to be an important area of work that we hope to build on. And so in this session, we have the privilege of hearing from three key players in the digital and AI industries, including leaders from OpenAI, Microsoft, and Amazon Web Services, or AWS. So we have Pragya Misra, who is the lead for public policy and partnerships at OpenAI. She spoke on yesterday's panel and shared a few of the AI use cases driven by OpenAI. And so as I introduce you, please make your way on stage as well. Yeah. We also have Adila Janet from Microsoft. Adila is the Director of Legal and Government Affairs for Microsoft in the Philippines and Malaysia. And as part of her role at Microsoft, she advises Microsoft for government on government and public policy issues that impact innovation and growth in the IT sector. And lastly, we have Dennis Magsaho, who is the Head of Solutions Architect for ASEAN Emerging Markets at AWS. He's based in the Philippines. So without further ado, let's dive into this engaging and important discussion. And so please welcome me, please join me in welcoming our distinguished panelists. So this is, I think, our last session for the day and our shortest session. It does not have, we don't have any presentations. Okay, sorry, Uni. We do have another session after this. But yeah, this one is a little different from all of the previous ones. No presentation, so we dive straight into a discussion. Please share any questions. Everyone knows to use the Slido and the QR code, so please send your questions in. The point of today's discussion is to explore collaborations between private sector and public institutions and how they can drive technological innovation, especially in the AI space. Highlight successful models of collaboration, what works, what hasn't worked, and for the ADB to get some key insights and takeaways on how we should go about this. And so, yeah, let me go sit down. Okay, yeah, that works now. All right, so thank you all for being here today. Let me start with Pragya. So how does the OpenAI approach, what is OpenAI's approach to scaling AI technologies for use in especially developing countries where we do work, where, as we've discussed yesterday as well, where there are infrastructure and resources that may be limited. And if you could also share a few of the examples that maybe you talked about yesterday. I know you talked about the Japanese collaboration on language services. Yeah, maybe you can elaborate on all of that. Yeah.
Yeah, no, would love to. I think before I start off, I just want to also say that, this is rare that you have more women on a panel than men. So this is amazing. Really happy and excited to talk on this panel about important things like how to collaborate. So I think just, the way we approach it, and I think I will also lean into some of my earlier roles where I was obviously playing a similar, in similar capacity of like an interlocutor between the government and the company I was working for. And I think, at least at OpenAI specifically, it's a very ecosystem kind of approach that we have. And that's simply because one, we're a startup. We're still a very small company. We're a 1.5-year-old product company, and so we're still thinking and figuring out what that looks like. But we, of course, have seen tremendous uptake and also the impact that our technologies have been making more so in this part of the world. And I can, of course, talk a lot about what it's been doing in India and South Asia more broadly. And I think many of those examples will fit in very well to what you're seeing in the Philippines and also in this part of the world. So I think ecosystem has been critical. And why so? Because you can imagine the incentives for the government sometimes is very different from the incentives that a private sector company has. And so for us, of course, our mission is building AGI for all of humanity. And like I was saying yesterday, a majority of the humanity is really in this part of the world. And so it's really, really critical for us to be here, for engage with stakeholders. The other piece that I'm seeing more and more, unlike other technologies that I've worked on, whether that was representing WhatsApp and doing work for them, or at Truecaller, which is the largest caller identification app, there's a large level of familiarity with the technology itself, because either you're using WhatsApp to chat, or you're using the caller identification app to block spam and scam calls. But with AI, somehow I feel there's a very, kind of a there is some sort of concerns on actually just downloading it and engaging with the technology. And so more often than not, I'm that person who opens my phone up and, starts to talk to our models, which then speak right back in the language, which I just did right now, with the earlier speaker. I was talking to him and everything that the model was saying was in Filipino. And he was like, okay, blown away, because I obviously don't know anything about about Filipino. But yes, the model was bridging that language gap. And I think that is where we are seeing a lot of this value getting unlocked here. And in specific sectors, in education, in health, in agriculture, we're seeing a lot of those use cases evolving very naturally. And I think very often, at least in India, I often say that, we need to build with India, for India, and really also for the world. And that's because I see that a lot in Southeast Asia more broadly, because the problems that we have are very complex. And if we're able to get through the diversity that we have in language, the diversity in culture, and also the infrastructure challenges that you spoke about, if we're able to overcome all of these aspects, we can literally take those models or take those solutions and serve and solve the problems of the world. So, that's really been broadly our approach, I would say.
Great. And yeah, if you could talk, delve a little bit into some of the specific examples
Yeah.
of what has worked, collaboration with,
Sure.
a government. Yeah.
I feel like, the specific use cases that we do well in is just access to information from complex sources. So let's say if you're looking at, the instinct is to go on a dashboard if you want an overview of what's happening on your project. But now with AI models, you have the ability to actually just ask questions and get the specific information that you want, as opposed to clicking through 5 various different clicks of your BI tool and your dashboard to really get to that last piece of information, the drill down that you really want. And I think that is really changing the way people are also making decisions, because now you get that information very soon and very quickly. And often that can be layered with real-time information as well. So you're not looking at outdated or even, a 24-hour-old piece of data. You're actually looking at real-time information. And I think that's changing a lot of things. I would also like to talk about some of the empowerment we're doing with frontline workers, whether that's with health or that's with education. Very often you have large sets of manuals that you're referring to, and we've seen that specifically in elections in India, where we are the largest democracy in the world. So you can imagine it's a massive, massive exercise each time we go into elections for the whole country, and we also have state elections. And the election officers on the ground often see some sort of a violation. They don't necessarily know what action to take if they see that violation. And so we've actually put in a lot of the training modules and manuals, which are all in PDFs and in hard copy, into our models. And today, when they see a particular violation, all they do is just ask our models that question, and they're able to take action almost immediately. So efficiencies are increasing, of course, and there's a high level of productivity, and also just being able to enroll many more election officers by the commission has also improved significantly, because really just go to market has shortened, or go to, in this case, the booth has really shortened significantly. And so I think those are some areas where we're seeing massive amount of uptake. Anything around data and overlaying with information is, I think, where we're able to do a good job. And I think just last piece around search, even working with the Indian government specifically on providing benefits. So today, if you're a person in rural India, you get access to many, many subsidies, similar to what you get in Philippines. And often what happens is you're again going through, firstly, you need to be literate. Second, you need to have a really smartphone to go through all those various websites to get to the information that you need to. But now we're trying to build an AI assistant where you're able to simply say where you're from, put out your gender, and give the specifics that the model needs in order to just give you an answer in terms of what subsidies are you actually eligible for, and then go out and get that direct benefit into your account because of just the schemes that the government has in place. And so today you don't really need to be literate in order to get the subsidy that you're looking for. And what we're also trying to scale up is, even if you don't have a smartphone, you can just call up a specific audio telephone line and get that same information. And so just bridging that massive gap and democratizing information and access to information is where we are seeing a lot of changes happening, just using our transformative
Tappings mo?
Thank you. I mean, those are very, very, very good examples, and I think there's a lot of replicability and learnings that other governments and other, I guess even private sector agencies can learn from in terms of the use cases, right? Similarly, I mean, for Microsoft, you have been around a long time. You have well-established relationships with governments. What is the approach that Microsoft typically takes? And if you can talk through some of the successful examples of your collaborations in the region, that would be really helpful. Thank you.
Thank you, Tahani, and thank you for having me here, and congratulations on having this sort of event, right? I think events like this is one of the very good initiatives that I think can really help collaborations and partnerships in this area of sort of delivering benefits in a sustainable way, right? So, okay, back to your question, what are some of Microsoft's approaches in partnering, right? So if I can try and be a bit structured about it, I'd say firstly, we'd like to collaborate broadly and widely so that the ultimate impact is meaningful and significant. And for that, I'd like to share an example of a project that we refer to as collective impact in Malaysia. And that was to do with sharing skills development to enable the general population to have that fluency in technology and digital skills, and now increasingly important in AI. And so it's how you reach all the segments of society in an inclusive way, partnering with all the different partners who have different groups of stakeholders. So for example, Microsoft would bring the content, other partners would bring the connectivity, some partners would bring the segments of population that were their specific stakeholders, and the collective impact that we have is far greater than in a single sort of initiative. So that's one of the ways that we do it. The other thing is I like what Pragya said about it's an ecosystem, right? So essentially, innovation, digital adoption, and delivering of benefits from digital technology takes place in an ecosystem. So ultimately, partnerships and collaborations we see as a way to build out that ecosystem, which means it's all the multi-stakeholders within the ecosystem, including government, other private sector partners, development institutions such as the ADB, think tanks, academia. And then the next part is it's an ecosystem because there are multiple components of the ecosystem. So one of the examples, again, I'd like to share from Malaysia, for example, when Microsoft sort of partnered with Malaysia. Well, Microsoft has been in many of these countries for a very long time, but specifically in some of our ASEAN countries, we've had recent investments. And with those, partnerships take place across the ecosystem. For example, when we invest in infrastructure, we also invest in developing the talent pool, skill sets. We invest in developing the policy and regulatory environment to enable that sort of like technology to diffuse locally. And then we also do partnerships to secure the digital ecosystem. So cybersecurity resilience, for example. Yeah, so very broadly, that's kind of the framework of how I like to think we partner.
So almost like an end-to-end collaboration where, okay.
Yeah, and it's end-to-end because of the broad range of partners rather than just a single person going end-to-end.
So the collective impact, as you said, is more significant than if Microsoft or, for example, OpenAI went out and did something on, their own. Okay. Dennis,
the fish
thank
out
you
of
so much
water.
for being here. Similarly, if you can share what AWS's approach is to
But
collaboration.
firstly, I'd like to thank ADB for giving us this opportunity. I was just walking by, I saw free pandesal, pick it up and they say, hey, you're from AWS, can you get up to stage? So there's no such thing as free pandesal, actually. Right, so in terms of the approach, it's faithful to how Amazon actually has this principle. It's working backwards from the customers themselves, right? In public sector's case, it's working backwards from the constituents that you're actually serving. So that's like the governing, I guess, principle in a sense. But we also break it down, especially in our part of the world, where if something happens, let's say in the West, in the US, it's not necessarily applicable to our part, right? So I think it was like one of the challenges is, oh wow, LLM and Gen AI and ChatGPT and like ChatGPT, there's Gemini, so things coming out, right? So it's basically language, right? So I actually more of like approach it, especially when talking to the government, in a very reserved way, in a sense that, okay, that's nice and all, but we need to check, because my countries are Thailand, Malaysia, Indonesia, Philippines, there's like different dialects, yeah. So that's going to be challenging. I know it's an exciting technology, but we look at the anti-patterns, because when customers ask me, hey, can we use Gen AI? So my question is, do you need it? What are the things that you'd want to address? Because it's don't put the, find the solution and look for a problem, right? So you really have to dig deeper into the challenges. And you know what? I've been working with government for a couple of years now. They have a lot of problems that they need to sort out. I think a week ago, I was presenting to the Department of Labor, and I was actually with Microsoft and Google, and yes, these are technologies would be helpful, especially in productivity. But the thing was, and this was mentioned in the earlier session with the SWD, for you to be able to use AI, ML, analytics, big data, the data has to be there. And the data needs to be relevant, right? So if I get a data set coming from the US or Europe or somewhere else, it's not going to churn out the right responses for you. So we look for anti-patterns and we make sure that, if we're going to go through this with the customer, the goal has to be there. I think it was mentioned, it has to be impactful. What are we trying to solve, right? And you know what? In some cases, you might not even need ML or Gen AI because it's heuristics. You don't need a model to answer 1 + 1. It could just be a simple formula, right? So, but they're so excited about the technology, which is fine. I think that drives innovation as well because there's excitement, but we have to tie that down to what we really need, because in countries like ours, the budget is very much limited. Our resources are very much limited. So we have to be very frugal on how we approach things with regards to innovations like these.
Great, thank you so much for sharing that. And so, so all of your companies do have very strong partnerships with all of these different governments. And so one of the questions that I hadn't posed was in terms of push and pull, like do governments come seeking out partnerships, or is it more driven by your own companies and the bigger picture sort of that you see in terms of technological change and innovation? Anyone wants to take a stab at that?
I'm happy to kick it off. No, that completely resonates with me about, is there a pain point you're trying to solve, or do you just want the latest bright shiny new thing? And definitely, to me, it's a responsibility of a true long-term partner to the government to ensure that your technology is being used to solve genuine problems in a sustainable, inclusive way, right? So I think I do agree there's a bit of a push-pull, because sometimes you're right, everyone wants the brightest, shiniest thing, or to make statements about how they're the best or the leading. That can be a good thing, it's a good motivating factor, but at the end of the day, is there true benefit being delivered from whatever resources that they're investing into that, right? So that, I think, is a responsibility of all the partners of a particular government or any customer or stakeholder. And so I think one of the things that we do, for example, is we understand the customer's business, and this could be a government, customer's business, pain points, what it wants to achieve, what its horizons for growth and development are, and how the technology can help them achieve that vision. So those are all very important things for people to understand before they think about how to adopt the technology to deliver what they want. Yeah, that's my view on that.
No, I could jump in here, and I think we are the shiny toy that everyone's talking about. So at this point, and so I think for me, I would say for us, it's been a lot of pull, where there has been significant amount of interest in what can our technology do to help solve those problems. But I think often in these conversations, I try and step back and understand one, to your point on what is really impact, because I think for different stakeholders, it means very different things. And so really setting out what that impact and the long-term vision looks like, because governments think mostly in years, and we often think in months. And even with our models moving so quickly, sometimes the problems where people have invested, a lot of money and a lot of time and a lot of research, often we hear get solved with just the upgraded model that gets released within 3 or 6 months. And so I think just having that insight for someone like me who's within the organization, often we're able to guide them in the directions and align the resources in directions which we know are not just going to be solved by general intelligence rising and our better models coming out, but really requires deep level of, I would say deep level of research as well, and is very contextual. And so can we really define what impact looks like? And also with governments, again, there's a constant change and churn in leadership. And so even if you get all the stakeholders around the table to align to what that goal is and what that impact looks like, you might have somebody completely different who you're talking to on the opposite side. And so I think the way I often think about is also creating short-term milestones on what win looks like, and then obviously making sure we're showcasing that around various other states or even within the central ministries, so that that acts as an impetus for many others to also replicate some of those learnings, but also replicate the model itself. Because the beautiful thing about frontier models like ChatGPT is that it has just so many use cases, and often we even don't realize the challenges that it's going to solve. We often have ecosystems or other developers or very often nonprofits coming to us saying, this is how we are using the models that you've put out. And so it's always refreshing to hear that. And I think at least in India, I can say, or the South Asia region more broadly, I think there's a high level of curiosity around this innovation. And so while maybe the top layer is reserved about just interacting with the models, you have the middle and the lower layer, which is more than excited to actually go out and push it and really see what value it can bring to them, first in their own lives, and then thinking more broadly on the department of the government that they're working in, or maybe their own constituency, or maybe their own home. How is it that this model is going to be able to unlock value? So I think people are seeing it in very different contexts. But yes, certainly there's a lot of pull in terms of what. And just to wrap this up, right? I think because the technology is new, often the questions we get asked is, you're OpenAI, this is the problem, just give us something so we can solve it, right? And I think it's often on us and our partners to sit around, brainstorm, and figure out what that path looks like, because just sticking a model in is not going to solve everything, but just making sure that we have all the guardrails, both for safety, also for responsible AI and for trustworthiness, putting all of those guardrails and really then charting out what that roadmap for the solution looks like is, I think, where a lot of the work with our partners really come in.
Add a little bit, so how that might look in terms of on the ground. What we would tend to do is maybe we partner with a government agency to run 2-day, 3-day hackathon, bring in the agencies that you think can have pain points that can be solved with this. Let's work it out of that, identify a top 3, do some POCs, move from there. And if nothing works, then nothing works, right? But that's how you find out whether there's a tangible impact to be delivered from the technology.
Got it. And would you like to respond?
Yeah, so on the question on push and pull, it's interesting because we push for something that they're not pulling for. So there's like a disconnect, right? So, and I think the same example is they're pulling for these nice shiny things, right? But we push for, you need to be more aware, education, skilling, people, processes, policies. In fact, policies, if there's something that I would want to push forward, it's not even technology. I'm going to take off my technical hat to say that I'm useless to you if I'm a technical person, because you need to fix your policies, your organization, and your people first, right? So that's where the disconnect actually comes into play, and hence agreeing with the milestones. If before, like, a government agency comes up with this multi-million or billion peso kind of opportunity, why don't we break it down into smaller chunks to really see if this is what you need? Because otherwise, there was I can't remember if it was Gartner, where there's a huge percentage of data science projects actually fail. Well, they don't have the data, they don't have the requirements, they don't have the champions, and they don't have the proper processes, right? So, and the other aspect that I would want to emphasize as well is for partnerships to actually work, you have to align on the objectives are. And this is going to be tricky. Private sector is like profit and loss business, right? But government agencies, apart from the revenue generating ones like BIR, SSS, or GSIS, most of them are mission driven. And you know how they're measured? Utilization of budget. Did you utilize the budget? Otherwise, I won't give you more. And it's interesting. You might think that's easy. Then one has the budget, one wants you to buy. Then why don't you just like match up? And it zeroes out on the ledger. But where do the constituents actually end up in that sort of scenario? It becomes a business transaction. So that's why it's very important that again, going back, what are we trying? Are we trying to help a particular set of constituents? Let's say the people in the coastal areas in the eastern seaboard of the Philippines, the fishermen, right? So trying to help them and make sure this is our target. What can they do? What are they capable of? And what do they need? And then let's see if the technology will be able to help out. If we are aligned, then that's where the partnership actually will work, right? If you're just you go in there because you just want to make a buck or you just want to spend your budget, then that's not going to fly.
Thank you. I mean, those are all very, very, very great insights. And I mean, it is clear that there are very different objectives between what government wants and also how they work, right? So the speed at which your organizations operate typically differ to how governments work. And so, yeah, based on all of your experiences partnering and collaborating with various governments, what are some of the, best practices or, recommendations in terms of how you design your collaborations? Anything that you can share that, will be useful even for us as ADB as we set out to collaborate with the private sector and sort of support our DMCs, our developing member countries.
I'll go first. And then I'm sure everyone can add on. So I do agree that ensuring that the government understands what exactly, or the customer understands exactly what they hope to achieve and exactly what the technology and capabilities can deliver. And also that for technology in particular nowadays, it's not like buying a inanimate object. So it's not one-off budget spend and then that's it. So for example, Microsoft, we're measured on utilization. There's no point you buying something and then you don't use it. Actually, that's something that's really, really frowned upon. So, I mean, that's trying to sort of recognize that there really needs to be an alignment between the two objectives, between the customer and the provider of the technology, right? So yeah, 100% agree, you need to be aligned on the objectives and the milestones. And that's a lot harder than I'm sure everybody here knows that's a lot harder than it sounds, because people change, objectives are not easy to measure because you don't have the data, and the baseline understanding, exactly to your point, the baseline understanding might not be there at all levels of the institution. For example, yes, we want to do AI. You're not even, your data is not even all standardized. Your data is not even in the cloud. You don't even keep your data in a digital format. These are all things that the decision maker level might not necessarily acknowledge, recognize, build into the project. So I don't know if that actually helped at all. I think I've more like highlighted issues rather than, yeah.
Oh, we have a lot of those.
But basically alignment, yeah.
Okay, so I'll continue on the alignment. Thank you so much. On the alignment portion, I think that's very important. And I'm happy that we have like people from policy, not just technology, who's actually present. Because for example, a good example, like Philippines, when we talk about long-term, how do you define long-term? If you ask like government, probably they'll say 6 years. Why 6? It's the term, right? It's the presidential term is 6 years, right? But on our end, that might be different. So you need to properly align because the technology will align to the direction of the government, however you look at it, right? So like for example, in the Philippines, sorry, I'm Filipino, so I use the Philippines as an example. The Philippine Development Plan, right? So it has been laid out. So that's like guidelines for us to look into. Right? And this is very interesting because last week we were in Department of Labor and I was with Microsoft, Google, and AWS. Oh, that's me. So sorry. So there's 3. I was like, who's the other one? So it's me. So and maybe the audience was like, oh, let's see what's like, who's the better cloud provider, who gives the better service. And you know what? The 3 of the speakers, we were like, they don't even know what they want. So it's like they're not even aligned to what the government wants done. But this is an interesting, I was talking to the Undersecretary of the Department of Labor and Employment. He said that, Dennis, I want this to go beyond the project. And you know how you transcend those policies? Create a paper, create a plan, make that span multiple years. You know, not just like it doesn't have to be a trend, right? It's a digital direction, it's digital transformation. Do not approach it piecewise because everything will gel together. And the only way to have that be inherited by whoever would be coming in next is, you know, would at least know what the direction is. I've seen a lot of projects in the Philippines that's funded by World Bank, UNDP, and ADB. You know, at the end of the term, the project just goes away because no one thought about sustainability because they were thinking, maybe, you know, the customer will think about putting budget to it, but it just disappears because they were like, there's no foresight into that, and without the plan, there will be no continuity on what's going to happen after 3 years or after the project. So if we are going to go through that venture, and if I'm going to go through that partnership, after of course, when we sign contract 3 years, 4 years, what happens after the 3rd year or the 4th year? That needs to be a question when asked. How do we renew? How do we transfer, et cetera, et cetera? I think those are the things that's missing.
Yeah, no, I think just to build off on alignment, because I also mentioned that in my earlier response, I find that agencies like ADB, I think, play a critical role in that. And often, you're playing the bridge between the services and the value that we as experts in the private sector provide, and really what is the government's goal. And that's because you are far more deeply embedded in the government ecosystem than we will ever be. And you also understand who are the right stakeholders, what do they need, and how do we really get to that place where we can deliver and make a project successful, which I think just by ourselves, we will not be able to do that. And so I think there's a great value that agencies like yourselves bring in. And I think so that's certainly something that I would say is a massive learning on having a bridge, like an agency like ADB or others in India, who can really help us in understanding and bridging that gap on language, because often the language we use is very different, the culture also very different from how we work and the government works. And I think those are very critical, and also the stakeholders, who are the right set of people we should be meeting and talking and bringing around the table. Because just as private sector going in, often we realize that we feel we've spoken to everyone important and we're all set to go. And then we suddenly get blindsided by this very strong, influential voice, which we hadn't even thought was a very critical player in this decision making, and we get to know much later. And I think that, again, agencies like yourselves really understand the lay of the land on that side very well. And so it often helps when there is somebody like that guiding us. I also think of the solutions more downstream and upstream. And I would say like the downstream is more around data. And so if I was to use an Indian example where, the justice system is obviously very, very complex and highly overwhelmed in India. We have cases from, it's embarrassing, but from like 50 years ago, still pending, and it just keeps going on. And it's almost as if, you file a case today, maybe your grandchild will get some sort of, outcome in that. And so how can AI play a crucial role in that? And, we worked with a nonprofit which is now looking at transcription. And so while it might seem as a very, very small plug, and how is this really going to move the needle on anything? But it is, because when you start to transcribe, you can then very quickly digitize all of the records and then upstream bring value. So, downstream, there are a lot of these small things that we're seeing happen around data sets, which is bringing a lot of change. Again, digitizing a lot of the data sets. To the earlier point, our models now, our vision models are pretty good, which is you take a picture of one of the old documents and it almost makes it machine readable. And so now you can digitize very, very quickly. And what that means is now you can leapfrog and think about what should the next set of solutions look like now that I have the data sets in place. And it also allows for many of these rural economies, or I would say rural states specifically, to now participate in this ecosystem which we're talking about. Because right now they're sitting on the fringe and saying, okay, that looks really good, but how do I really get in the game? Because there is so much of a long journey that I need to play in order to really start participating. And so I think we're trying to do a lot of the downstream work around data sets, and then also do the upstream work, which is really ask the big strategic questions on, if there is climate change, how is that going to impact food security? What is it that the average farmer on the ground then should be planting? And should he have, just one rotation or two rotations? What should those two rotations look like, keeping in mind the temperature differences? So we're trying to also work with research institutes within, the Indian ecosystem to really also answer these very, very hard questions, which don't move the needle today, but are really going to show a vision of what does 2 years, 3 years, 5 years down the line look like if we do that work today.
If I can try to redeem myself from the earlier answer, actually, I was just thinking in terms of simple answers, right? What would make a collaboration work? Having a champion or sponsor, I think that's very important. And that person who can actually drive the accountability for the deliverables, right? And I think that's where partnerships are important, because if you're accountable outside of just a single line of reporting, that can help, right? So that's why partners like the ADB are very important. Nobody wants to fail publicly, right? And I was thinking the other thing that can be quite useful is a precedent. So let's say you start with something small, then when you go to something bigger, you have a precedent to refer to, so then people get more comforted. Yeah, those are what I can think of.
Okay, great. All good insights and all valuable takeaways for us. We have 2 minutes left before the end of the session. Do we have any questions from the audience? SY?
Thank you. I have a question for the partnership between your company and ADB. So ADB is very serious about digital transformation, and in upcoming midterm review is already approved. We emphasize the importance of digital transformation as one of the key area ADB working on in next medium 5 years. And in this journey, I think a partnership with private sector, such as a big tech company, is very critical. So we just want to find a solution. What kind of partnership is most desirable? Because we are a non-profit organization, and then your company is basically looking for business opportunity, further profit. So we are a little bit different situation. So if it is just a business relation, which is simple, we have our own mechanism, procure consulting firm and procure goods and service through our procurement mechanism. But in terms of knowledge partnership, it is very tricky because we have to think about the transparency, and also we have to avoid the conflict of interest. So, but we want to work with big tech company to ramp up this our activity on digital transformation. So we have no answer currently. Just want to know from your side, what is the good motivation to work with ADB, and then what kind of partnership you are looking for?
If you keep serving the pandesal, I keep coming back to ADB.
Yeah, I think, OpenAI is a slight exception where we're not in existence because we want to make profit. And I think, therefore, we want to be able to work with you on very complex problems that require not just technical solutions, but also research. And so, as you know, OpenAI for the longest time has been a research lab. And so therefore our DNA is really deeply embedded in that sort of thinking. And while we do have now a product, we're a still very young product company. And so we still think about everything from a research lens. And so I think to some of the questions that we've been trying to solve and answer along with you in certain countries where we're trying to run pilots is mostly around that, it's not a one solution fits all, but it's more around, can we also deeply understand what is that country dealing with? What is the larger play? Can we think of a more long-term solution? And can we also then bring along academic institutes and also deep thinkers within the government, within ADB, within our organizations to all come together and sit around the table and I think solve the much bigger problems that as countries and as companies we feel we can contribute towards. So I think there is no doubt that there is a very large research angle to many of the collaborations that we're trying to drive with you. And I think the second piece is really, you have access to many countries as DMCs, and I think we can often replicate a lot of the solutions that we're seeing in one particular country, which obviously you may not be aware of, but we are, because we're in many ways powering them, to then bring that for you to think about, and then maybe some minor customizations, and that's a model or that's a solution that will work for you. And often those partners are also willing to go along with you in those countries because they too have those aspirations in actually doing that work. So I feel there's an incredible amount of opportunity both for how our models can be used internally by ADB members, which yesterday I saw ADB Genie, and I was just blown away how you're thinking about familiarizing a lot of your employees to what the various models are, and so really have been talking with your team around building evals or what else can we do around that, because that would be very helpful for us. So that's more internal. And then I think external facing, just many big problems to solve, which we want to do with you, not just from a company lens or for profit lens, but really impact and building AGI for all of humanity.
So I'll be quick. That's flashing red. So I know it keeps flashing. Okay, very quickly. I guess first of all, just wanted to make a very clear distinction, right? So companies such as Microsoft, yes, it's a company. So by law, one of the obligations is to have that obligation to return profit to the shareholders, that kind of thing. But our mission statement is to empower every person and every organization on the planet to achieve more. So basically, it's kind of an objective in terms of benefit to society and humanity, right? Rather than just limited to kind of a profit lens. And with that, going back to what I said before, we work with the whole ecosystem, right? So that's a digital ecosystem, an economy with a sort of socio-economic lens. And ultimately, what we want to do is build a sustainable business, which then means basically working with all the stakeholders in an economy, in an environment, in an ecosystem. And so to that end, I think objectives are very aligned with pretty much every stakeholder in the ecosystem. And one of the things that maybe is more specifically to your point, it doesn't answer your question exactly, but it's an example of how collaborations can be beyond just technology or just policy dialogue. I can share here, I think, one of the things we're working on is for the financial services sector, for example. Everybody right now is looking at how should I govern AI in my sector, my industry, or even horizontally within the country. So for the financial services regulators, we did have some discussions with them to kind of identify what would be some of the principles for governing AI use within your sector. But now in the next phase, we're actually working on collaborating with regulators on how they are using AI so that we develop this learning by doing. When they use AI, then they're aware of what it actually means, what some of the risks are, and that can inform how they look at their supervision and regulatory and policy making work. So that's an example of how the collaboration can be beyond just either tech use or policy debate.
Dennis, any
Okay, so
before we close, a quick one.
If I had the answer to that one, we probably have fixed a lot of problems already. So, but I guess my sort of like, this is what I tell my people anyway, right? So we're a business, right? So we profit, AWS pays for my salary, so it has to come from something. Yeah, and I don't think that can be taken away, right? But at the same time, as I've mentioned earlier, there has to be some, I know it's cheesy, but some heart to it, right? The same way that I am working in public sector, not because I just want to help like the big companies in the Philippines to like increase their revenue, because I want to make a mark that I can tell my daughter is there, by the way. I can tell my daughter, my grandchildren, if ever she has grandchildren, that I did this, and this helped, and it helped the underrepresented, right? So it's actually a fulfillment on my end, right? But then again, this is what I tell my people. Yes, we need to earn money, but there's such thing as a happy dollar and a sad dollar. A happy dollar is when a customer like pushes, I'll pay you because it's going to help me. Sad dollar is if we do like license audit and they're like, I don't want to let go of my money because you're just scamming me, right? So we aim for the happy dollar, right? Because in that case, if the customer is happy, then we're happy because they're paying us. And the money that they spent is money well spent. So we make sure that whenever we engage in any of those parts, yes, there would be investment, but up to the last cent, where does that go? Does it help our cause? Or does it like just, it goes to wastage? That has to be there, and we need to be very intentional about it. We have to be deliberate about it. Where is it going? Because if it's not going anywhere, then probably we don't need that and we don't need to pay for it. So that's just my advice. I'm a solutions architect. Whenever we come up with solutions, we don't put all the 300 plus services of AWS in your solution because it looks neat, right? There are cases you only need 1-2 service and you're good to go. And it could be free, right? So that's our job, and that's actually inherent, or it's inert to how AWS and Amazon actually looks at it. It's from the customer perspective.
Great, thank you. I know we're well over time. Really sorry about that. Pragya has a flight to catch as well. But thank you so much for your questions, for being on the panel. A lot of takeaways for us. I mean, hopefully this is not the end of our discussion in terms of collaboration, and we can have these important conversations beyond today. And so looking forward to the next session. Yeah, I think we're done here.
Thank you.
Thank you.
You're stressing me out now. Right? Yeah.
No, go ahead and please take the photo. I'm in the interest of time. I just wanted to get set the scene for the next session started. So we're going to change the gear a little bit. So this is an event within an event where we get to actually show you what the fruit of public and private partnership on knowledge looks like. So ADB, we've been working with Netflix for the past 2 years on a knowledge product on digital creative economy, and we're very excited to show think of this as a premiere of the report. We meant to launch it today. The report is currently held up on some final editing and compliance processes, but we're excited to use the Digital X ADB platform to share the findings of the report and also launch a discussion on what next, right? Okay, we've done this report and what next? So that's what the next session's about. But before we do, we also wanted to use this occasion to formalize ADB's partnership with Netflix with the signing of MOU. So, and then we'll get into the panel discussion. So, first of all, I'd like to introduce the esteemed representatives from the two organizations who will be signing the MOU today. And when I do say your name, please make your way to the stage. So I'd like to begin. So from ADB, we are honored to have Ms. Yolanda Fernandez-Lamon. She's a senior advisor to Climate Change and Sustainable Development Department. Okay. And our team belongs to the Climate Change and Sustainable Development Department, and really thank the leadership of CCSD in really helping us push through this partnership. Okay. And from Netflix, we're delighted to welcome Ms. Shangari Kirupalani, Manager of Public Policy, looking after Southeast Asia of Netflix. Okay. And it's her global team and their commitment to dedication has been really instrumental in bringing us to this moment. So Plimi, okay. Can you take a seat? Okay, so this MOU, it symbolizes a shared commitment between ADB and Netflix to combine our strengths and resources and expertise to ensure that digital creative economies, digital creative industries become a driver for bringing quality jobs and also source of soft power for the region. Okay? So it's through a partnership like this that we create meaningful change and drive progress. So, and now without further ado, I'd like to invite Ms. Yolanda Luman from ADB and Ms. Shangari to sign the MOU. Thank you, Yolanda and Shangari. And so please join me in congratulating both organizations. Okay. All right. Fantastic. Thank you, Linda. Thanks, Shangari. And thank you very much for staying put on this important occasion. Okay. Now we're ready to move on to the next part of our session. So, again, for the next, I guess, 55 minutes that we have now, we'll hear from our main consultant, Disal Consulting, who's provided us with the research and analytical rigor to put together this report. So yeah, let me first invite Ms. Ludovica De Santis. She's the report author and a project manager from Design Consulting, who will share the key findings of the report. All right.
Thank you very much.
Yeah.
Do you have a microphone that I can just carry around? Hi, everyone. Checking this works. Okay. Hi, everyone, and welcome to the presentation of this new ADB report that was produced in collaboration with Netflix. I'm Ludovica De Santis. I'm one of the lead authors of the report, and in the next 15 to 20 minutes, I'll walk you through some of the most interesting and I would say also exciting findings of our research. Before we start, let me ask you a quick question. So, do you remember when these were the only options we had to enjoy content? Well, it seemed like yesterday, but today many things have changed, and now we can enjoy music, films, games, anywhere and anytime, thanks to our smartphones. And so, as I said, many things have changed in a relatively short period of time, and I think we could all agree that all industries undergo some sort of evolution over time. But what we're claiming here is that in the case of creative industries, it wasn't just an evolution, it was a revolution. Okay, sorry, I think this is, okay. So, a revolution where as screens get bigger, possibilities for consumers, for creative professionals, for businesses, for countries as a whole expand. But sometimes change happens so fast that it almost goes unnoticed. So I'm going to give you a few examples. Did you know that Asian movies and series are already topping global streaming charts? That tourists around the world are choosing holiday destinations based on the movies they watch? Did you know that music artists are going on virtual tours inside video games? This is rapper Travis Scott performing inside Fortnite, which is one of the most popular online multiplayer games. Did you know that a single band is worth more than $3.6 billion yearly to the South Korean economy, bringing not only economic value, but also reinforcing the country's image in the international political arena? So this is BTS visiting US President Joe Biden. Last two examples. Thanks to AI, this year, a single song was released in 6 different languages at the same time. And India released its first feature film shot entirely in virtual production. What does it mean? It means no physical sets, no green screens, just LED backgrounds and game technology to activate everything. So all these examples are snapshots of a new era for the creative economy, an era where new and unprecedented opportunities are emerging from digital transformation. an era where new technologies like smartphones, cloud computing, artificial intelligence, virtual reality are giving rise to new distribution models like the app economy, like streaming services, like e-commerce and e-stores, but also to new ways of working. So today we can work from home. We can work with other professionals that are in different geographical locations. And all of this has opened up a new phase of growth for digital creative industries. So as you can see here, according to PwC estimates, in Asia and the Pacific, the cinema, gaming, and streaming sectors are expected to have double-digit growth in the next 4 years. And this, of course, has an impact on employment as well. Another study by BCG tells us that in India, for each new job created in the creative economy, 3.6 jobs, indirect jobs, are created in the wider economy. So the pie is growing. All countries, maybe inspired by the success of the Korean wave or of Bollywood, wants a bigger slice of the pie, but not many countries are ready to seize these opportunities. And this is where our report comes in. So what we really tried to do in the past year, almost, is to answer 3 key questions. Number 1, what are these new opportunities for Asian countries arising from digital transformation? What are the main barriers to development that are undermining their ability to reap these benefits? And 3, what policies could support creative industry development? So this is the report, which will be available soon. As you can see, it's divided in 3 parts that reflect the 3 questions that I've just mentioned: opportunities, barriers, and policies. And in particular, the study focuses on 3 subsectors: audiovisual, music, and gaming, and on 4 countries: India, Indonesia, Thailand, and Vietnam. As a methodology, we conducted, of course, high-level desk research, but most importantly, we spoke to almost 50 local stakeholders and experts. So let's start having a look at the key findings. Part 1, as we said, is about new opportunities from digitalization. So what are these opportunities? Number 1, the world is the limit. So streaming services have removed any physical barrier to content distribution. This means that now local creators can reach global audiences. So now the world is literally the limit. And the result of this has already been a surge in demand for Asian content. Number 2, a second chance. So in the past, if a movie flopped at the box office, that was the end of it. Now, streaming platforms are providing an alternative distribution platform that helps creators diversify and increase their revenues. And it happened already that some movies that were flops at the box office became hits on streaming. 3, investment magnet. So as demand for Asian content rises globally, more and more international players are looking to invest in the region. 2 examples here: Ubisoft, the gaming giant, opened new offices in Vietnam in the past years, or Netflix invested in more than 180 titles in 4 years only in Southeast Asia, just to give you an idea of what is happening. Point number 4 is a bit more complex. What is happening here? Value chains, content production value chains, are getting increasingly global and fragmented. So this means that a single video game or a single movie is not produced in one country only, well, let's say it might be shot in Europe, then visual effects might happen in India, and then sound mixing might happen in Thailand. So Asian countries are well positioned to take part in these global content value chains, specializing in specific value chain activities and capturing value. India, for example, as you can see here, is emerging already as a global hub for visual effects. And many international companies like Technicolor are opening offices locally. Finally, last point for the opportunities, new jobs are emerging with fancy job titles we couldn't even imagine. We have, for example, virtual production supervisor, AI artist, VR software engineer. This is it for opportunities. Let's move now to part 2, which is barriers to development. Through our research and interviews with local stakeholders, we identified 3 main clusters of barriers. The first, which we define as foundations for policy making, refers to all those institutional settings that are preventing governments from designing effective policies. The other 2, which are talent and regulatory and business environment, are more self-explanatory. But now we'll delve into each one of them individually. Let's start. So for foundations for policy making, to understand what was going on here, we asked ourselves 4 main questions. Number 1, is there a clear attribution of roles and responsibilities among government entities involved in the oversight of creative industries? 2, are countries developing effective digital creative industry strategies? 3, is there a robust data collection infrastructure to ground policymaking activity? And 4, what is the level of public-private dialogue? The main finding for all 4 dimensions is that there is room for improvement in all 4. Of course, each country is different, but general finding is that all 4 dimensions have some room for improvement. Moving to talent, 3 key findings here. Number 1, there is a general skill gap with respect to global standards and a talent shortage. So there's not enough talent to keep up with the big sector growth. In the audiovisual sector, the most sought after profiles are screenwriters and technical crews, while in gaming, there's a lack of game designers and game artists, mostly. As a second finding, we found that education institutions are struggling to keep the pace of evolution of technology. So according to local industry players, there are not enough university courses in gaming, but also in audiovisual production. And often curricula are outdated, they are too focused on theory, they lack specialization, and they are not based on a dialogue with the private sector, so they're not industry relevant. And finally, third finding related to talent is that job quality in this industry also has room for improvement. And in particular, job quality is hampered by several factors: irregular incomes, temporary contracts, long hours, long working hours, low wages, and gaps in social security. For the third cluster, which is regulatory and business environment, first finding is that, well, funding availability in general and access to credit is an issue. As you can read here, 2 out of 3 game designers regard the lack of funding as an issue, and 92% of creative economy entrepreneurs in Indonesia recur to self-financing. The last finding here regards regulation, and what was flagged by industry insiders is that there is tightening government control on content. There are some legal bottlenecks and bureaucratic hurdles that prevent processes from running smoothly, and that piracy is still regarded as a very big issue for local creators. This is it for the findings, and now we move on to the more constructive part, where we look at what policies could support creative industry development. How did we structure the work here? We started by looking at creative powerhouses, so best practices, both global and regional, both mature, but also emerging. And looking at what they've done, we derived some policy recommendation, policy lessons that can be helpful for other countries to emulate. So as you can see, the report contains 11 recommendations divided into the 3 clusters we just saw. Of course, we won't have time to look at all of them at the same, like now. So we just handpicked a few that we think are particularly relevant. First recommendation is for countries to set a clear vision and define actions to reach it. So one of the findings of part 2 was that countries lacked effective creative industry strategies. So we asked ourselves, how does an effective strategy look like? And here we found that the Spain Audiovisual Hub of Europe was a pretty good example. And so we condensed these 4 features that you read here that make a strategy effective. So 1, it sets a clear and long-term vision for the sector. 2, it develops a roadmap and concrete actions to achieve the vision. 3, it assigns clear roles and responsibilities for its implementation. 4, it defines KPIs, measurable targets, that then could be tracked for progress. The second recommendation is to develop a robust data collection infrastructure. Here, a good example is offered by the UK. The UK does well 3 things. First, it has official government statistics for the sector. Second, it has monitoring and evaluation framework to track the progress of the implementation of its strategy across specific KPIs. And third, it also commissions research or sector reviews to specialized bodies, like, for example, the British Film Institute. The third recommendation, which is now related to talent development, is to, when reforming the education system, to set policies that focus on continuous learning. So up until now, we've always thought of education as a specific moment in time that happens before work. In a world that is constantly evolving, where standards are changing at a very fast pace, we need to shift this idea and move to a system that encourages continuous learning so that workers can keep up with technology and stay competitive. The fourth recommendation instead focuses on encouraging private sector-led training. A good example here is offered by Singapore. As many countries, Singapore offers content grants, so funding for creative projects. But what is really peculiar and unique about these content grants is that they are conditional on hiring Singaporean talent. So I'll give you the money if you take to work with you 10 or 20 Singaporean workers. And this, of course, helps local workers upskill Last two recommendations, we have funding, bridge the financing gap through the creation of structured funding facilities. Again, a few examples. Canada offers content grants, Spain offers credit guarantees, so it doesn't finance directly, but creators, when they go to the bank and ask for loans, they can get a state guarantee on these loans. And while KOCA, the Korean creative government agency, offers content value assessments. So there are these third-party entities that assess content quality, like the proposal, for example, for a movie, so that creators can bring that to the bank and saying like, look, my content has potential and it's been analyzed by a third-party entity, give me the money. Finally, incentives. So encouraging domestic and foreign investment through incentives. There's been a study in the UK that showed how effective incentives are in increasing production spending, improving the skill level of crews, boosting employment, and generating a high return on investment. And not all countries that we have analyzed have incentives in place. So of course, this is a very effective way to set the wheel in motion. This is it from my side. Thank you very much for listening, and I give back the floor to Yuni.
Thank you, Ludo. Yeah, 20 minutes is not enough to do justice the work that Ludo and Disal Consulting, as well as countless number of ADB staff and our knowledge partner Netflix has put in. So in order to bring more color to the report findings, we're very excited to bring in a line of panelists who were all involved in creating this report. So as I introduce you, great if you can make your way up to the stage. So first, let me invite Ms. Shangari Kirupalini from Netflix. Please join us in welcoming our panelists. And from the Philippines, we have Mr. Basil Andres, Program Manager for Research, Planning and Policy at Department of Trade and Industry, Creative Industries Development Office. So we're very excited to have you, Mr. Andres. And Mr. Sipto Adiguno, okay, President of the Indonesian Game Association and Chief Strategy Officer of Agate. Okay, please take a seat. Please take a seat. I'm not going to do justice to the dynamic and enriching experience that they've had. So I'm going to ask the panelists to introduce their own, introduce themselves and their experience. But as you can see, we've brought in a diverse perspective, again, that the report was trying to contain, which is really the private sector perspective, as well as some of the global players and a government that's been working hard on driving digital creative industry as a as a competitive edge of the country. So let me join you here to start the panel discussion. And in case you don't know, my name is Yuni Zhang, and I'm part of ADB's team, one of the project leads of this report. Okay, all right. So welcome to ADB. So let me start with the first round of question, which really focuses on the opportunities, right? The key takeaway of the report was really the impact of digital transformation has had on key creative industries, from the way it was produced, distributed, and consumed, which unlocked new opportunities for the sectors as well as for the country, right? But what does that look like for you, right? As a country, as an industry, as a company, and as a professional who's worked on it, right? So if you can unpack that and provide some examples, that would be great. So what are the most significant opportunities that you see from where you're situated, and how can we, or where you are seated, how or you can best capitalize on them. So can I start with you, Ms. Shankari?
Thank you so much for the question, and thank you so much as well to ADB for organizing such a great event. Here at Netflix, we do partner with industry associations, government entities, and also institutions such as the ADB to try to further research around the creative communities. And we're really honored to be a knowledge partner for this study and look forward to the partnership, I guess, growing over the next few years as well. But to answer your question specifically around the opportunities is that I think the report already, I think, kind of highlights that the creative industries has got an immense amount of multiplier effect that has both a direct and indirect impact on the economy through job creation. And we see a lot of potential for the creative industries to kind of continue to thrive, especially in this part of the world, because of the fact that when you compare it to perhaps like Hollywood, we're still very much so in the evolving space. And what that means is that there's nowhere else but up. The sky is the limit. And therein lies, I guess, the opportunities. But what I think specifically Netflix sees as the key opportunity for this sector is the globalization of local stories. And what do we mean by that? Is the idea to create really, really locally relevant content that is then able to travel across the globe. So let me give you an example. So here in the Philippines, we recently launched a movie called Lolo and the Kid. It's a Netflix movie. It's done entirely in a local language. And for those who haven't watched it, please do. I am not saying that because I work for Netflix, but it's genuinely a beautiful movie about an older hustler who then takes on a kid, and then they kind of do Con X together. So what's really beautiful about this particular example is that this movie did really well, not just in Philippines for us, but also globally. In fact, it was one of our top performing non-English titles across the globe. So people from like Venezuela, Argentina were all watching Filipino content. Something that digitalization, without digitalization or streaming platforms like Netflix, it would have happened before. So I guess this is what we see as the growing potential of the ability to create really local relevant stories that captures the imagination of audiences beyond the borders.
I just want to say that the report looks really, really good. Like, and when Ludo was explaining about it, I realized that I'm very happy that a lot of other countries are having the same problems as mine. So it's great. I feel like this is not just specifically in games or in Indonesia. But answering the question about opportunity, I think the biggest opportunity that I've seen is the globalization of creative industries nowadays, empowered by these new technologies. Back then, especially in games, just a few decades ago, to play games, it's very logistically difficult. You know? The games are produced in certain countries, mainly like the US or Japan, where you have to manufacture these discs or these cassettes specifically there. And then only there you can distribute the consoles, the arcade machines. And it's not too long ago when we moved almost like very quickly into these smartphones that we have in our pockets. It's mainly maybe just 10 years ago when it starts like video games started going into mobiles. So in this opportunity, I think there's this potential of, like said before, like stories and games to be easily distributed all over the world. And there's economic opportunities as well. 70% of in Indonesia, and I think in other gaming companies as well, 70% of the expenses is actually from human resources cost, not from tools, not from softwares, it's from human expenses. So in that case, countries that should have the advantage of human cost should have this big opportunity to be able to sell worldwide, especially, of course, in Southeast Asia as well. So I think that's the largest opportunities we've seen. And in games, we see that happening as well. Stories from all over the world have found their audience in places they never thought they would hit. You know? So, yeah.
Thank you very much. So for the government's perspective, just to introduce to you all, so I'm Basil Indres from the Creative Industries Office. It's just a new office actually. After the law, after it lapsed into law, the Philippine Creative Industries Development Act, very government words, RA 11904. We were created actually. So the office was just officially created last April this year. But we've been already supporting the creative industries through various efforts of the Department of Trade and Industry. And yeah, so going back to your question of opportunities, it opened doors to a lot of industries, specifically the digital creative industries. And of course, as you know, trade ministry, we welcome competition and we encourage innovation. So for the digital creative sector, it enabled them to access various markets globally without the traditional ways of accessing, you know, markets. As mentioned, the content that was playing or that was popular in South America, even before it already is, Philippine content has been, you know, selling in South America, but now it just proves that there is potential in those markets, and that Philippine content has, you know, could go a long way. The government recognizes, of course, the contribution of the creative industries. We actually have a partnership with the Philippine Statistics Authority to help us measure the contribution of the creative industries. They had actually provided a preliminary report for 2023, wherein they found out that 7.1% of the total Philippine GDP was because of the Philippine creative industries. So so that's preliminary. We're still working together with, it's a long process, but we're seeing the light at the end of the tunnel. We're just an update currently. We're identifying or working together with the Statistics Authority and assessing the creativity of the classifications for, yeah, of the Statistics Authority. Yeah, thank you.
Yeah, I forgot to mention, so Indonesia and Philippines are some of the few countries where there has been a strong policy focus. Indonesia has a Ministry of Digital Economy, and we've seen some strong push from DTI to really ensure that the creativity of the Filipinos that we all know and appreciate is globalized and appreciated. So I think there's been Creative Economy Month event happening since last year. And DTI has been a strong partner of ADB across different projects. And we're looking to fold the digital creative industries and support into the ongoing projects as well.
Thank you very much, Uni. Just to add,
Mm.
yes, September is the Philippine Creative Industries Month, and I just want to promote that to everyone here and to your friends, please. I encourage everyone to visit various activities. We've partnered with various organizations to co-brand their activities in line with the Philippine Creative Industries Month. So hashtag We Are a Creative Nation.
Thanks for that plug. Okay, Ludo.
Very nice. So I would like to take this short space I have to stress another great opportunity that creative industries present. This is also in the report, but I didn't have time, of course, to cover it, which is synergies. So as technology evolves, all creative sectors are getting increasingly linked to one another. And there are a lot of different kinds of synergies. Synergies means that if you invest in one and the sector grows, then you also stimulate growth on other sectors. One type of synergy is, for example, technology synergies. I'll give you an example. Game engines, which is the technology that is used to develop games, is now shaping the future of cinema because it's the key technology being used in virtual production. Another type of synergy is the
what we call the cross-pollination of IP, of intellectual property. And what does it mean? What does it mean? It means that there's the possibility to exploit the same intellectual property, so the same brand, the same stories, characters, environments across multiple medias. So if you think of Pokemon, for example, which is the largest media franchise in the world, Pokemon started as a video game and then evolved into movies, card games, comics, and so on. So really giving creators the possibility to develop these stories, these characters, is not only that, it's not something that will only benefit one sectors, but will have like a domino effect on a lot of other creative and non-creative sectors too.
Thanks, Ludo. And that really is an important point. I'm sure a lot of us are guilty of watching K-drama when we're down, and a lot of which came from webtoons originally. And that's just one example of cross-pollination that we see. And again, the platform really enables this multiply effect, whether it's at a horizontal level or jumping physical barriers as well. Okay, now that we've talked about the opportunity that's presented to us, right? I want to delve into the challenges, right? Something that keeps you at night, or something that you really wish that ADB, government, or partners that you meet here would work on together, right? So can I start with you, Shangari?
Sure. So I think with great opportunities also comes even greater challenges, unfortunately. And I think from Netflix's perspective, at least, is that, and it's something that we encounter on the ground as well, is the issue around the labor shortage and a mismatch of skills. So we at Netflix, we don't actually, when we say we produce local content, it's not done in-house. What we do is that we actually identify local partners and local studios across different parts of Southeast Asia, and then we begin to basically work with them to produce content. So what this means is that our slate in our content is only going to be as strong as our local partners on the ground. And what we've come to notice is that across different parts of Southeast Asia, there seems to be more often than not either a skills mismatch or a complete skills shortage, especially in the post-production phase. I'll give you an example. So we've recently about to launch a movie in Indonesia. It's called Shadow Strays. It's a horror, action, thriller, everything in one. And it's locally produced, it's done by local directors, local scriptwriters, etc. But then the editing of the video, where it kind of needed a little bit more like video special effects, etc., the talent in Indonesia wasn't able to do it in a way that was up to perhaps Netflix's standard. And therefore, we had to basically then work with our partners in Thailand instead to be able to do it there. So what this shows is, of course, opportunity for Indonesia to kind of grow in this space, but at the same time, it also kind of demonstrates how then potential work and the multiply effect that we discussed earlier is then taken away from Indonesia to more mature markets in the region instead. So I think that's one of the key challenges that we see for us, at least in Southeast Asia.
Yeah.
That about the talent shortage in Indonesia.
That's absolutely true. I see that happening in Indonesia, not just in movies or cinema, but also in games. We find that games in Indonesia has found their certain market, bringing this, lately in the past few years, Indonesian game developers have managed to find a balance between bringing local content and making it globally understandable. Like instead of focusing on our very national heritage, like batik, for example, that a lot of people don't understand, we focus on coffee, for example, which people like. I drink coffee every day, probably everybody here. So, but anyway, so that's very, very true, the lack of skill mismatch. And I think it's also very true in the report that we used to see that after a series of education, people would be not anymore the case. This, especially in creative industry, and maybe because particularly in games, is very close with technology. By the time students finish their education, the technology has moved on. We've moved into a different engine. We've moved to different ways of designing games and making art nowadays also, of course. there's also AI and also other tools, that the knowledge that these students gain from their education is already obsolete by the time they go out of college or university. So I think the new format of learning as you go and continuous learning is very spot on, and integrating actual work into education is more crucial than ever. That's what we're seeing, that again, most of the cost in making a game, and maybe this is also true for other creative industries, is on the human cost. Now with the democratization of tools and software everybody can access, it's very easy to, back then you need to, a few years ago, you need to purchase like an expensive set of computers to actually make games. But nowadays you can actually do it in a $200 laptop. It's very easy, it's very accessible. But then the key is just competing between these creative talents. It becomes like an industry where the only point or the only key advantage you have is your creativity, which is great. We're just creative industry and we're competing on creativity. But then our people, or in Indonesia at least, and maybe also in Southeast Asia, are not prepared for that. We are not educated to be, to follow the trends, or to be able to go with the new technologies and learn how to compete. So I think that's the biggest challenge. Not to mention the other two, which is like governments not being, not actually being consistent with what they do. It became a meme in the Southeast Asia, Indonesia. Our creative economy ministry, it used to be, became one with the tourism ministry, and then it split, and then it came back again, and probably in a month it will split again. Please don't follow this. But yeah, but I think the biggest issue is the skill mismatch in the talents.
Okay, barriers. There are a lot, but we're trying to, of course, in the government we find ways to assist. That's why first PCDA was created, and the office, creative office, is here to assist the creatives. But yeah, based on our observation, we've identified various barriers. So I agree with the labor skills mismatch, but on our end, we've developed various Philippine skills framework publications. So the industry will be able to adopt to the changing times of the industry, and then the creative industries and its dynamic nature. Next, perhaps, would be the distribution. Of course, the value chain. Philippines has been very popular or known for its production side of animation, game development, maybe films. But we are still exploring or gauging or finding ways to, so we'll have our own content similar to Indonesia, and of course distribute them as well. So that's for the value chain. And then another one perhaps would be financing, of course, access to finance. It has also, it's been what do you call this? I have been in discussions with different stakeholders already, and especially with content, it's very difficult to evaluate them. Although, of course, in Korea, you have already established framework structure, but other traditional financing institutions, especially in the context of the Philippines, still don't understand the importance or how to evaluate IP. There are a lot of creators wherein their creations have potential to go global, but they have no access to those financing schemes. So those are the three barriers I think that they're facing right now.
On my side, I take the opportunity to add on the last point that Basil mentioned about funding, and why, for me at least, I think is one of the key elements. So be it with game developers or with movie producers, the story I've been hearing a lot is that given the absence of like government funding, what stakeholders need to do is recur to self-financing. So they put their own capital to fund their projects. In case they're able to get a bank loan, they have to put their own properties, like their houses, as collateral. So the implication of this is that if the project isn't a success, they'll end up losing everything, basically. And this is a problem also because creative industries need experimentation, you know? Like as startups, they need to have room for experimenting, trying, and also failing to some extent. You know? They say fail fast, fail forward. And without a structured funding facility, this is just not possible. So creative possibilities are really limited.
Thank you. And I don't think we have an answer as to how we will change the finance system to understand the value of creativity, but perhaps just in the context of a bigger event, right? We do know creativity of human is what is going to sustain us for the next years. So perhaps it's a good time for us to really rethink, as a country, as a company, as individuals. This is one area that we do need to preserve, whether it's for cultural values, for economic growth, or for social cohesion, or even for to produce quality jobs, and then also to put the country on the map, in the mind share of the world. It is an important sector, and we're seeing the recognition of the importance across different countries in Asia, and who've been very successful at it. So I think a lot of work to be done for us to really change the framework, how we view creative industries. But I think we're on a really good start. So on that note, last round of questions, promise, because we do need to end on a high note. We can't end on a challenges, right? So I'm going to give you a very important task of giving us recommendations, policy recommendations. Okay, again, from where you stand, and so for. And for Shankari, because Netflix is a global player and you do a lot, perhaps you can share a bit about the role of the private sector in driving this collective growth in creative industries as well.
No pressure. So I think everyone has got, I think, a responsibility in trying to advance the entire ecosystem collectively, and there's no exception for the private sector either. So here at Netflix, I think we try to ensure and try to promote the long-term growth of the industry to two key kind of set of trainings that we do. The first is conducting trainings for folks that are already in the industry to ensure that they kind of can continue to keep up with technological trends. Something they've also kind of mentioned that when folks are graduate from university, it's done already, it's changed. So how do you kind of like keep abreast with these kind of changes? And the second way that we kind of do trainings is to kind of promote and do trainings for more underserved aspiring artists. So I'll just give you a few examples. So with the first set of trainings, for example, we recently did a closed-door workshop for top editors in Thailand in June this year, where our content team kind of organized our closed-door event, and these editors obviously got a chance to network, but beyond that, we also had an information sharing session on what are the latest tools that they can use to edit different kind of media files, how do you compress them, and what does it mean to basically add then different video special effects as well. This is one of the many kind of trainings that we do in Thailand and in different parts of Southeast Asia. The second set of trainings in terms of empowering aspiring artists. So at Netflix, we do something called, it's quite a mouthful, it's called the Netflix Fund for Creative Equity. It's a $100 million fund that we are dispensing over a period of 5 years, including in countries like in APAC. The objective of this fund is to try to identify underserved or underrepresented communities that are participating at different parts of the production cycle, and then try to empower them through trainings or workshops consistently as well. So we did one very recently here in the Philippines. It's called In the Genius, whereby it was a public call out for aspiring filmmakers to submit stories, and they got to then pitch their ideas to actual like directors and then refine the stories accordingly. We've done something similar in Thailand. It's called Real Life Camp, REEL, whereby again aspiring film directors could come in, meet with real life directors, and also get a chance to understand and familiarize themselves with equipments that Netflix uses on set as well, because that constantly changes. And we've got many other trainings happening in India and Vietnam as well. But happy to share more in person. I'm just conscious of time. But I think that this is an example of how the private sector is able to work hand in hand with local communities and stakeholders to try to build a solid foundation and try to addressing the skills gap that we spoke about earlier. And in doing so, trying to ensure the longevity of the sector as well.
And Sipta, probably, perhaps you can have perspective as an industry association, someone who leads an industry association that acts as a bridge, but also as an owner of a game company. Yeah. We all want to hear from you.
All right. Yeah. I believe that as an industry and also as private sector, we should take active part in growing the industry. I mean, clearly, as private sector and as an owner of a company as well, we are a for-profit company, right? But it just, if we always think about ourselves only and not help or actively participate in moving the industry forward, it doesn't go anywhere. Like when the tide rises, everybody rises together. And that's the case with Indonesia. Again, I've told you about how the Ministry of Creative Economy like changes shape every 5 years. But also like in merely like 3 years ago, or actually merely 1 year ago, games was under 3 different ministries, which is Ministry of Creative Industries, Ministry of Communications and Technology, and also the Ministry of Investment and Maritime. And that's the one ministry, Maritime and Investments. So these 3 are supporting games in their own ways, not working together. But with the private sector combining together in an association, we can be the voice of telling the government what to do, what we need, where are we currently in the talent scene, what data we don't have, what do we know. So these, I think these, it's unfair for the industry or private sectors to ask the government to understand these things without us being actively involved in this. Because we, as the private sector, we are the business people, we should know the best. What is going on, what we need, what the industry needs, what are our problems, how much, for example, does it cost to create one movie or one series or one game, which can range between like a casual game to a AAA $100 million blockbusters. So we, as business owners, as industry associations, we should know the best, and therefore we should use this knowledge to move the whole industry forward, not keep it to ourselves. I think that's and this is saying this as a for-profit organization. There's also for our own benefit, you know. Without, like, if we just focus on growing ourselves as an actual like sustainable business, it works, but it's very difficult to grow. We should grow together. In the creative industry, again, like what Ludo said, there's a lot of synergies between our own, like our own creative industry, like for example, between game companies and also outside of the subsector, for example, games and movies or games and music, for example. So I think that would be my input, is that for private sectors and associations to take an active part in driving this whole industry forward.
Okay, for the government, I believe it's continuous engagement and dialogue. the government is here to, of course, listen and take action. But of course, it's hard to take action if you're not familiar with the landscape of what they're requesting, to take action on. But yeah, continuous dialogue is one of the ways that we actually encouraging. On the Creative Industries Office, actually, we have concluded already or finalized the Philippine Creative Industries Development Plan, aligned with the Philippine Development Plan and all other plans. Although this is still for approval of the president, but it already consolidates the various efforts of different government agencies to assist that are, extending assistance to the creative industries. So that plan provides a framework for the industry to move forward and reach the goal of Philippines' goal of Asia's premier creative hub by 2030. We have 5 pillars in that outlined in that plan, which we call beams. In the government, of course, we like abbreviations. B, for building creative ecosystems. E, empowering creative workforce. A, accelerating inclusive innovation. M, mobilizing financial support. And S, seizing global markets. There you go. So yeah, so the government is here, and of course we have various initiatives, of course, in assisting our different creative industries. As outlined in the law, we have 9 domains, and we have 72 sectors under that domain. So actually, what Ludo mentioned earlier, in that plan we clustered the different sectors, so we will have the impact of the efforts that we do would trickle or will have a wave chain effect in various sectors connected to it. So yeah, I think that's it on the government side. Thank you.
I can see that you've already started on some of the recommendations, having a clear national strategies, ways to measure by clustering. And did I also see a recent news that there is a cross-border collaboration between the Philippines and Indonesia in promoting digital creative industry or creative economy, where digital is a big part?
Actually, that's one of the efforts. Currently, Philippines and Indonesia Ministry of Trade and Creative Economy, apologies. Indonesia's Ministry of Tourism and Creative Economy and the Department of Trade and Industry signed an agreement, memorandum of understanding, in 2022, if I'm not mistaken. And recently, we just concluded a roundtable for Philippines-Indonesia Creative Economy Roundtable. And we've, of course, discussed various collaboration efforts in strengthening both countries' creative industries. Yeah.
All great progress. And again, we're looking forward to supporting Philippines, and hopefully we'll find a way to rope Indonesia in there as well. And moving forward. Ludo, you have the last word.
The last word. So as a concluding point, I wanted to mention one specific fact, which is that from our analysis, what we observe is that creative powerhouses, countries like South Korea, for example, or the UK, what really makes the difference, I think, is having well-rounded, holistic approaches. So not just a series of initiatives, some from the government, some from the private sector, but having a unified vision of where the industry should go and working simultaneously on different enablers of growth. So working on talent, on everything we mentioned here in this discussion, working on talent, on funding, on improving and easing off regulation. And at the end of the day, I think that it's this 360-degree approach that makes the difference.
Thank you. So that concludes the panel discussion. Would you join me in thanking the panelists for exciting dialogue we've just had? Okay, thank you. Thank you. And everybody who's been staying put to listen and participate in the final session deserves some drinks and food, which is hosted by Netflix and ADB. I believe we'll be in mezzanine space near Staff Hub, and I think there are ushers outside who will take us there. So please, since you've stayed this long and there's no point in trying to beat the traffic at this time, please stay and join us for the networking and cocktail reception afterward. But thank you very much. This concludes this day 2 of Digital X ADB, and we'll be back with more sessions tomorrow. Thank you.